you are holding on to that dream. You have a choice today to go up or stay down. Now is the time to take the first step to the top. With quality review materials that produce born top-notchers and thousands of board passers across professions.
Today, let's discuss
In dynamic, innovative, and interactive review delivery. Ensuring an excellent, balanced, relevant, and comprehensive review experience. Extending support beyond review and celebrating victories together as one family. What you choose today determines your success, so make that powerful decision.
Welcome to the top.
Choose to be the top with Top Rank.
So one thing na na-help sa akin ng Top Rank talaga is that confidence. Nung pumasok ko, yun talaga yung hinahanap ko sa Top Rank eh. Kasi I always question myself. And yun yung nagiging breaking point ko lagi. Imagine all those exams na every time na sobrang hirap, you try even harder. Tapos next exam, mas mahirap ulit. So you try harder again. So by the time na magpi-PNLE na, parang, okay, give it to me, I can do it.
Very holistic po sila approach. Hindi lang po mentally, ano rin po sila sa physically, spiritually, and emotionally po. Tulad po sa stress management na po.
Sa Top Rank kasi, na-realize ko, there's so much more to learn. Every single day na nakaupo ko sa harap ng lecturers sa Top Rank, they've given me knowledge na nakuha nila from their experiences as nurse. Iba kasi yung Top Rank, parang pag naririnig ko siya, very welcoming. Tapos yung lecturers, very engaging sa students. And then, ayun, parang everybody really cared na kailangan makapasa tayo. Nagmo-motivate kami sa isa't isa. And then, ayun, basta pag Top Rank, iba talaga siya. As in, ibang level. So, never ako nag-regret na nag-Top Rank.
Naniniwala po ako na lahat ng student may potential. Top Rank was there to harness me to the fullest extent of my abilities. From giving me top-notch lecturers, top-notch materials, environment, it never came short of providing me what is the best there is for me to improve myself and to help me achieve this goal.
Top Rank po kasi mag-e-enjoy ka talaga. Ang naging review ko po sa Top Rank is fun, enjoyable, habang natututo ka ng maraming learnings. So, minsan gigising ako in the morning, parang tinatamad ako, bad trip ako, ganyan. Then, ma-realize ko, ay teka, funny yung prof ko ah. Parang gusto ko ma-enjoy tong araw na to. So, ang gagawin ko, papasok po ako ng Top Rank. Then, uuwi ako, good vibes na ako. Ang dami ko pang natutunan.
Out of everyone na nag-take ng board exam, ako po yung
top 1. Hindi pa rin po nagsisink in totally. Bali yung mom ko po yung pinaka-inspiration ko po. Kasi siya po yung reason kung bakit gusto ko po maging successful.
Sobrang proud ako na hindi ko ma-express yung feelings ko kung ano yun. Na hindi nga, that night hindi ako nakatulog. Pero ngayon, the same pa rin, para pa rin akong naka-float. Kala ko sa TV ko lang mapapanood na naranasan ko pala ngayon na kahit sa kabila ng mga experience mo ng mga hardships, meron din pala talagang hope na pwede kang mag-top of all.
Thank you po.
Ha?
Thank you. Hindi ko po din akalain na magta-top 1 ako, pero sa tulong po ng top rank, nakamit ko po.
Dear Lord, we thank you for the gift of life today. You allow us to have another day to praise you and see your glory. Thank you for the love and protection, especially this time of pandemic. Bless us, Father, with your wisdom as we begin our class. Help us to focus our hearts and minds on what we are about to learn. Inspire us by your Holy Spirit as we think and listen. Guide us by your eternal light as we discover more about the world around us. Lord, we thank you and let your will be done in our lives. We ask all this in the mighty name of Jesus. Amen.
Of different schools we start, of a single name in our part. The clash of battle is sweet to hear. Right now when the victory is near, excellence is our only standard to outshine the rest. With a great mind and compassionate heart, trained us to be the best we can be. All that we learned at Top Rank Review Academy, we shout with pride and heads up high as victors our dreams shall soar to the sky. Trained us to be the best we can be. Soar to the sky. We learned that if you want to Top Rank Review Academy, soar to the sky.
vroom, vroom, vroom. When we pull up, you know it's a shutdown. 간판 내리고 문 잠가 shutdown. Whip it, whip it, whip it, whip it. Whip it, whip it, whip it, whip it. It's black and it's pink once the sundown. When we pull up, you know it's a shutdown. 간판 내리고 문 잠가 shutdown. Whip it, whip it, whip it, whip it. Whip it, whip it, whip it, whip it. Keep watching me shut it down. Nah, you don't wanna be on my best side. That's right, I'm sliding through. Bunch of wannabes that wanna be me. Me three if I was you. Been around the world, pros on your girl, Vivian says be invested. Need a lesson, see the neck and see the stresses we don't buy. We regress it. A rock star, a pop star, but rowdy. I say bye to the paparazzi. Get my good side, I'll smile for ya. No, it ain't fair to ya. It's staring you like what now? Blackpink in your area. The area been shut down. It's a shutdown. 네 담담한지야 똑바로 봐도 sleep, baby. 뒤집어봐 이거 가격표야 ain't cheap, baby. Stay in your own lane cause I'm about to swerve. Catch me when you hear my Lamborghini go vroom, 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 vroom. When we pull up, you know it's a shutdown. 간판 내리고 문 잠궈 shutdown. Whip it, whip it, whip it, whip it. Whip it, whip it, whip it, whip it. It's black and it's pink once the sundown. When we pull up, you know it's a shutdown. 간판 내리고 문 잠궈 shutdown. Whip it, whip it, whip it, whip it. Whip it, whip it, whip it, whip it. Keep watching me shut it down. Shut you down. Kicking the door, waving the coco. popcorn이나 챙겨 껴들 생각 말고. I talk that talk. Runways I walk, walk. 눈 감고 pop, pop. 안 봐도 쳐. By one and two by two. 내 손끝 툭 하나에 다 무너지는 중. 가짜 쇼 지금 화려해. It makes no sense. You couldn't get a dollar out of me. 자 오늘 밤이야. 난 독을 품고 네 혼을 뺏은 다음. Look what you made us do. 천천히 널 잠재울 fire. 잔인할만큼 아름다워. I bring the pain like this that pink venom, this that pink venom, this that pink venom. Get 'em, get 'em, get 'em. Straight till you don't like. Whoa, whoa, whoa. Straight till you don't like. Taste that pink venom, taste that pink venom, taste that pink venom. Get 'em, get 'em, get 'em. Straight till you don't like. Whoa, whoa, whoa. Straight till you don't like. Black pen and aim, who got bodies like Rambo. Rest in peace, please light up a candle. This the life of a vandal, messed up, and I'm still in saline. Deciding crime, so it wouldn't be me. Diamond shining, driving silence, I don't mind it. I'm riding, flying private side by side with a pilot. Up in the sky and I'm wild and silent on him, and there's no chance. Cause we got bodies on bodies like this is slow dance. 자 오늘 밤이야. 난 독을 품고 네 혼을 뺏은 다음. Look what you made us do. 천천히 널 잠재울 fire. 잔인할만큼 아름다워. I bring the pain like this that pink venom, this that pink venom, this that pink venom. Get 'em, get 'em, get 'em. Straight till you don't like. Whoa, whoa, whoa. Straight till you don't like. Taste that pink venom, taste that pink venom, 심장의 색깔을 보여줘 정말 내 세상에 네가 필요해 두 눈을 떠봐 네 앞에 Here I am I'm ready for love Tell me when you're ready cause I'm already ready Tell me when you're ready cause I'm ready for love I'm ready for love I'm ready for love I'm ready for love, I'm ready for love. Ready or not, here I come and I'm running like a snail. I never know if you wanted what if love wasn't what it was supposed to be. What if there's no Romeo for me? No hope, no roses, no more notes to read. So I keep my eyes closed to see what I need is forever and forever, baby, not sometimes. When you want it, then you best come find me, cause I'm ready. 이젠 기다릴 것도 없잖아. 겁낼 필요도 없잖아. 네 심장의 색깔을 보여줘. 정말 내 세상에 네가 필요해 두 눈을 떠봐 네 앞에 Here I am I'm ready for love Tell me when you're ready cause I'm already ready Tell me when you're ready cause I'm ready for love I'm ready for love I'm ready for love I'm ready for love, I'm ready for love. 영혼과 모든 것이 날 황홀하게 해 기쁘게 해 나쁠 거 없잖아. 난 모든 걸 나 위에 던질 때 날 지켜줄게. 영원한 밤 천 없는 방에 우릴 가둔 love What can we say 매번 아파도 외치는 love 다치고 망가져도 난 뭘 믿고 버티는 거야 어차피 떠나면 상처 조성이 채로 미워하게 될걸 끝장을 보기 전 끝낼 순 없어 이 아픔을 기다린 것처럼 아마 다 잠깐일지도 몰라 우리 무얼 찾아서 헤매는 걸까 But I don't care do it over and over 내 세상 속에 너만 있으면 돼 We are the lovesick girls 네 맘대로 내 사랑을 끝낼 순 없어 We are the lovesick girls 이 아픔 없이 난 아무 의미가 없어 But we were born to be alone Yeah we were born to be alone Yeah we were born to be alone But why we still looking for love No love letters, no X and O's No love, never my exes, no No diamond rings, that's set in stone To the left, better left alone Didn't wanna be a princess, I'm priceless A prince not even on my list Love is a drug that I quit No doctor could help when I'm lost 아마 다 잠깐일지도 몰라 우리 뭘 찾아서 헤매는 걸까 불안한 내 눈빛 속에 널 담아 아프더라도 너만 있으면 돼 We are the lovesick girls 네 맘대로 내 사랑을 끝낼 순 없어 We are the lovesick girls 이 아픔 없이 난 아무 의미가 없어 But we were born to be alone Yeah we were born to be alone Yeah we were born to be alone But why we still looking for love 사랑은 쏟히는 falling 사랑은 killing your darling 아프다 아프면 또 탄탄해 네 겁없는 떨림 들리지 않아 what you say 이 아픔이 난 행복해 나를 불쌍해하는 네가 내 눈엔 더 불쌍해 네 맘대로 내 사랑을 Blackpink in your area. 보란 듯이 무너졌어. 바닥을 뚫고 저 지하까지.
엊그처럼 잡겠다고 저 높이 두 손을 뻗어봐도
다시 캄캄한 이곳에 light up the sky. 네 두 눈을 보며 I kiss you bye. 실컷 비웃어라 꼴좋으니까 이제는 너의 하나 둘 셋. How you like that? You gon' like that? Da-da-da-da-da-da-da. How you like that? How you like that? Da-da-da-da-da-da-da. Now, look at you, now look at me. Look at you, now look at me. Look at you, now look at me. How you like that? Now, look at you, now look at me. Look at you, now look at me. Look at you, now look at me. How you like that? Your girl need it all and that's 100. 패킷 중에 100 내 몫을 원해. Come on, get some. 나 같지만 어쩔 순 없잖아. What's up? I'm right back. 방금 sweater cut back. Plain Jane get hijacked. Don't like me, then tell me how you like that, like that. 더 캄캄한 이곳에 shine like the stars. 그 미소를 띠며 I kiss you goodbye.
실컷 비웃어라 꼴좋으니까 이제 너희 하나 둘셋
How you like that? You gon' like that? Da-da-da-da-da-da-da. How you like that? How you like that? Da-da-da-da-da-da-da. Now, look at you, now look at me. Look at you, now look at me. Look at you, now look at me. How you like that? Now, look at you, now look at me. Look at you, now look at me. Look at you, now look at me. How you like that? 나에게 이른 채로 추락했던 날
어두운 나날 속에 갇혀있던 날
그때쯤에 넌 날 끝내야 했어. Look up in the sky, it's a bird, it's a plane. Bring out the boss, bitch. Blackpink. Dum 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 dum. How you like that? Dum 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 dum. You gon' like that? Dum 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 dum. How you like that? Dum 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 dum. Yeah, yeah, yeah. Blackpink in your area. Yeah, yeah, yeah. 천사 같은 high, 끝은 악마 같은 vibe. 매번 미칠 듯한 high, DM 뱉어야 하는 price. 이건 답이 없는 test, 매번 속더라도 yes. 딱한 감정에 너게 얼어 죽을 사랑해. Here I come kicking it out. 가장 독한 걸로 drop. 뻔하디 뻔한 그 love. 더 내놔봐, give me some more. 알아서 매달려 벼랑 끝에 한마디만 더 like 해볼래 해. 그 따뜻한 떨림이 새빨간 설렘이 마치 해변가겠지만 you might not get in it.
Look at me, look at you 누가 더 아플까 you smile 누가 you are 내 눈에 빈눈물 흐르게 된다면 so sorry 누가 you are
난 어떡해 나약한 나에 견딜 수 없어 서로를 가린 채 사랑의 숨통을 뜯어야겠어. Let's kill this love. Yeah, 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 yeah. Ram-pa-pam-pa-pam-pa-pam. Let's kill this love. Ram-pa-pam-pa-pam-pa-pam. Feeling like a sinner, it's so far with him. I go woo. He said you look crazy, thank you, baby. I'll eat up to you. I'm the old messed up. His love is my favorite, but you plus me sadly can be dangerous. Lucky me, lucky you. 결국엔 거짓말 we lie. So what, so what? 만약에 내가 널 지우게 된다면 so sorry. I'm not sorry. 나 어떡해? 그렇지 못한 태도 간녀린 몸에 쏙 가려진 볼륨은 두 배로 거침없이 찍힌 굳이 보진 않지 넌지 Black 하면 pink 우린 예쁘장한 savage 원하던 대놓고 뺐지 너무래도 칼로 무배기 두 손엔 가득한 fat chicks 궁금하면 never fact check 눈 높인 꼭대기 물 만난 물고기 좀 톡해 난 toxic 유혹해 I'm foxy 두 번 생각해 흔한 남들처럼 착한 척이 못하니까 착각하지 마 쉽게 웃어주는 건 날 위한 거야 아직은 잘 모르겠지 그저 원하면 test me 넌 불 보듯이 뻔해 만만한 걸 원했다면 I'll wait till I do what I hit you with that 뚜루뚜루뚜 Oh yeah, oh yeah Hit you with that 뚜루뚜루뚜 Oh yeah, oh yeah Blackpink 지금 내가 걸어가는 거린 Blackpink four way 사거리 동서나 북사방으로 running 이는 버킷리스트 싹 다 버려 널 당기는 것도 멀리 미치는 것도 제 멋대로 하는 bad girl 조건 싫어하고 누가 뭐라 하던 with a bass drop it's another banger 두 번 생각해 흔한 남들처럼 착한 척은 못하니까 착각하지 마 쉽게 웃어주는 건 날 위한 거야 아직은 잘 모르겠지 굳이 원하면 test me 넌 불 보듯이 뻔해 만나는 걸 원했다면 Wait till I do what I hit you with that 뚜루뚜루뚜 Oh yeah, oh yeah Hit you with that 뚜루뚜루뚜 Oh yeah, oh yeah What you gonna do when I come through with that What you gonna do when I come through with that 뜨거워 뜨거워 like fire 뜨거워 like fire Like pink Oh yeah, oh yeah, oh yeah, oh yeah 넌 거짓말 때문에 내 맘에 상처를 내어놓고 미안하단 말 한마디 없이도 날 혼자 위로하고 오늘 하루도 혹시나 떠날까 늘 불안해해 I just want you to stay 점점 무뎌져가는 너의 그 무표정 속에 점점 내려놓은 잠을 거울에 속삭이곤 해 늘 당연하게 생각하는 너지만 그게 너다워 그래도 stay with me 널 닮은 듯한 슬픈 멜로디 이렇게 나를 울리는데 네 향기는 달콤한 felony 너무 믿지만 사랑해 어두운 밤이 날 가두기 전에
Hello, good morning. Good morning po. Morning. Hala, antok pa sila. Good morning. Morning po. Kamusta? Alam ko sure ako diyan sobrang vacation mode na ng utak nyo. Sure ako diyan. Sobrang pang vacation mode na. Antok na antok pa. Okay, meron ba magbabakasyon? Meron hindi mag-aaral buong Holy Week? Meron ba dito hindi mag-aaral buong Holy Week? Good morning. Mag-aaral. Bakit? May sure ako dyan. Kaya nga in-expect ko sobrang konti na ng estudyante ngayon. As in-expect ko na sobrang konti na student ngayon. Kasi nga ang daming hindi na umaattend kasi parang Holy Week na ata sila. Okay. At may recalls 8 pa, isang oras mo na sasagutan yan. Diba? Bilis lang yung sasagutan. Magpahinga kayo, promise, ngayong Holy Week. Magpahinga kayo ngayong Holy Week. Kahit isang araw lang, pagbigyan nyo na yung sarili nyo. Oo, di ba? Nagsiswim. Umamin ka, nagsiswimming na yung mga personal. NP3 number 51 tayo. Swimming na yung mga utak nyo, no? Pagbigyan nyo na yung sarili nyo, promise, para hindi kayo mapagod. Wag nyong bantawag dito, wag nyong gugulin yung oras nyo sa buong Holy Week na nag-aaral. Para hindi kayo mapagod. Malayo pa naman yung board exam. Almost 2 months pa naman. So, carry lang. Give yourself a time. Okay, nasa number... Yeah, yung board exam di naman talaga. Pero, kasi, yung tawag dito, nakakapagod yan. Okay, swimming sa lectures. Lunod na ba sa lectures? Lunod na ba sa mga lectures ng mga Okay lang yan. Ako nga, galing ika-5th day ko na ng rest day ko today. Para, miss you too. Anong tawag dito? Ika-5th day ko na ng rest day ko. So, 6th day na pala. Kasi duty tayo ng Holy Week para double pay. Diba? Double pay tayo ng Thursday, Friday. Thursday, Friday, Saturday. Diba? Tinapat ko talaga yung parang yung mag-rest day ng Holy Week. Wala pang pasyente. Diba? Wala pang pasyente pag Holy Week. Kaya tinapat ko talaga na duty ako ng Holy Week ng Thursday, Friday, Saturday, Sunday. Diba? Saya. Okay, let's start. No. Tsaka lubos-lubosin nyo na yung yung meron kayong Holy Week break. Kapag naging RN na kayo, tas next year, nasa ospital kayo, wala kayong Holy Week break. Nasa trabaho kayo nun. Okay. Situation, Mr. B came to the ER of sharp throbbing pain after his surgery claimed pain is felt even when he is asleep. Number 51, what stage of pain mechanism do you classify this pain? Dito kasi nakalagay sa situation, naramdaman na daw po niya yung pain. Tamang sagot, alam ko yung ration niya nasa Google form na yung sagot dyan. Anong tamang sagot po dito? Letter Apple. Perception. Kasi di ba by the word perception, sabihin niya naramdaman niya na yan. Okay, naramdaman niya po na yan. Okay. Number 52, when client complains of pain less than 6 months, kapag less than 6 months, matic and yun? Pag less than 6 months, that is your letter C, acute pain. How about your chronic pain? Paano masasabing chronic pain yan? Paano kaya? Ano yung sabihin pag chronic pain? More than 6 months. Yes, more than 6 months yan. How about your persistent pain? Ang persistent pain, sabihin nito, may pain siya throughout the time. Throughout the time, hindi nawawala yung pain niya. Okay, as compared to your intermittent pain, ano meron pag intermittent pain? On and off siya. Okay, on and off yung pain niya. Wala ba? Okay, number 52, letter cat. Letter K. Pre-boards 1 nyo. Parang nabigyan na ako ng material ng pre-boards 1 eh. Kailan pre-boards 1 nyo? Malapit na din pre-boards 1 nyo. Okay? Next. After Holy Week, excited na kayo sa pre-boards, no? Ayaw pa. Ayaw pa. Okay, in order for the nurse to recall the location of pain. Okay, di pa. Location of pain, he has what? Anong tamang sagot dito? Letter boy. Kasi di ba painful body diagram para malaman mo kung saan ba talaga yung pain na nangyayari. Kadalasan when it comes to your pain, di ba ang assessment is yung PQ or ST, the precipitating, ano yung letter Q? PQ. Ano yung Q? Quality, very good. Tapos letter R, radiation, letter E, severity, and letter T, timing. Okay. As a drug and as example of drug therapy to relieve your moderate pain is, ano kaya yan? Tamang sagot. Letter Apple, your codeine. How about your Demerol? Para saan ang Demerol mo? Mild, moderate, severe. Para saan kaya ang Demerol mo? Mild, moderate, severe. It is for your severe. Okay, severe po ito. Severe. How about your Methadone? Para saan ang Methadone mo? Methadone is also for your severe. Okay, severe pain din to. Okay. How about your morphine? Para saan ang morphine? Severe din. Ano yung pang moderate mo? Ay, pang mild pala, sorry. Ano gamot yung for mild pain mo? Example ng mga gamot for mild pain. NSAIDs, paracetamol, yan. COX-2 yung mga celecoxib, di ba? Ito yung mga ano mo, examples ng mild, moderate, and severe pain. Tatandaan nyo lang dyan para mas madali nyo ma-memorize, your mild pain are your common medications na tinitake nyo. Kahit walang reseta ng doktor, for sure tinitake nyo yan. For example, Biogesic, tinitake nyo yan. Ibuprofen, indomethacin, naproxen, ketorolac, celecoxib, yan yung mga available. Diba? Agad-agad. Dito na lang kayo malilito sa moderate pati sa severe. Ang pinakamagandang i-memorize nyo lang dyan, itong moderate lang. Kasi tatlo lang siya. Hydrocodone, codeine, and your tramadol. Okay? Hydrocodone, codeine, and your tramadol na lang i-memorize nyo. Paramedic, moderate pain siya. Okay? Sabihin sa akin kapag done na mag-screen cap. Saan lamig ngayon? Pansin nyo ba malamig ngayon? Or ako lang malamig ngayon sa amin? Or sa amin, pagkagising ko sa malamig. Ang weird. Okay. When a client is on... Umulan? Oo, umulan. Napabalik. Ang aga pa. Kaya antok na antok pa ako. Ito lang ba class nyo for today? Ito lang ba yung class nyo for today? Feeling ko ito lang. Yes, ala, sorry na. Ay, 7 to 8. Shit. Rasyo. Napashit. Kala ko ako lang class nyo. Okay. When a client is on prolonged pain therapy, the nurse should watch out for ganito, kapag prolonged pain therapy, may risk ba to for addiction? Most probably wala. Okay, kasi controlled naman ni doctor yan. Controlled ni doctor, di ba? Kadalasan your addiction is always link yan sa uncontrolled use and consistent cravings. And when it comes to your prolonged pain therapy, ang ginagawa kasi dyan nila doctor, may control dyan. May certain dosage lang ibibigay. Tapos kapag na-meet niya yun, mag-shift siya to another medication. Drug resistance, saan common ang drug resistance? Saan common ang drug resistance? Antibiotic. Okay, antibiotic common yan. Okay, feeling nyo ba magkakaroon pa siya ng allergic reaction sa drug? Feeling nyo magkakaroon pa siya ng allergic reaction sa drug? Hindi na B, kasi naka-pain therapy na to B. Okay, kapag naka-pain therapy na yan, most probably may maintenance medication na siya. So hindi mo na-expect yung allergic reaction. Mag-expect ka na allergic reaction kapag initial dose. Yan, pwede ka mag-allergic reaction sa gamot na yan kapag initial dosing yung bibigay mo. Pero sa case kasi nito, naka-prolonged pain therapy na siya. Correct answer is letter apple. Tolerance to drug. Di ba ang tolerance to drug, by the simplest definition ng tolerance to drug, nag-i-increase yung dosage mo para magkaroon ka ng pain relief. Okay, nag-i-increase yung dosage mo ng drug to have your pain relief. Next, Diego, 46 years old, admitted to the coronary care unit with an MI and frequent premature ventricular contractions and has orders for continuous amiodarone infusion, IV nitroglycerin infusion, and morphine sulfate 2 mg IV every 10 minutes until there is pain, relief of pain. She's taken care by Leona, a newly graduate nurse. Because of Diego's premature ventricular contraction. Ano yung premature ventricular contraction? Is it an arrhythmia, yes or no? Form of arrhythmia. Yes, the nurse should monitor on which of the following parameters. Monitoring, most probably kapag monitoring yan, vital signs yan. Okay, pag monitoring, most probably vital signs yan. So tanggalin mo itong electrolyte, total nasa ER naman siya, hindi na magmamonitor ng electrolyte. Hindi ka magmamonitor ng electrolyte sa paulit-ulit mo kukunan ng dugo. Saka medications. Matik, anong sagot dito? Letter boy. Bakit mo i-monitor ng yung patient na may premature ventricular contractions? Kasi yung mga patient mo na may premature ventricular contractions, di ba, may mga PVCs mo. Kapag in 1 minute, naka 6 PVCs yan, anong gagawin mo? Anong possible mga RKPs? Pwede mag-arrest yung patient mo dyan. Okay, pwede mag-arrest yung patient mo. Pwede mag-arrest siya ng cardiac arrest. Kaya kapag naka 6 PVCs ka in 1 minute, kailangan mo mag-prepare ng crash card. Crash or e-card. Kasi pwede siya mag-arrest anytime. Okay, pwede mag-arrest yan anytime. Kaya apical radial heart rate ang kailangan mo bantayan. Okay? Next. In analyzing a patient's electrocardiographic ECG rhythm strip, Leona used the knowledge the time of conduction of an impulse. So, conduction of impulse, most probably saan ba yan? Sa may start ng P-wave. Diba? P-wave. Yung Purkinje fibers mo, kadalasan yung sa ventricular contraction niya. Okay, from the time of conduction to the impulse of your Purkinje fibers, anong tamang sagot dito? It's letter apple. Your PR interval. Okay, PR interval. How about your P-wave? Anong ginagawa ni P-wave mo? Ang ginagawa ni P-wave? Si P-wave ay sa atrial depolarization. Ano yung sabihin nito? Ang sabihin ng atrial depolarization, that is your atrial contraction. Yan siya. How about your QRS complex? Para saan ang QRS complex mo? Ventricular depolarization. Yes. Kumbaga, dyan magkakontract ventricular contraction. Ano yung QT interval mo? How about your QT interval? Your QT interval represents your ventricular contraction plus your ventricular relaxation. Okay? Yan siya. Kumbaga, the whole time na nag-pump at nag-relax siya. Okay? So, yung naman, your PR interval, ang pinakamagandang gawin mo dito, time of conduction, kasi medyo an impulse. Hanggang Purkinje fibers. So, sabihin ito, okay, NP3, number 57. Tingnan mo, medyo lutang pa yung utak ko. Medyo lutang pa yung utak ko, nakakaloka. Okay. No, pag ganyan kasi, start, kumbaga, ang PR interval mo, ito yung start ng P-wave mo, ay, start, from the start na nag-atrial contraction ka, hanggang pwedeng start na ventricular contraction. Yan siya. Sabi sa kaya pagda na mag-screen ka. Ay, done na. Oh, next. Ayan ang example ng ECG strip mo or yung isang lead ay isang contraction mo. Okay? May possible ba siya lumabas sa boards? Yes. Okay, possible. Hindi ko sure kung lumabas sa amin yan. Hindi ko na matandaan kasi kung lumabas sa amin yan. Try ko hanapin kung meron lumabas ng ganito sa amin ng time namin. Okay? This is your P-wave. Itong P-wave mo, ito dito nag-contract si atrium. Okay? Siyempre, pagka-contract ni atrium, magre-relax siya. Kasama na siya sa ventricular depolarization mo. This is the time kung saan nag-contract naman si ventricle mo. Okay? Di ba sa sobrang laki ni ventricle mo, sa sobrang laki ng force ng ventricle mo, nagkakaroon pa siya ng T-wave. It represents the relaxation ng ventricle mo, yung T-wave mo. Okay? This is your PQRST sa 12-lead ECG mo. Now, considerable difference between your apical and radial pulse rate would indicate, kayang tamang sagot dito? Ano ba yung mo? Anong term sa apical? Sa difference ng apical and radial pulse rate mo? Dito? Term dito. Difference between the apical and radial pulse rate. It is what we called your we called it as your pulse deficit. A pulse deficit. Anong pinagkaiba niya sa pulse pressure? Yung pulse pressure mo ay difference na systole and diastole. Okay? So ano yung sabihin kapag may pulse deficit? Kaya sabihin hindi mo nararamdaman ng maayos sa may radial pulse rate mo or sa peripheral mo. Okay? Ang tamang sagot is letter boy. Numerous weak ineffectual cardiac contractions. Ang tanong dyan, normal po ba magkaroon ng pulse deficit? Yes or no? Correct answer is no. Hindi siya normal. Okay, hindi siya normal magkaroon ka ng pulse deficit. As Jago is assessed, he complains of being very nauseated and very weak. The nurse should, nauseated, sabihin medyo na nahilo-hilo siya at weak. Kapag ganyan kasi, we're talking about your cardiac. So kapag ganyan, most probably ba nagkakaroon siya ng altered brain perfusion? Pwede ba siya? Altered brain perfusion. Start ng altered LOC mo. Yes. Pwede ba siya early sign ng shock? Pwede ba siya maging early sign ng shock or early sign ng cardiac arrest? Pwede. Okay, pwede yan. Okay. So, magno-nutritional assessment ka pa ba? Priority mo pa ba yan? D na B. Di ba? Wala din naman na-mention about stress. Okay, walang na-mention about stress. Okay? And reassurance, di ba? Ang priority mo dito is alert the staff for potential help. Kasi baka bigla mag-cardiac arrest yung patient natin. Okay? Baka bigla mag-cardiac arrest yung patient natin. Letter boy. Letter boy. The physician is scheduled. The physician is scheduled for an exercise, electrocardiogram stress test. What information should the nurse include when explaining the value of this test? Exercise stress testing is, invasive, non-invasive ang stress test mo. It is a non-invasive procedure, di ba? Non-invasive procedure of means of your assessing of your cardiovascular conduction and function. Letter cat. Letter K. Nurse Luna is employed in Hospital X and assigned in the medical ward for a year now. The nurse supervisor ordered her to proceed immediately to the surgical ward as a reliever to another nurse who went on emergency sick leave. She was not oriented in the surgical ward and the unit was very busy. Feeling niyo ba competent enough na siya para malagay sa surgical ward? Competent enough naman na siya, B. Kasi halos same lang naman to, general ward naman siya. Okay, general ward to. Okay, general ward naman siya. So, kaya mo mag-perform dyan kasi surgical ward naman siya. Okay. Next. Which of the following is the most appropriate action for nurse Luna? Ano kaya? Letter dog. Request the nurse supervisor to give her brief orientation before compliance. Bakit? Kasi you are competent enough naman to handle patients na may surgical procedure. Kasi galing ka ng medicine ward. Kapag galing ka medicine ward, most probably may mga patient ka din naman na inooperahan dyan. Okay, bakit ka magpapa-orient? Because different nurse station, different system. Okay? Magkakaiba ng sistema per nurse station. So magpapa-brief orientation ka when it comes to the environment, the process, the system ng mga nurses doon. Okay? The best answer is letter dog. Pero for example, kung maaaring pupunta ka from medical ward to ICU, doon medyo magkakaroon ka ng problem. Okay? Medyo magkakaroon ka ng problem kasi ibang-iba yung yung competency when it comes to your medical ward at ICU mo po. Okay? Correct answer is letter dog. To qualify as an operating room nurse in the Philippine setting, Nurse Luna should possess the minimum requirements of, take note nyo, yung mga person na pwede mag-operating room, kahit fresh grad kayo, pwede na kayo mag-OR. Okay, kahit fresh grad, pwede na mag-OR. So, hindi mo na kailangan ng master's degree holder. Okay, for sure din yan, hindi mo na kailangan nag-work sa abroad. Kasi wala naman. Kailangan mo lang may lisensya ka at may surgical ward orientation. Letter dog. Okay, letter dog. Meron ba dito gusto maging OR nurse? For sure, madami dito gusto maging OR nurse. Meron ba dito? Malay. Meron. Meron. Ayan, meron ng isa. Meron, ayan. Oh. For sure, ang mga number, isa sa mga common na gusto ng mga students, ER, ICU, OR, DR. Yung apat na yan. Diba? ER, OR, DR, ICU. Diba? Meron ba dito gusto maging psych nurse? Psych nurse. Ay, meron. Sobrang nakaka-proud pag gusto maging psych nurse. How about me? Di ba nag-work ako sa isang working ako sa hospital. Di ba aware yung mga person? Nag-work po ako sa hospital. Opo, din po ako, charge nurse po ako sa isang hospital. Yes. Hindi na po ako lecturer. Okay. Nurse Luna is a graduate. Yes. Opo, charge nurse po ako sa isang hospital. Nurse Luna is a graduate in the Philippine Nursing School. Hindi ko pa ba na-share sa inyo? Hindi ko pa ba na-share sa inyo na ako? Na-share na, di ba? Sabi sa inyo, na-share ko na, B. As part of her professional and personal development, she should attend which of the following program, except, okay, so dito, ang PNA, syempre, attendan mo yung inano ng PNA. Ba't ka mag-change ng career? Di ba? PRC din, di ba? PRC, check din to. Pati International Nurses Association. Correct answer is letter C kasi hindi naman siya kasama sa ang tawag dito, when it comes to your CPD unit. Yes. Okay, CPD unit. Kasi ang dito, kadalasan yan, kailangan link siya ng mga professional organizations, tapos KPNA, KPRC, yan yung mga common dyan. Okay, ino-offer ng hospitals, pwede din siya maging CPD units mo. But when it comes to the offering of the school, hindi kasi siya kadalasan. Okay, hindi siya kadalasan. Except kapag ino-offer talaga siya sa mga sa mga RNs talaga. Pero kadalasan kasi kung offered by the school, for students yan. Okay, for students yan. Walang CPD units ka makukuha dyan. So number 63 is letter cat. Letter cat. O the priority objective behind career advancement of Nurse Luna is, plastika na sagot. O kapag ba't ka magsi-CPD daw? Wala ko sa inyo. Kaya kayo nagsi-CPD, letter apple. Umamin. Letter apple, kaya nagsi-CPD. Pampataas ng sweldo. O kaya para marinyo ang lisensya. Diba? A talaga yan, B. Pero dapat kapag nasa board exam ka, letter dog. Okay, updating one's knowledge, skills, conduct, and values. Diba? Kapag totoo naman, pag di pa nurse, letter dog muna. Pero kapag kapag nurse na kayo, para lang, kadalasan yung mga CPD units para daw makarenew ng lisensya. Diba? So, letter dog. Letter dog. Nurse Luna has an expired license but promises to renew her license in due time. Which of the following can she be charged if she participated in home healthcare activities? So, kapag expired yung license mo, professional ka naman na. Okay, professional nurse ka naman na. Pero, you go what is expected of you kasi wala kang lisensya to practice. Kumbaga, may RN ka naman na talaga, registered nurse ka, kaya lang wala kang license to practice. That is your letter apple. Malpractice. Ano yung grave coercion? Ano kayang grave coercion? Grave coercion, ito yung namimilit ka. Okay, namimilit ka. Namimilit ka na, pag hindi mo ito ginawa, ganyan. That is an example of your grave coercion. Your felony is a crime that is due for imprisonment. Okay, it is a serious crime that is due for imprisonment. Okay, how about your negligence? Negligence, kadalasan sabi ni Attorney Campili, basta hindi ka professional at may nagawa kang mali, that is your negligence. Okay, that is your negligence. You are caring for a married woman who underwent modified radical mastectomy. On admission to post-anesthesia care unit, you read the OR report which indicates that estimated blood loss is 1,000 ml. Madami to be. Okay, from the list below, select the most objective indicator for the nurse to closely monitor. Kung wala nagka-blood loss ng 1,000 ml, ano yung monitor mo mas closely? Ano yung mga i-monitor mo dapat? Ano kaya yung mga expected mo kailangan i-monitor? LOC ba? Priority mo ba? Yung LOC dyan kapag ganyan. Pwede naman, di ba? Pwede mo i-monitor yan, pero may mas priority ka kasi dito. Okay? Yes. Di ba? Possible ba yung ano niyan, yung blood pressure mataas mababa? Di ba? Anong possible na mangyari dyan? Pwede ba mababa? Yes. Kaya di ba mo siya i-monitor? Kasi ang taas ng blood loss niya, letter apple. Okay, letter apple. Ito naman, pupillary reaction to light, wala din naman to. Mag-monitor ka ng soak dressing kapag napansin mo meron ng for example, may blood tin sa dressing, doon mo pwede i-monitor yung soak dressing. Pero as of kasi, blood loss ng 1,000 ml yung tinitingnan mo. So, X to. Okay? So, expected mo dito, pwede kasi bumaba yung blood pressure, your pulse rate yan, pwede bumagsak din yung pulse, tumaas yung pulse rate mo kasi compensatory mechanism. Okay, correct answer is letter apple. Letter apple. Yeah, pwede naman siya mag-hypovolemic shock. Diba? Pwede siya mag-shock kasi anytime. Number 67. You assisted in positioning the client. Marisa G-form, baka lang po nagkamay lang po ng ng input. Okay. Her left arm should be placed in which of the following manner. Eto, iniba ko din talaga to. Iniba ko din kasi to. Okay, iniba ko din to. Kasi left arm. So yung left arm mo dapat below or dapat po ba above or at the level of the heart? Saan ba dapat mas maganda? Level of the heart or above the level of the heart? Above the level. Above dapat ang mas maganda mo. So letter apple. Okay. Position the client in semi-Fowler's position. Turn from the back to the affected side with the affected arm elevated. Okay. The heart to promote drainage and to prevent ano. Ba't ka nga ba nag-elevate? Ba't ka ba nag-elevate? To avoid your lymphedema. Okay, to avoid your lymphedema. Correct answer is letter apple. Okay, letter apple. Mas maganda yung above kaysa sa level of the heart. Okay. Letter apple. When the patient woke up from anesthesia, she refuses to see her husband. She remarks that she is not the same person, no longer a woman, much less a wife, with psychosocial nursing diagnosis would describe this situation. May nakasabi na ba dito yung performance na altered na? Wala. Okay, wala yan. Meron ba naka-accuse dito na may anxiety siya? Wala din. Anxiety mo, most probably, tanong siya ng tanong. Yan, example mo. Altered role performance, may ginagawa na siya. Ito kasi, verbal pa lang to. Ang best answer mo dito is altered body image. Okay, altered body image. The client was obviously withdrawn, although her recovery from the surgery was uneventful. How can the nurse be of best self during this recovery? Iiwanan mo ba siya? More time for herself, yes or no? More time for herself? No, kasi mas pwede ba ito mas mag-overthink yung patient natin? Yes. Di ba? Pwede ito mag-overthink, be overthinker. Okay, allow the client to talk with other clients in the ward who had the same kind of surgery. On her case kasi, uneventful, sabihin natin to worry about naman. Eh, hindi naman kasi lahat ng clients mo magkakaroon ng ganon. So, ang tendency dito, baka may ma-share sa kanya na na complication. So, mas lalo siya mag-worry. Okay? Letter dog mo, almost same answer sa letter apple. Okay? Allowing the patient more time to reflect about the effects of surgery. Correct answer is letter boy. Encouraging the client to have more time to verbalize concerns with her family. Number 70, during the first 8 hours post-operative, the total drainage from the Jackson Pratt drain attached to the wound total of 25 ml. What is the best action? So, ang Jackson Pratt drain mo, ang purpose talaga nito is to drain yung mga excess drainage mo sa wound. Okay? Yan lang talaga main responsibility niya. Okay, 25 ml, di ba? 25 ml. Medyo expected mo to. Okay? When it comes to the JP drain kasi wala tayong too much or too less na draining. Okay? Wala tayong too much for draining. Another example kasi, you can infer na first 8 hours end of shift na ni nurse to. Di ba? End of shift na ni nurse to. Okay, ano ba mas maganda mong gawin? Di ba? You just drain it. Empty the Jackson Pratt device. Letter boy. Okay, letter boy. I-empty mo na kaysa wala kang gawin. Pwede mo naman siya i-drain. Okay. Sir, kailan ba tayo magno-notify sa surgeon? Okay, kailan tayo magno-notify sa surgeon? Magno-notify ka sa surgeon kapag may active bleeding. For example, bright red blood na lumalabas sa Jackson Pratt niya. This is a good example. Kapag mayroon lumalabas sa JP drain niya na color. Bright red, that's example of your bleeding. Another example, kung for the first 8 hours, ang drain mo nasa 50 ml, 50 or 100 ml. Then after 8 hours ulit, nag-zero siya. Baka kasi meron kang obstruction na nandyan na kay patient. Okay, baka may nag-obstruction siya. Okay, so mas better answer is letter boy, empty the Jackson Pratt device. Okay, empty the Jackson Pratt device. Next, as a staff nurse in a government hospital, you have been exposed to varied cases of clients with endocrine problems. Your nursing responsibility starts from admission to discharge, which is the domain of your competencies. Which of the following questions should you ask during an admission interview for a client with diagnosis of your pheochromocytoma? Ano po ba ang pheochromocytoma? Ano po ang pheochrom? Benign or malignant tumor to? Ano kaya? Benign or malignant? It is a benign tumor. Okay, benign tumor. Anong tendency kapag may pheochromocytoma ka? Nag-i-increase ba ang catecholamine levels mo? Yes or no? Yes, increase ang catecholamine levels mo. Ano ba yung mga catecholamines mo? Your norepi and epi. Di ba? Norepi and epi. Kapag mataas ang norepi, epi mo, ano nangyari? Kamusta blood pressure mo? Mataas, mababa? High. Heart rate mo, mataas din. Correct answer is letter cat. Letter cat. Letter cat. 72. When the sympathetic nervous system is stimulated, in the case of pheochromocytoma, you expect the following symptoms. Siyempre, mag-expect ka hypertension. Headache, possible po ba? Yes or no? Possible ba? Headache mo? Yes. Ano yung hyperhidrosis? Ano yung hyperhidrosis? Ano kayong hyperhidrosis? Excessive sweating. Expected din to. Taas ang blood pressure mo. Hypermetabolism. Yes. Kapag may hypermetabolism, pwede ka pa mag-hyperglycemia. Yes or no? Yes. That is another classic symptoms of your pheochromocytoma. 5 yan. 5H yan kadalasan. Correct answer is letter cat. And letter cat. Which of the following drugs can induce your hypertensive crisis in your pheochromocytoma? Correct answer. Okay, tamang sagot. Letter apple. Bakit, sir? Ang tendency kasi ng tricyclic antidepressant, it inhibits the reuptake of your serotonin and your norepinephrine. Kaya tumataas yung norepinephrine levels mo sa blood. Okay, mas tumataas ang norepinephrine levels mo sa blood. Tendency, mas nagkakaroon ka ng hypertensive crisis. So, letter apple. Letter apple. Number 74, in the presence of your pheochromocytoma, the diagnostic test which is expected to be elevated is, ano kayong tamang sagot dito? Thyroid, serum thyroid hormone levels. Ito, parang hyperthyroidism to. Albumin globulin test kasi, more of the albumin blood test to. Okay, correct answer is letter dog. Okay, letter dog. Kasi it measures your catecholamine levels. Okay, catecholamine metabolites. So, kadalasan yung may mga ganito, 2 times higher yung expected, the normal limit when it comes to this one. Ang tinatanong dito palagi, ano yung mga foods na i-avoid mo kapag nagko-collect ka ng urine dito? Okay, di ba? 24 hours urine, VMA mo, ano yung mga pagkain na avoid? Foods to avoid. Ano yung mga avoid mo kaya? A good example ng i-avoid mong food. A good example is your caffeine. Okay, yung mga caffeine mo. For example, your chocolates. Okay, coffee, tea, cola, banana, ano pa? Vanilla. Yan yung mga avoid mo. Okay, yan yung mga i-avoid mo kadalasan. Correct answer is letter dog. Number 75. Palpation as a modality of physical assessment is avoided when diagnosed with pheochromocytoma because this action, ano kaya? Ano kaya yung tamang sagot dyan? Letter. Ito kasi, okay, di ba? Ano ba yung meron ng pheochromocytoma mo, di ba? Ang common sa may pheochromocytoma is common, ayaw mo mag-palpate kasi pwede ba siya mag-release ng catecholamines? Yes or no? Yes, pwede siya mag-release ng catecholamines. Kapag nag-release siya ng catecholamines, ano mangyayari? Ano kaya? Pwede siya magkaroon ng severe hypertension. So, mas tamang sagot is letter boy. Okay, pwede kasi siya mag-release ng catecholamines that could lead for your severe hypertension. Okay? Better answer si letter boy kaysa kay letter cat. Okay? Kasi, di ba, yes, pwede siya ma-displace. Pero ang tendency mo kasi kapag nagpalpate ka, ang tendency, pwede siya mag-release ng catecholamines mo, which can lead to your severe hypertension. Mas importante yun eh, mas focus mo yun. Kasi pag nag-severe hypertension yan, problema sa'yo yan. Okay? So, letter boy. Letter boy. Yeah. Tinama ko yan. Tinama ko yan saan? Tinama ko yan sa ano? Okay, tinama ko po yan. Iniba ko talaga yung sagot dyan. Sinadya ko talaga iba yung sagot dyan. Okay? GN 56 years old underwent partial gastrectomy with gastrojejunostomy. The nurse identified iron deficiency anemia as a potential problem. Which of the following specifically would predispose the patient to this problem? Okay? O dito, 'di ba, kakatapos lang niya ng surgery niya. Okay, kakatapos lang ng surgery niya. Wala naman tayong cues na meron siyang inadequate intake of food rich in iron. 'Di ba? Wala naman tayong cues. Ang cues lang natin dito is nagkaroon siya ng surgery. Okay, nagkaroon siya ng surgery. Okay, rapid gastric emptying of your due to gastrojejunostomy, wala pa din naman siya. Okay, wala pa din naman siya sinabing kumain siya. And your inability to eat large meal. Ang pinakatamang sagot dito is letter cat, excessive blood loss or loss of blood during your surgery. Letter cat. Letter cat. O the nurse understands that iron deficiency anemia results in decreased RBC, which are tamang sagot dito. O, ano yung abnormally crescent shaped? Ano kaya yan? Ano yung sakit na yan kapag abnormally crescent shaped? That is your sickle cell. Okay, sickle cell yan. Okay, large immature. Kadalasan ang tawag sa large immature mo. Ano yung mga large immature mo? Pwede siya matawag na macrocytic anemia or your megaloblastic anemia. Okay, pwede siya matawag na your megaloblastic anemia. Ano yung mga common vitamin deficiency kapag may megaloblastic anemia ka? It's either your vitamin B12 or your vitamin B9. Okay, B12 or B9 yan. Okay, correct answer is letter cat. Okay, letter cat. Letter cat. Number 78. The physician emphasized that vitamin B12 levels will be routinely monitored. Which of the following mechanism correctly explain the possibility of the patient developing vitamin B12 deficiency? Ang vitamin B12, saan siya na-absorb? Duodenum or ileum sa... Saan kaya? Duodenum or ileum? Sa ileum siya. Okay, ileum po siya na-absorb. Okay, sa may ileum po siya na-absorb. Okay, saan, ano po ba nangyayari since nag-gastrojejunostomy ito? Yung sa may mo kasi, ang intrinsic factor mo na-absorb siya sa sa stomach. Okay, nag-gastrojejunostomy ito, nag-partial gastrectomy. Sabihin ba nito, magkakaroon siya na inadequate absorption? Yes, letter cat. Okay, your intrinsic factor kasi is a glycoprotein produced by your parietal cells in the stomach. Since nag-gastrectomy ito, di ba? Nag-gastrectomy ito, magkukonti ang intrinsic factor which is necessary for the absorption of your vitamin B12 in your ileum. Okay, in your ileum. Correct answer is letter cat. Letter cat. Which of the following group of manifestation will the nurse expect in vitamin B12 deficiency develops in the patient? Diba, one of the classic symptoms of your vitamin B12 deficiency is your, ano kaya? Letter, ano kaya yan? Letter dog. Okay, letter dog yan. Specifically your glossitis. Okay, your glossitis. Ang chelosis mo naman, common yan sa riboflavin deficiency. Okay, alam ko vitamin B1 and riboflavin. If I'm not mistaken. Okay, this one is for your riboflavin. Saan ko na lang? Dito na lang. Yan. Ito naman, your spoon-shaped nails, kadalasan to linked to your, to your iron deficiency. Okay, linked to kadalasan to your iron deficiency anemia. Iron deficiency anemia. AIDA. Yan siya. Priority nursing diagnosis identified by the nurse for GN is imbalanced nutrition related to patient's inadequate intake of food. Which of the following is an inappropriate intervention? Diba? So kapag ganyan, dapat ba kapag nagda-diet plan ka with the patient or with the family? With the patient or with the family? Siyempre with the patient, matic letter, boy, X. Ito din, wala din naman dito. Okay? Ano ba mas maganda? Titingnan mo kukunin mo lang yung kay patient yung food pref niya tapos ikaw gagawa or magpe-prepare ka in consideration kumbaga kasama si patient. Letter cat. Okay, letter cat, mas better si letter cat. Dito kasi sa letter apple, kumuha ka lang kay patient ng food choices niya or yung mga gusto niya pagkain. Tapos ikaw nag-prepare. As compared dito, prepare a diet plan in consideration of your patient's preferred eating pattern. Letter cat. Letter cat. Situation, GI problems are rampant in the ward. Nurse Patricia is assigned in. The following question apply. Jean is a patient admitted in the ward for her hemorrhoid management. The following are recommended for caring for Jean. Tepid spits bath, yes or no? Pwede ba yan? Tepid spits bath. Yes. Warm or cold? Warm or cold? Ano kaya yan? Saan mo papaupuin yan? Sa warm. Okay, so warm mo papaupuin yan. Warm. How about high fiber diet? Kapag high fiber diet, pwede bang magiging soft ba yung poops mo? Yes. Okay, magiging soft to. Okay. Use of moistened tissues in cleaning the anal area? Yes. Correct answer is letter boy. Bakit kapag nag-wipe ka ba sa hemorrhoids mo, ano mangyayari? Ano mangyayari kapag nag-wipe ka sa hemorrhoids mo? Magbi-bleed tsaka masakit ba to, B? Masakit ba? Yes, masakit to. So anong i-recommend mo? Ano i-recommend mo? Kapag, syempre, matik naman, syempre, di ba? Pupunasan mo naman yung anal area mo pag nag-poops ka. Di ba? Anong gagawin mo? Should be dabbing. O kaya patting. Yung lang, ganun-ganun lang, konti lang. Parang hindi masyado masakit. Yan yung i-recommend mo, dabbing or patting to clean the anal area. So, letter boy. A patient with colorectal cancer and who underwent surgery a week ago had colostomy in place. What assessment finding is expected? Expected mo ba magka-bright red bleed profusely? Expected mo ba yan? Kapag ganyan, ano most probably meron si patient? Meron siyang active bleeding. Nagbi-bleeding yan si patient. Okay. Dark red. Expected mo ba magka-dark red yan? No. Kapag dark red, pwede yan sign of infection? Pwede. Flaccid ba dapat ang colostomy mo? Yes or no? No din. Reddish pink. Pwede ba mag-reddish pink ang colostomy? Yes, pwede tong reddish pink mo. Pwede siya mag-reddish pink. Okay, pwede to. Pero dry, pwede ba mag-dry ang colostomy mo? No. Diba? Ano ba dapat ang colostomy mo? It should be moist. Moist dapat yan. Correct answer is letter boy. It protrudes 2 cm from the abdominal wall. Kapag naglilinis ka ng colostomy, sterile or clean? Pag naglilinis ka ng colostomy, sterile or clean? Clean. Kapag nagpapalit ka ng dressing ng colostomy mo, sterile or clean? Dressing. It is still clean. Clean yan, B. Ano ba yung lumalabas sa colostomy mo? Ano lumalabas sa colostomy natin? Pupo. Sterile ba ang pupo, B? No. Okay, no yan. So, kapag nagpapait ka ng dressing, clean lang. Okay, clean lang. Which of this refers to the abdominal pain when eating? Abdominal pain when eating. Sabihin nito, symptom ang hinahanap mo. Ang GERD, di ba? Ang GERD kadalasan acid reflux to, yes or no? Acid reflux yan. Okay? Acid reflux. Ang gastritis mo is swollen, okay, or inflamed stomach lining. Okay? Ang achalasia mo naman, ang achalasia mo kasi, it is a form of esophageal disorder. Okay, esophageal disorder to. Correct answer is letter dog. Letter dog. Hmm. 84. A patient with duodenal ulcer experiences pain that is usually aggravated by which of the following? Ano kaya dyan? Kapag nag-ingest ka ba ng food sa may patient na may duodenal ulcer, ano mangyayari? Duodenal ulcer, tapos nag-ingest ka ng food, ano mangyayari? Magkakaroon ka ba ng pain? No. Diba? Mari-relieve yung pain. Meron kang pain relief. Okay, saan yung meron kapag kumain, pag nag-ingest ka ng food, magkakos ka ng pain? Ano yun? Gastric ulcer yun. Okay. Anong gagawin mo kung wala nagkaroon ng pain habang kumakain ka tapos gastric ulcer? Anong re-recommend mo kay patient? Ano kaya? Ano re-recommend mo? Suka, di ba? Isusuka yun, di ba? Kadalasan kapag gastric. Okay. How about your caffeine? Naka-induce ba ng pain to ang caffeine mo? Yes or no? Yes. Fried food? Yes. Spicy? Yes. NSAIDs? Gastric irritant ang NSAIDs mo. And corticosteroids? Yes or no? Yes. Gastric irritant din to. Correct answer is letter dog. Ano mas common sa duodenal? Melena or hematemesis? It is melena. Okay, melena. Saan mararamdaman yung pain? Mid epigastric or sa left? Mid or left? Kapag duodenal. Saan ba duodenum mo? Saan duodenum mo? Sa mid. Mid ang ano mo. Ang duodenal mo. Ang gastric na. Saan ba yung ano mo? Stomach mo? Nasa left portion ba ang stomach mo? Yes or no? Nasa may left yan kadalasan. Diba? Hematemesis or melena ang gastric mo? Hematemesis. Okay. Ito siya. Yung difference sila ng dalawa. Na-explain na natin yung lahat, B. Okay. Next. Once peristalsis is established and confirmed, a patient underwent surgery for diverticulitis, which among this nurse Patricia expect to be given first. So expect nyo dyan, di ba? Pag galing surgery, anong diet ni patient mo pag galing surgery? Anong diet ni patient pag galing surgery? Di ba? Kadalasan naka-NPO muna yan, B. NPO muna yan. Kapag magpa-progress ka, anong uunahin mo? Pag magpa-progress ka, clear leaks muna. Okay, kapag na-tolerate na yung clear leaks, anong susunod mo? Soft or gen leaks? General liquid or full liquid diet ka muna. Okay? Pagkatapos mo mag-general liquid diet, ano susunod mong progress? Soft ka na. Okay, soft diet. And then last one is your DAT or diet as tolerated. So, galing siya NPO most probably kasi nanggaling siya ng surgery niya. Ano yung ano dyan? Clear leaks dito is letter cat. Okay, letter cat. How about your mashed potato? Ano yung mashed potato mo? Soft. Yogurt. Anong yogurt mo? Ano yung yogurt mo? It is your Genlix ang yogurt. Okay, Genlix yan. Okay, Genlix. How about your pudding? Pudding mo is an example of your Genlix. Genlix ang pudding mo. Okay, Genlix yan. Another example, black coffee. Ano ang black coffee mo? Black coffee. Your black coffee is a clear liquid diet. Okay, clear liquid yan. How about your 3-in-1 coffee? Gen liquid diet. General liquid diet. Apple juice. Ano yung apple juice? Clear. Beef broth. Beef broth. Beef broth. Clear. Porridge. Ano yung porridge ba? Anong tagal ng porridge? Lugaw yun, lugaw. Arte lang yung porridge. It is a Genlix. Okay, Genlix yan. Genlix ang porridge mo. Okay, to carry out management functions in any healthcare setting, it is necessary for the nurse to integrate leadership skills that he or she developed. The organizational chart of the nursing department illustrates the structure and relationship of the nursing leaders and staff of the organizational chart. The following are the functions of an organizational chart except Siyempre, kapag ganyan, makikita mo yung control of the organization and chain of command. Makikita mo din yung relationship. Okay, and you identify the managerial levels. Correct answer is letter dog. Saan ba makikita ang functions and duties of the staff? Sa very good job description po. Okay, sa job description mo yung makikita. Letter dog. Letter dog. Coercing. Ano ibig sabihin ng coercing? A patient into taking medications by threatening punishment could be legally considered as, di ba? Coercing, pinipilit mo siya. Kapag pinipilit mo siya, anong tamang sagot dito? Letter apple. Okay, paano kung wali sinaktan mo yung patient mo? Ano yan? Letter dog battery. How about your false imprisonment? A good example of your false imprisonment is ano kaya? Restraint, 'di ba? Restraint na walang na walang consent. Okay? Pero pag may consent 'yan, tas ni-restraint mo 'yan, false imprisonment pa ba 'yan? No. Okay, hindi yan B. Okay, hindi yan. Okay, another example, kapag yung psych patient mo, tapos lahat yan naka-side rails up, that is an example of your false imprisonment din. Okay? Kasi tatandaan nyo kapag sign of, dapat daw, kapag psych patients, dapat may isang side rails na nakababa. Specifically sa baba, sa lower extremities na side rails na dapat nakababa yung isa doon. Kasi para makakonsider kasi siyang restraint kapag ganun. The doctor assigned to the patient was also sued together with the nurses. When it was his turn to take stand during the next hearing, he was told to bring with him a copy of your patient's chart. Okay? The hearing officer will have to issue what legal order to bring the patient. Anong tamang sagot dito? Letter boy. Okay, letter boy. How about your subpoena ad testificandum? Ano dyan? Testify. So, sino pupunta dyan? Yung person ang pupunta dito. Okay, person. Dito kasi document. Okay, pupunta yung witness dyan. Letter boy. Yung letter boy. Mr. Putanesca has declined after being revived yesterday after suffering from arrest. Dr. Isoto ordered a DNR. Ano yung DNR order? Ano yung DNR order? Do not resuscitate. Okay, do not resuscitate. Kapag do not resuscitate, hindi mo na bibigyan ng food and water. No, bibigyan mo pa yan, wala naman, di ba? One of the things dapat tatandaan nyo, kahit sabihin nyo nag-DNR, DNI yan, or may advanced directives yung patient nyo, may right pa din sila makakuha ng water at food. Okay, may right sila niyan. Do not give due care to Mr. Putanesca, even giving bed. But diba, dapat mamamatay sila with dignity. Okay? The patient need to not be given ordinary care so that his dying process is hastened. Hindi rin naman letter dog. Ibig sabihin ng DNR, do not resuscitate. Kapag nag-cardiac arrest, magpa-pump ka pa ba? Yes or no? No. Paano kung wari nag-pump ka? Tapos naka-DNR si patient, nakapirma siya ng DNR. Anong mangyari sa'yo? Pwede ba ito maging sign of battery? Yes or no? Yes. Okay, unconsented touch yan. Di ba nag-consent na siya na wag mo siya i-revive. Diba? Letter cat. Letter cat. What ethical principle applies when the surgical team adheres to the surgical asepsis during surgical procedure? Ito, una ko na kayo, medyo, talaga to, parang conflicting answers to from across the, iba't ibang lecturers. Pero diba, your surgical asepsis, you promote, goodness, and you limit the harm. Correct answer dito is letter, kaya? Let's stick with the answer of letter, letter dog. Let's stick with the beneficence. Okay, I'm trying to look, kasi di ba may nagsasabi din na mas maganda yung non-maleficence. I'm trying to look a source kasi na nagsasabi na non-maleficent siya. Okay, pero wala kasi ako mahanap talaga na non-maleficent siya. Like, I've tried looking to books, research book, ethics books. Wala akong makita na pag surgical asepsis non-maleficent siya. So let's stick with your letter dog. Okay, letter dog. Rainier's nurse assigned in the medical ward of Laguna General Hospital. The following questions pertain to nursing care of patients with diabetes mellitus. A middle-aged male client has recently started on insulin therapy. During one of Nurse Rainier's rounds, the client asked whether drinking alcohol would be possible. How should Rainier respond? Tamang sagot. Okay, diba? Ang alcohol mo can impair ability to what? To recognize and treat your hypoglycemia. Kasi almost same ba sila na manifestations mo ng alcohol? Or pag inom mo ng alcohol and your hypoglycemia, yes. So letter cat. Okay, letter cat. A female client is asking about sugar substitutes. Okay, so sugar substitutes. She knows that she needs to reduce her calorie intake to reduce her weight to avoid complications associated with diabetes. What sugar substitute would be best? Okay? Kapag may diabetes yung patient nyo, palagi nyo tatandaan, we don't recommend them to take what? We don't recommend them to take simple sugars. Okay? So tanggal agad to si fructose and si sucrose. Kasi kapag nag-advise ka sa kanila mag-take ng simple sugars, like your fruits, ano pa ba yung table sugar mo, mag-i-increase yung blood sugar ba nila, yes or no? Magsa-sudden increase, yes, kasi madali mag-breakdown yun. Okay? Your sorbitol kasi, okay, it is what we call your sugar alcohol. Okay, sugar alcohol. Meron pa din tong calories. As compared to your sucralose, wala kasi siyang calories. Okay? No calorie sweetener kasi siya. So letter dog. Okay, letter dog. Letter dog. Number 93, Nurse Rainier is preparing to administer insulin to a client with blood sugar of 124. So si patient mo, diabetes mellitus, yan DM. Yung 124 ba sa kanila, mataas or mababa na yan sa kanila? Sa mga DM patient. Medyo nagbo-borderline na to. Okay, medyo borderline to sa kanila. Kasi some other patients kapag below 100, hypoglycemia na sa kanila, as in sobrang baba na sa kanila niyan. Okay? He had compared the result to the medication record and physician's order and noted that the client is ordered Novolog insulin Your Novolog insulin is a rapid-acting insulin, yes or no? Yes. Okay. He acquired the appropriate amount of insulin, then went to the client's room to administer the medication. The meal tray is due in 30 minutes. What should you do? Kapag insulin ba na mas recommended mo? Before or after meals? Before. Mas recommend natin before. Since ito kasi ang Novolog insulin mo, ang onset nito is nagsa-start ng 15 to 30 minutes. Okay, 15 to 30 minutes. So kapag nagbigay ka, okay, ng insulin agad-agad, within 15 minutes, pwede ba mag-hypogly yung patient mo dyan? Pwede ba mag-hypogly yung patient mo? Yes, kasi yung meal tray mo, due pa ng 30 minutes and medyo borderline na to. So ang pinakamaganda mong gawin, hold the medication until the meal tray is in front of the client. Like bago talaga siya kumain, doon mo bibigay yung Novolog insulin mo. Correct answer is letter dog. Okay, letter dog. Number 94, another patient in the unit was recently diagnosed of type 1 diabetes. Kapag type 1 DM, nakakapag-produce po ba yung patient ng insulin, yes or no? No. So kapag ganyan, insulin dependent po ba ang mga type 1 DM, yes or no? Insulin dependent ba sila? Yes. Honors Rainier is providing education on what is termed as survival skills. Which of the following should he prioritize to teach the client? Kapag insulin po ba, ano po bang route dapat? Anong route natin kapag insulin? Sub-Q. So, di ba wala silang insulin, anong dapat ituturo mo sa kanila? Letter? Ano kaya? Survival skills. Letter? Ano? Letter cat. Okay, letter cat yan, siyempre. Insulin self-injection technique. Letter cat. Opo, mali po yan sa sa Google form. Alam ko po. Opo. Tapos yung number 95 nyo, same choices sa number 94. Di ba? Same choices. A 23-year-old woman is asking Nurse Rainier regarding the preparation of mixed dose insulin. Which of the following instructions should he give the patient? Tamang sagot. Siyempre, matik to, hindi mo siya matik to. Okay, hindi mo naman papainitin yung yung insulin mo, 'di ba? Dapat cold siya as much as possible. Okay? Inject air to both insulin. 'Di ba dapat dapat mauna mo mag-inject ng insulin? Ay, saan ka una mag-inject ng air? NPH or regular? Saan kaya? NPH, letter cat. Okay, ano bang gagawin dyan, sir? Screen cap nyo muna to. Screen cap nyo muna. Next na po. Next. Okay, ano bang gagawin dyan? Diba, kadalasan yan, okay? Kadalasan, mag-i-inject ka muna ng air sa NPH mo. Inject air to air. NPH, yung desired amount mo. Magta-touch ba dapat siya dun sa fluid, yes or no? Magta-touch ba dapat siya sa fluid? No. Okay, no. Then after mo mag-inject, kung 36 units, yun yung i-inject mong air. Tapos, mag-i-inject ka naman ng air sa regular insulin mo. Inject ka ng 12 units. Tapos kukuha ka na doon. Okay, kukuha ka na doon ng insulin mo. Kapag kakuha mo niyan, okay, i-inject mo na ulit siya sa NPH mo. Most probably, bababa na yan ng kusa kasi may positive pressure na dito. May positive pressure na siya, so hindi niya na isa-suck yan. Most probably, mag-aano na yan. Dahan-dahan na yan mag-aano ng sakto 36 units po. Okay, ang tanong dyan, pwede ka ba magbigay ng insulin via your 1cc syringe? Yes or no? Pwede ka ba magbigay ng insulin syringe ba using your tuberculin syringe? Yes or no? Pwede kaya magbigay ka ng insulin via your tuberculin syringe. Correct answer is no. Hindi pwede, B. May insulin syringe talaga dyan. Okay, may insulin syringe ka. Kasi magkaibang unit of measurement mo. Sa tuberculin, sa insulin syringe mo. Okay, so no yun, ha? No yun. Ang insulin mo, pang insulin syringe lang talaga siya. Okay? Next. The patient's readiness for surgery is critical to the outcome. Preoperative care focus on preparing the potential for surgery. Interventions needed and responding to potential anxiety. The nurse in the ambulatory preoperative unit identifies that the client is more anxious than most clients. The best nursing intervention is to, kapag anxious yung patient mo, anong gagawin mo? Verbalize feelings ba agad-agad? Yes or no? Pag mga ganyan, psychosocial, yes. Correct answer is letter Apple. Attempt to identify client's concern. Number 97, which is an independent nursing measure that would be helpful in preventing the accumulation of secretions in a client who had general anesthesia during surgery. Tandaan nyo, okay? One of the things, best way to prevent all post-op complications is what? Early ambulation. Ano yung early ambulation kaya dyan? Letter. Ano kaya? Letter dog. Okay. Frequent changes of possession. Letter dog. '98. What is the priority nursing intervention for a client during the immediate post-operative period? Anong priority daw natin, B? Letter boy. Okay. Bakit? Diba? Letter boy. Airway. Diba susunod mo yung breathing and your circulation. Letter boy. Letter boy. The nurse in the post-anesthesia care unit identifies that after an abdominal cholecystectomy, a client has serous-sanguinous drainage. Serous-sanguinous, normal, abnormal. Serous-sanguinous, normal, abnormal. That is normal on the abdominal dressing. What should the nurse do? Tamang sagot. Letter boy. Reinforce the dressing. Ibig sabihin na reinforce, you can, check mo, lagyan mo ng tape, additional tape. That is your reinforcing of your dressing. Bakit ka hindi mag-change ng dressing kaya? Bakit ka hindi mag-change ng dressing? Meron na yung serous-sanguinous drainage. Ano kaya? Si doktor ang gagawa. First change yan, B. First change. Okay? Post-anesthesia kakatapos na ng OR. So, ang first change mo si surgeon po ba? Yes or no? Yes. Okay. So, reinforcing of the dressing ka lang po. Okay. Ano yung mga different ng mga drains mo? Serous drain, normal, abnormal. Serous drain, normal, abnormal. Normal. Anong color ng serous drain mo? Ano color ng serous drain mo? That is a straw colored. Straw colored. Sabi niya parang ihe, babi. Parang ihe. Your serous-sanguinous is a pinkish color that is still normal. Okay, normal pa din po ang serous-sanguinous drainage mo. Screen cap muna ng mga person. No, ano yung hindi normal? Ano yung hindi normal na drains mo? Purulent. Okay, purulent. Ano yung purulent drain mo? Other term for your purulent, that is your, ano kaya? Ang purulent mo, that is your nana or pus. Okay? Yellow, gray, or green drainage due to the infection in the wound. How about your sanguineous? Normal, abnormal ang sanguineous drainage mo. Normal, abnormal. Abnormal din yan kasi sign of your, meron kang trauma sa blood vessel mo. Kumbaga, yung dressing mo, mapapasin mo para siya may buo-buo. Okay? Para siya may buo-buo. Next. Sabihin kapag done na mag-screen cap ang mga person. Done. A client has corrective surgery of bladder laceration, which nursing intervention takes priority during this client's post-operative. Okay? Di ba we promote what? Ambulation. At the same time, bladder surgery to, anong meron siya? Meron siyang Foley catheter to aid your drainage. Okay, to aid your drainage. Correct answer is letter apple. Okay, letter apple. Okay, questions to your NP3. Questions to your NP3 meron? Wala. Let's have a quick bladder break lang hanggang 8:35. Carry or 8:40? Bladder break. 8:35, 8:40. 8:40. Sige, balik kay 8:40 po. Okay, balik kay 8:40. Bladder break. Let's go na. Para maaga tayo matapos, di ba? Situation. The nurse provides health education to a group of adolescents about pelvic inflammatory disease. The nurse explained that prevention of PID in adolescents is important due to which of the following reasons? Tamang sagot. Kapag nagkakaroon ka kasi ng PID, ano ba yung mga possible? NP4. Nandyan pa ba kayo, B? Diyan pa ba kayo? Tulog na. Dito pa. Okay. Huwag muna kayo matulog. Last push na, tapos ilang araw kayo. Hanggang kailan kayo walang pasok ba? Hanggang kailan kayo walang pasok? 10, ang haba. Sana all. April 10? Ano ba April 10? Hello? Ang haba hanggang Monday. Hanggang Monday kayo ano? Sana all. Diba? Okay. So ano ba yung mga usual na ano ba yung usual mga complications mo? Okay, number 1 complication mo is what? Scarred fallopian tube. Okay, scarred. Nandiyan na ba yung yung rasya sa inyo? Wala pa. Sterility is very good. Sterility. Ano yung sabihin na sterility, B? Ang sabihin na sterility. Hindi makakapag-conceive or hindi majujuntis. Kaya ano pa? Recurrent pelvic pain and abscess. Siyempre, di ba? Correct answer is letter apple. Okay, letter apple. Kasi kung ito yung letter cat, hindi ka na kasi magkakaroon kasi magiging sterile, magiging infertile ka na. Okay? It is easily prevented by compliance with any form of contraception. Kasi yung IUD mo din kasi is linked for your PID. Okay, your IUD is also linked for your PID. Kadalasan ba ano bang cause ng PID mo? 'Di ba? Anong kadalasan cause ng PID natin? It is your tamang sagot. Letter boy, gonorrhea. Ano pa yung other? Pwede din dyan ang chlamydia and your ano pa? Clostridium perfringens. Yan siya. Letter boy. Letter boy. Number 3. The nurse further explains that PID represents the following signs and symptoms which adolescents should be aware of. What? Di ba sinabi natin, pwede ba siya magkaroon ng pain? Yes. Okay, tamang sagot dito. Letter cat. Okay, letter cat. Diba? Lower abdominal pain and urinary tract infection. Pwede ba sila magkaroon ng vaginal discharge dito? Yes or no? Vaginal discharge? Yes. Okay, pwede siya magkaroon ng vaginal discharge din dito. So, letter cat. Which of the following statements is true when teaching adolescents about gonorrhea? Tamang sagot. Ang gonorrhea po ba, nakukuha to sa pag-upo mo sa toilet seat? Yes or no? No. Saan nakukuha? STD. Sexually transmitted disease po ang iyong gonorrhea. Okay? Gonorrhea is most often treated by multi-dose administration of penicillin. Okay? Kadalasan dito, ang penicillin mo kasi kadalasan multi-resistant sila to your penicillin or penicillin resistant sila. Okay, penicillin resistant. So anong drug of choice mo kadalasan kapag may gonorrhea ka? Anong drug of choice mo kaya? Drug of choice natin kadalasan is your ceftriaxone. Anong route ng ceftriaxone mo kapag ganyan, kapag may gonorrhea ka? Ano kaya? Anong preferred route kaya? Oral, IV, hindi, intramuscular injection. Okay. Masakit kaya yun, B? Masakit yun, B. Halata naman. Ang lapot-lapot nun. O paano mo nalaman masakit? Na-try mo na? Char, joke lang. Baka may magalit. Charot lang. Okay. Mahapdi yun kasi antibiotic yun. Ang lapot-lapot ng antibiotic. Okay, ang lapot-lapot na antibiotic. Okay, correct answer dito is letter boy. Okay, letter boy. Letter boy. Now, the nurse further explained that to the adolescents that gonorrhea is highly infectious and it can, nasabi na natin to, letter boy. Okay, pwede siya magkaroon ng sterility. Letter boy. Halatang yung mga person, mga hindi morning person yung mga tao, nag-i-increase pa din yung number of students. Nakakaloka. Halatang hindi mga morning person talaga. Nag-start tayo dito ng 7 o'clock, 1:50 eh. Nag-start tayo 1:50. Ilan na ngayon? 2:60. Napaghahalataan nga naman. Okay lang yun. Okay lang. Night owl, bakit? Ay, wow. The ER personnel, ay bakit pighati? Broken hearted. Meron na ba hiniwalayan dito ng jowa? Wala pa. Hiniwalayan ng jowa, meron na boyfriend. Wala pa. Meron yan. Meron yan. Wala akong jowa. Diba? Meron yan. Hindi naman required magka-jowa, diba? Muntikan tinan nyo, mga first week na May, meron na yung mga paisa-isa hiniwalay ng jowa kasi hindi siya kinakausap kasi busy kakaaral, diba? Not understanding. Okay, the ER personnel of Hospital X receives a report that a bus traversing a highway fell off the road. There were several passengers injured. You are one of the nurses in the ER. True, safe for Lanjowa. You assist in preparing the ER to receive injured passengers. Siguro madami dito naghahanap ng jowa dito sa review. As an ER nurse, one of the most important assessment skill you need to prioritize utilizing the triage system. The triage system is, sa dorm? Uy, grabe naman sa dorm ka naghanap ng jowa mo. Okay, di ba? Kapag nagta-triage system ka sa ER, ano bang priority mo? Critical or stable? True, para masabi mong sulit sa top rank. True naman. Di ba? The most critical. Di ba? Yun yung unahin mong i-treat sa ER. Letter cat. Letter cat. Number 7, one of the injured passengers brought in was unconscious and has multiple trauma. Using the 5-level emergency severity index, how soon should the nurse injured be seen by a physician? Unconscious and multiple trauma. Kapag unconscious, maatik ba unstable yan? Yes or no? Yes. Kapag unstable, maatik ES1 under your resuscitation. Letter boy. Okay, letter boy. Letter boy. Ano ba yung mga ES1, ES1 or ESI? Okay, your ESI1 is what you call your resuscitation. Kadalasan ito yung mga naka-cardiac arrest, mga unconscious, unresponsive, seizure. Meron siyang shock or sepsis na may hypoperfusion, anaphylactic reaction, and respiratory failure. Ito yung mga ini-intubate agad-agad. Intubation agad-agad. Ito yung mga possible mo mag-arrest agad-agad. Your ES2 or ESI2, your emergent. Ito yung may mga sign of stroke, blindness, chest pain, lower airway obstruction, severe pain, profuse bleeding, major head trauma, abnormal vital signs, suicide, and febrile more than 38, some less than 28 years old patient. Ibig sabihin pag done na. Done na mag-screen cap. Next, your ES3. Pag ES3, ito yung meron kang multiple resources na kailangan. Like your abdominal pain, vomiting, mild asthma, allergic reaction, diarrhea, vaginal bleeding, fever, and your palpitations. ES4 mo, ito yung naman less urgent. Isa lang yung resource na kailangan mo dyan. For example, may trauma, back pain, headache, crashes, painful urination, muscle pain, and ankle injury. G. Ito na. Your non-urgent. Sore throat, rabies, simple wound, NGT insertion, sore eyes, prescription refills, change of FC, and cough and coats. Grabe yung sore eyes na magpapa-ER ka para sa sore eyes. Mamin kayo na ganyan kayo, no? Mamin kayo dyan. Tapos gusto nyo priority kayo. Done na. Next. Oh, you do an emergency assessment of one of the injured passengers. Which assessment should you take? Priority. Kapag nasa ER ka, anong prioritization mo? Letter cat. Airway. Tapos breathing and your circulation. ABC tayo, di ba, kapag nasa ER? Airway, breathing, and your circulation. Number 9. You take vital signs of the injured passengers. Which of the following vital signs indicate the person is experiencing hypovolemic shock? Kapag nagsashock yung patient mo, anong classical signs and symptoms kapag nag-hypovolemic shock or shock yung patient mo? Hypo, tachy. Tachy, anong tamang sagot dito? Letter dog, di ba? Mataas ang pulse rate mo hanggang 60 to 100 lang, 110 siya. RR mo 12 to 20 lang pero nasa 26. BP mo ang normal mo dapat at least 90/60 pero kanya 80/60. Hypotension. Okay, paano malalaman kapag septic shock versus hypovolemic shock? Paano malalaman na septic shock siya? How would you differentiate septic to hypovolemic shock? Paano malalaman na ay septic shock to? Kapag febrile yung patient mo. Taas ng temperature. Yes, kapag hypovolemic shock, paano mo nalalaman na hypovolemic shock siya? Kapag kadalasan cool as compared. Yes, pag cool or clammy skin yan. Okay. Number 10, one of the male passengers sustained a concussion during the accident. He appeared to be disoriented and restless. Kapag disoriented, restless, anong priority mo? Yes, hypotachy-tachy pa din ang mo. Septic shock mo, pero kadalasan febrile yan. Okay, kadalasan febrile. Pag disoriented at restless ka, anong priority mo kay patient mo? Safety. Kasi risk for injury. Okay? Risk for injury, letter dog. Okay, letter dog. A 30-year-old male fell from a tall building while doing construction work. He is conscious, apparently alert, but could not move his legs. Wait lang. Sorry. Move his legs. His co-workers called for the paramedics for emergency assistance. When planning to move a person with possible spinal cord injury, the primary concern of the paramedics would be to. Primary concern mo dyan, syempre, diba? Hindi yan pain. Okay? Yes, pain is your primary, pero hindi ito priority mo. Comfort, hindi rin kasi almost same answer sila ni letter boy. Correct answer is letter dog. Bakit mo ipaprotect or immobilize ang head at neck? Bakit? Anong possible complication yan? Kapag ganyan, bakit mo kailangan? Pwede ba siya magkaroon ng spinal cord injury or cervical spinal cord injury? Diba? Pwede siya magkaroon ng cervical spine injury. So letter dog. Okay. Kapag natamaan yung cervical spine mo, anong possible mangyari? Possible mangyari kapag natamaan. Respiratory problem. Diba? Magkakaroon ka ng paralysis. Diba? Quadriplegic. Pwede ka din magkaroon ng respite distress. Kaya mo inaalagaan yung head and neck mo. O number 12, the victim is brought to the emergency department of Hospital X. The physician assessed the client. The client is confirmed to have a spinal cord injury pero hindi mo sure kung saan. Which of the following is the most or would be the most important nursing intervention during the acute stage of client's care. Pneumatic yan. Pwede siya mag-respire distress ba dito? Yes or no? Yes. So, kailangan mo ma-secure ang kanyang airway. Okay? Letter dog. Magre-reposition ka ba every 2 hours? Hindi mo to priority B. Okay? Pwede mo next assessment mo is yung vital signs and your monitor alignment. Pero at this point in time, ang priority mo, airway ng pasyente mo ang priority mo. Okay? Airway ang priority mo. A physical therapist prescribes range of motion exercise for the client with assisted ROM exercise for the arms as part of the client's regimen, which observation by the nurse would indicate treatment is effective. Paralyzed yan, magagalaw pa ba niya? Yes or no? Magagalaw pa ba yan kapag paralyzed na? No. Diba? X to B. Okay, absence of tissue ischemia over bony prominences. Ito, most probably, kapag bony prominences, pwede ba tumaling to your pressure ulcer? Yes. ROM ba ang solusyon kapag ano? Pressure ulcer? No. Turning yan, B. Turning. Okay. Correct answer is letter apple. Absence of your paralytic drop. Ano yung paralytic drop? Ano yung paralytic drop? Ano kaya yun? It is also known as your foot drop. Okay, foot drop. Di ba dapat ang paa mo nakaganyan? Ang tendency, para sila nakatipon, gumaganyan yung paa nila. Okay, another way to relieve your foot drop or to prevent your foot drop, ano kaya? Ano yung mga pwede mong gawin pa para ma-prevent ang foot drop? Ano kaya? Sprint. Pwede ka maglagay ng sprint. Evidence-based practice po, isa sa mga evidence-based practice, lagyan mo ng rubber shoes. Lagyan mo ng rubber shoes yung pasyente mo. Hindi yan magpo-foot drop. Okay, evidence-based practice siya. Okay. Next. The fracture is repaired by the orthopedic surgeon. As soon as the healing takes place, daily physical therapy sessions are scheduled that includes tilt table. Okay, ano po bang ginagawa ng tilt table? For example, ito yung initial mo, flat. Ang tilt table, ang tendency niya, mag-rotate yan hanggang maging ganyan kataas or pwede minsan 90 degrees na siya. Hindi man 90 to. Yan, pwedeng ganyan. After the pain therapist places the client at 45-degree angle. The nurse should monitor the client which of the following. Ano kaya? Expected mo ba hypertension, hypotension kapag ganyan? Nag-tilt table ka, biglang itatayo yan, di ba? Tendency niyan, sanay yung katawan, naka-flat, pwede mag-hypotension yan. Kapag nag-hypotension ba, mag-facial flushing ba si patient? Mamumula ba siya o mamumutla? Putla yan, B. Mamumutla yan. Correct answer is letter dog. Dizziness. Okay, dizziness. No, for the kilo ang person, B. Tapos bigla siyang gaganon. For the lightheadedness. Kasi anong possible meron dyan? Orthostatic hypotension ba yan? Yes or no? Pwede bang orthostatic hypotension? Yes. Yes. After a month of therapy, the client begins to experience a muscle spasms. Which of the following statement is accurate? The leg spasms. Ano kayang tamang sagot dyan? Tingnan mo, paralyzed si patient mo. So, kapag may spinal cord injury yan, most probably hindi makakapag-walk. Okay? Hindi yan. Kadalasan kasi, kapag nagkaroon ka ng paralysis, okay? Kapag nagkaroon ka ng paralysis, sa spinal level mo, hindi na nakakontrol. Okay? Hindi na nakakontrol yung brain function mo. Kaya nagkakaroon siya ng excitatory nature. Kaya siya nagkakaroon ng spasms. Correct answer is letter dog. Occur from muscle reflexes and they cannot be initiated or controlled by the brain. Letter dog. Okay, letter dog. Letter dog. Next. Healthcare professionals or personnel include nurses are part of a team trained to respond to disaster that may occur in the community. The following questions relate to disaster preparedness. In disaster preparedness, which of the following is the responsibility of the nurse? The nurse, tamang sagot. Ay, tamang sagot dito. Letter, anong priority mo kapag disaster preparedness? Triaging ba, yes or no? Yes, triaging, letter dog. Okay, assist with triage and emergency healthcare needs of the injured or those involved in this disaster. Diba? Letter dog. A disaster preparedness plan is a formal plan of action for coordinating and the response of a healthcare personnel, local government unit, and other trained personnel in the event of a disaster. Which of the following is not true about disasters? Okay, kapag may disaster ba, nag-work ba ang mga interagencies, yes or no? Yes, ano yung mga pwedeng involved na agencies kapag ganyan, pag may disaster? Ano yung mga example ng mga agencies na pwedeng ma-involve? NDRRMC, ano pa? LGU, what else? DOH, yes, what else? Red Cross, what else? Bureau of Fire Protection, pwede ba? DSW, pwede din. DSWD. Bureau of Fire Protection, yes. Okay. Disaster are natural events that cause destruction, yes or no? Yes. Pwede din ba itong gamit ang human-made errors? Pwede din ba human-made errors? Yes. Pero nakakontrol mo ba ang disaster? No. Letter cat. Okay, letter cat. Letter cat. Which of the following concepts best describe your reverse triage? Okay, kapag reverse triage, anong principle ang sinusunod natin? Utilitarianism ba, yes or no? Utilitarianism, yes. Ano yung sabihin ng concept na yon? It is letter dog. Do the greatest good for the greatest number of people. Okay? Di ba kadalas kapag reverse triage, anong isi-save mo? Yung mamamatay na o yung stable? Kapag reverse triage, yung stable ang priority mo. Okay, stable ang priority. Letter cat. Letter cat. The nurse in disaster situation classify victims according to the following except, okay, tatlo yan. Okay, when it comes to your classification of your victims, tatlo tayo. Your severity of your injury, the urgency of your treatment, and the place of your treatment. Except ang hinahanap natin, tamang sagot is letter boy. Okay, again, kapag nagka-classify ka ng victim, tatlo dapat ang kakonsider mo. Your urgency of treatment, severity of your injury, and your place of treatment. Correct answer sa number 19 is letter boy. Letter boy. Number 20. A nurse is the first responder in the disaster scene. The nurse should first, ano yung gagawin mo? Kapag ganyan, pag first responder ka, okay, according to Saunders, kapag first responder ka, anong gagawin mo? You, care for the victim muna. Okay, care for the victim with life-threatening problems. Kapag dumating na yung ibang rescue workers, doon kayo magsa-start mag-triaging. Okay, again, if the nurse is the first responder to a disaster, the nurse cares for the victims by attending to the victims with life-threatening problems first. When the rescue workers arrive at the scene, doon na kayo mag-start mag-triaging. Correct answer is letter cat. Letter cat. Letter cat. Nurse Febe is a charge nurse in the oncology unit. She applies principles of leadership and supervision in the management of Lion's environment. Nurse Febe is aware that control of Environment is a nurse responsibility, which among the following is the biggest problem of hospitalized clients. Anong tamang sagot dito? Ano kaya? Siyempre, letter boy. Ano kaya yung mga source of noises? Ano yung mga source of noises kapag ganyan? Yung mga hospitalized client. Yung mga example. Machines. Diba? Ano pa? Yung bantay din naman, pag nagkakwentuhan yung bantay, umamin kayo dyan. Diba? Yung nurse. Pwede din ba yung nurse? Umamin kayo. Totoo naman. Diba? Yung nurse. Diba? Kahit yung oxygen, maingay din ng oxygen mo. Diba? Siyempre, pag yung mga may latest chika dyan, latest chismis, mag-iingay ba yung mga nurse? Yes or no? Yes. Diba? Hindi mawawala ang chismis sa lalo na pag-endorsement. Hindi mawawala ang chismis. Diba? Ano dapat na una? Chismis or endorsement kapag nag-endorsement? Ano unahin mo? Chismis muna, B. Yun muna ang una. Diba? Pwede naman habang nag-endorsement, sisingit mo yung diba? Pwede mo naman unahin ang chismis muna. Para yun yung para mas mabilis yung endorsement. No? Para mabait yung ka-endorsan mo, yes or no. Sige, okay na yan na kasi natapos mo na ang chismis. Diba? Okay na yan. An ideal environment for the hospitalized clients should be infection-free. True. Which of the following infection protocol is the first line of defense against infection? Tamang sagot. Diba? Number 1 yan, syempre dapat ma-prevent mo lahat. Diba? One thing to prevent everything is letter dog, your hand hygiene. Okay, letter dog, hand hygiene. A staff nurse delegates routine morning care of a client to a nursing aide. The person most responsible for the safe performance of the care is, okay, sa ano kaya yan? Ang dito, most responsible, di ba? Ang most responsible pa din. Responsibility na yun ni nursing aide. Pero kasi ang hinaharap mo dito, most dapat. Sabihin kapag most responsible, kung sino yung nag-delegate pa din. Okay, kung sino pa din yung nag-delegate, letter cat. Okay, letter cat. Okay, letter cat. Number 24. The most important why a nursing aide must fully understand how to implement a delegated procedure is because the nurse aide must be able to, pwede ba magturo si nursing aide kay co-nursing aide niya sa procedure, yes or no? Pwede ba magturo si nursing aide sa no. Si staff nurse dapat yon. Okay. At don't perform the procedure quickly. It is a, nursing aide focus kasi siya. So, hindi ito. Explain the procedure to the client. Pwede ba mag-health ed ang nursing aide mo? Yes or no? No. Nade-delegate ba ang nursing ed? Health ed? No. Correct answer is letter dog. Letter dog. Hmm. 23 is letter cat. Cat. Nurse Febe makes the daily case assignments of subordinates and strictly monitors their activities and decisions. This is an example of what type of leadership style? Strictly monitor. Kapag may nabasa kayong strigmatic, authoritarian yan. Diba? How about your bureaucratic? Ano yung bureaucratic po? Ano yung bureaucratic? Ito yung nakasenter siya to your by the book. Yeah, pwede by the book, rules and regulations. Okay, how about your democratic? Ano yung ng democratic mo? May input ba yung mga staff, yes or no? May input yung staff, tapos nakikinig ba si leader? Yes, nakikinig si leader. How about si laissez-faire? Ano meron kay laissez-faire? Wapakels ba si si leader? Wapakels si leader? Yes. Okay. Sila staff lang po ba yan? Yes. Kasi kadalasan yung mga staff mo, empowered na ba yung mga staff mo dyan? Kumbaga mga na sila? Yes. Okay. Sila na bahala dyan. Next. Miss Marcia is a nurse supervisor of 3 departments in Hospital X. She attends orientation on seminar on hospital records management. Miss Marcia understands that good client care relies on good record keeping, which of the following is not the purpose of the hospital. Siyempre, provides hospital accountability. Yes, to. Okay? It is for research and statistical reports. Yes. Okay? Yan ang isa din sa mga reasons kung bakit. And provide data on health information system. Marito is letter dog. Diba? Personal information. Dapat wala dyan personal information nila doctor pati nila nurse. Diba? So letter dog. Letter dog. '27. Miss Marcia is aware that when a client is readmitted to a hospital, the client's file is retrieved from the tamang sagot. Physician matic wala dito. Civil service hindi rin to. Ang hospital library record file mo, mga libro to B, mga libro yan, mga sources mo, letter cat. Naulit ba sa number 28, yes or no? Naulit ba yung number 28? Naulit yung number 28? Yes. Sir, may chance po ba maulit sa sa board exam? May chance bang maulit sa board exam yung mga tanong? Feeling niyo may chance? May chance maulit ang tanong sa board exam? Yes. Meron po. Opo. Meron. Board exam ko mismo November 2019. Ang board exam November 2019. Parang NP3 ata yon. NP3. Tapos Palmer ang tanong. Hindi ko alam ang sagot. Siyempre, natira ako sa dalawang sagot. Siyempre, for the hulaan person. Okay, for the hulaan person. Tapos, hindi ko siya sinearch kasi ruling ko nung board exam, nung day ng board exam ko, hindi ako magbubukas ng phone, hindi ako magsa-search ng sagot. Hindi ko rin bubuksan yung libro ko. Okay. Come the next day, pagka Sunday, NP4 ata yun or NP5, hindi ko na alam, basta magka-opposite day yun. Lumabas ulit yung ganong tanong. Same question, same choices. Alam mo ginawa ko? Iniba ko yung sagot ko. Yung isa, yung isa, letter A, yung isa, letter boy. Para more chances of winning. Okay? Kaya kapag hindi nyo talaga alam yung sagot, ibahin nyo yung sagot. Okay, ibahin nyo yung sagot. Pero syempre kapag 100% sure kayong sagot nyo, ano pa din, yun na yung gawin nyo. Okay, ganun gawin nyo. Okay? Kasi keto nandito kasi expected pa umulit yung mga tanong. Okay, baka umulit yung mga tanong. Para lang may strategy lang kayo, para lang meron kayong test taking na, ay ito, hindi ako sure, ito na lang ulit sagutin ko. Ibahin niyo yung sagot, dahil na kapag hindi talaga kayo sure. Okay, answer sa number 20, it's letter cat. Letter cat. Yeah. Ito din tatandaan nyo, one of the things na kailangan nyo tandaan, pag nag-board exam kayo, hindi lahat ng tanong sa board exam alam nyo. Hindi lahat ng topics sa board exam alam nyo. Yes, yun. Totoo yun, promise. Okay, a good example for me, first-hand experience ko, hindi ako familiar nung lumabas yung board exam ko. Lumabas sa board exam pa na brand name. Meron doon, ano na lang yun, GI meds na lang hinahanap, GI meds, as in GI meds, gastrointestinal meds. Tapos, ang question nila doon, which of the following is not a GI meds? Parang ganun. Lahat ng choices, brand name. Eh, hindi ako familiar sa brand name talaga. Nung nagbo-board exam ako. Siyempre, for the hula ang person ulit. Okay, for the hula ulit ang person. Ganon. Ganon. Yeah, I do recommend for you to be familiarized when it comes to the board exam. I do recommend to be familiarized but not memorizing them. Be familiar lang po. Okay? Yes, normal makalimutan yung concepts. A good example again, na hindi ko alam na concept sa board exam, infectious polyneuritis. Hindi ko alam na GBS yun. Hindi ko din alam ba't di ko alam yun. As in, context clues lang ang ginawa ko ng board exam doon. Okay, hindi ko alam na ng infectious polyneuritis pala ay GBS. O ngayon, alam nyo na GBS yan. Yun. Familiar lang. Be familiar with it lang. Mas maganda maging familiar. Yes, familiar to pero walang ano. Ano yan? Familiarization lang talaga. Sub-sub ako sa aral noon. Oo, araw. Hindi naman. Meron kasi ako nung nag-board exam kasi ako. Hindi ako nag-aaral hanggang madaling araw. Alam ko na share ko na, hindi ako nag-aaral hanggang madaling araw. Hanggang 10 o'clock lang tulog na kapag 10. Tapos kapag Kapag walang pumapasok kung nag-aaral ako, walang pumapasok sa akin, natutulog ako. Hindi ko pinipilit sarili ko. Kasi matutulog ako. Nung board exam ko kasi, nung time namin na nagbo-boards ako, wala kaming recalls. Wala kaming recalls nun. Pre-boards lang kami tsaka closed door. Kaya hindi ko alam kung yung time ko, hindi ko alam. Ngayon, hindi ko alam kung may lumalabas sa recalls. Alam ko mga previous board exam questions kasi ito. Yeah. Okay. Miss Marcia is aware that when a client is discharged or dies, the following details should be entered in a client's record. Okay. Kapag namamatay yung mga pasyente nyo, importante dito ang letter apple. Okay, letter apple. Your letter C and D, nakukuha to kapag admitting. Admitting yan, kapag admitting orders yan, or admission ni patient po. Okay. Outcome classification. Siyempre, nandun na yung kung patay or buhay yung pasyente mo. Pero mas importante ang final diagnosis. So, letter boy. Letter boy. Importante siya. Yes, ilalagay siya sa death certificate. On the following questions, our statements are true about patient and hospital records except. Siyempre, confidential records to. Okay, confidential lang hospital records mo. May right si patient magkaroon ng confidential treatment of information and pwede mag-release basta meron kang court order. Correct answer is letter 29 please, letter apple. Letter C. Sino ba may-ari ng health records mo? Sino may-ari ng health records? Si hospital. Sino may-ari ng information? Si patient. Okay? Ang may-ari ng records mo ay si hospital. Ang may-ari ng information ay si patient. Letter cat. Miss Bella is a member of the Ethics Committee of Training Hospital. Prior to her acceptance to the committee, she was tasked to conduct a research. Nurse Bella is guided by the ethical guidelines in the conduct of research. She should apply which of the following principles? Privacy, yes. Okay, kailangan mo ng privacy kapag nagre-research ka. Kailangan mo ng fairly and justly, that is your justice. Kailangan mo ng non-maleficence. Kailangan ba lahat ba ng research subjects mo magbigay ng informed consent, yes or no? Kailangan ba nila lahat magbigay ng research? Sa research, yes. Requirement yun, letter cat. All of the options. All of the options. 32. Nurse Bella understands the principle which impose a duty in the researcher to minimize harm and maximize benefits. Ito yon, minimize harm. Mas nananaig si benefits. That is your, letter dog. Benefits. Ano yung non-maleficence mo? Ano yung non-maleficence? Non-maleficence is 31 points, letter cat. Do no harm, 'di ba? Do no harm, confidentiality. 'Di ba? Non-maleficence mo is do no harm. Okay? Confidentiality is protecting the information. Okay? Data information 'yan. Okay? Protecting the data information. Minimize harm kasi but maximize benefits kasi. 'Di ba? Your beneficence kasi ay by definition kasi talaga your benefits is to minimize harm and maximize benefits. Yun talaga siya. Pero kapag nakalagay pag nakalagay is do no harm, doon ka non-maleficence. Okay? The principles of justice connotes which of the following? Tamang sagot. It is your letter apple. Ang equity kasi, ang fairness, sabihin patay-patay, ang equity mo, it would depend on the need of the patient. A good example niyan, kung wari ang equality, you gave everything same. 5-5-5 yan. Ang equity mo, yung mga pasyente mo, bibigyan mo sa depending on their need. Okay? Bibigyan mo sa depending on their need. That is your equity. Okay? Correct answer to number 33 is letter apple. Apple. Which of the following code of conduct has endured through the years of ages? Di kapag ganyan, wag mo nang anuhin. Di ba? Wag mo nang anuhin si Lord. ibigay mo na letter C, ibigay mo na 10 commandments. Okay. Letter C, 10 commandments. Number 35, Nurse Bella is aware that the participants in the research should give their consent. The following are vulnerable subjects incapable of giving informed consent. Vulnerable subjects. Yan. Ibig sabihin, hahanapin mo, ano ba yung mga vulnerable subjects? Institutionalized person, yes or no? Institutionalized persons, yes. Ano ba yung mga example ng mga institutionalized person? Yung mga nasa, mga nasa kulungan, ano pa? Yung mga nasa, with mental illness, what else? Yung mga nasa home for the aged, institutionalized din yung mga yan. Mga orphanage, di ba? Pregnant women also your vulnerable subjects. Bakit? Kasi meron siyang batang dinadala, okay? Siyempre, your minor age, letter dog. Nasa rehab is also an example of your institutionalized person. Correct answer is letter cat. Letter cat. Pero hinahanap mo kasi ito, vulnerable subjects. Vulnerable subjects. Okay. So most probably ba, incapable. Incapable. Sabihin, anong mas pipiliin mo? Physically and mentally able person or pregnant women? Ano mas pipiliin mo dyan sa dalawa? Siyempre yung letter C. 'Di ba? Sila yung mas capable. Okay. 'Di ba? So letter C. At the same time, you are looking for the vulnerable subjects. Okay, your vulnerable subjects. Next, a 54-year-old female was admitted to the emergency department for crushing, substernal pain, diaphoresis, and nausea. The tentative diagnosis of the physician is myocardial infarction. The nurse in the emergency department understands that pain experienced by the client is due to which of the following? Diba, myocardial infarction. Ang tendency ba, kamusta ang perfusion mo? Kamusta ang perfusion mo? Sa heart. Decreased perfusion. Decreased perfusion, yan. Okay, kapag decreased ang perfusion mo, ano nangyayari? Pwede ba siya mag-lead to your anaerobic metabolism? Yes or no? Anaerobic, sabihin ito, walang oxygen. Anaerobic metabolism. Pag nag-anaerobic metabolism ka, ano napaproduce? Ano kayo napaproduce kapag nag-anaerobic metabolism? Lactic acid. Okay, lactic acid. So your lactic acid irritates your nerve endings. Okay, nerve endings. Correct answer is letter boy. Letter boy. Letter boy. Next, 37. The initial action of the nurse to client is to nag-ano na to be myocardial infarction. Hindi mo priority ang hindi mo masyadong priority itong complete. Hindi mo importante ang complete to just get the pertinent informations. Okay? So, prior mo ilagay sa coronary care, may mas kailangan kang gawin. And your intravenous infusion bago yung bigay. Letter dog. Administer pain medication prescribed by the physician. Anong bibigay mong gamot? Anong bibigay mong? Morphine. Ba't ka nga ba magbibigay ng morphine? Ba't ka uunahin mo yung pain medication? Vasodilator, yes, pwede. What else? Diba? Kapag nagpe-pain ka ba, increase ba ang RR mo? Increase ba ang respiratory rate? Yes. Nag-increase ba ang oxygen demand mo? Yes or no? Increase ang oxygen demand mo. Tendency mo, magkokonti ba yung perfusion sa heart mo? Yes. Okay? Mas magli-lead dyan to your furthermore pain. Kaya ka nag-letter dog. Diba? Pag na-administer yung pain medication mo, ma-relief yan. Okay? Lesser yung oxygen demand mo. Okay? Lesser yung oxygen demand mo dyan. Letter dog. Okay, letter dog. The nurse is aware that the area of the heart that is most damaged in myocardial infarction is ano? Ano kaya? Ang pinaka-common mo kasi is your left anterior, left anterior descending artery. Okay, your left anterior descending artery. Correct answer is letter cat. Okay. MI always occurs in the left ventricle, often significantly depresses left ventricular function. This is due to the occlusion of the left anterior descending artery. This is referred to as your anterior wall infarction. Letter cat. Letter cat. "39, the nurse writes a nursing diagnosis. Which of the following priority nursing diagnosis during the 24 hours, first 24 hours following your myocardial infarction?" Okay. Ano ba unahin mo dyan? Physiological or psychological nursing diagnosis? Physiologic or psychological? Physio. X mo to, B. Okay. Meron ka bang cues for your high risk for infection? At the same time, risk, unahin mo yung actual. Okay, unahin mo yung actual. Fluid volume deficit or impaired gas exchange. Di ba? Perfusion problem to. Perfusion problem ka. Unahin mo na si impaired gas exchange. Tanong dyan, nagpo-fluid volume deficit or excess yung patient mo? Excess or deficit kapag nagmamyocardial infarction? Ano sa tingin nyo siya pwede mag-lead sa excess? Okay, excess. Kasi kamusta yung pump ng heart mo? Pangit ang contractions mo. Sabihin niya, maganda ba perfusion mo sa kidney? Yes or no? Maganda ba perfusion mo sa kidney? No. Kapag pangit ang kidney perfusion mo, kamusta urine output mo? Kamusta urine output mo? Onte, nalalabas ba niya yung fluids na dapat ilabas? No. Kaya ka nagkakaroon ng fluid volume excess. Letter cat. The nurse admits the client to the coronary care unit. Which of the following included in the admission process? Tandaan nyo kapag admission process, paperwork yan kadalasan ang focus mo. Siyempre, matik, wala ka namang concern, hindi mo na contact si supervisor. Si family din, hindi mo rin ito priority. Diba? Same time, hindi mo na din yung saan mag-stay kasi, diba? CCU yan. Most probably, hindi pwedeng bantay dyan. Okay, hindi pwedeng bantay dyan. Correct answer is letter cat. Letter cat. Letter cat. The nurse in the emergency department admits a 45-year-old female for vomiting blood. According to the family member who accompanied the client had gastric ulcer for several years. The nurse assessed the client is in shock. Shock daw siya, gulat, charot. Which of the following assessment findings indicate hypovolemic shock? Sabihin niyo to, okay? Hypovolemic shock, start. Initial siya. Okay. Ano ba yung mga usual? Initial shock. Anong manifestation mo kapag nag-initial shock yung patient? Ano yung mga initial mo? Kamusta blood pressure? Increase or decrease kapag initial shock? Increase ang BP mo. Increase ang BP mo niyan. Kamusta heart rate mo? Increase or decrease? Increase pa din ang heart rate mo. Okay? And increase ang RR mo. Classical manifestations po, classical. Ba't mag-i-increase? Ano bang tendency ng heart mo? Gusto ba niya i-force? Gusto ba niya mag-compensate? Yes or no? Gusto ba mag-compensate ng heart mo initially? Yes. Okay? Ang one way to compensate ng heart mo is increase na yung BP niya para magkaroon siya ng magandang perfusion. Yes or no? Yes. Okay? So, classical signs mo ng mga shock mo is dyan papasok si hypotachy-tachy. Okay? Hypotachy-tachy. How about your di ba? Una yan, magko-compensate yan. Okay? Tapos, aabot yan sa decompensatory mechanism na siya. Ibig sabihin niyan, late sign of shock na siya. Okay? Ano yung mga late signs mo ng shock? Kamusta BP mo? Kamusta BP mo? Low. Decrease na ang BP mo niyan. How about heart rate mo? Kamusta heart rate mo? Increase pa din po ba kapag late sign or bababa na din yan? Decrease na din ang heart rate mo niyan. Okay, tapos decrease din ba ang RR mo? Yes, decrease na din ang RR mo. At this point in time, we can infer na sa initial shock pa lang ba yung patient mo? Yes or no? Initial shock pa lang ba siya? So, kamusta ang SBP mo? Mataas or mababa? Mataas, mababa ang SBP mo nito? Mataas pa kasi nag-initial shock pa lang yung patient mo. Okay? Pupils are unequally dilated. Most probably, kapag unequal dilated to, meron kang brainstem damage. Okay? Brainstem damage yan. Okay? Brainstem damage yan. Diba? Initial shock mo, mataas or mababa pulse rate mo? Mataas din to. Okay? The best answer is letter cat. Okay? Letter cat. Okay, letter cat. Usually, nag-hyperventilate. Takipnik ba yan? Yes or no? Yes, takipnik yan sila. Nag-hyperventilate yan sila. Kapag nag-hyperventilate yung patient mo, anong manifestation niya ng ABG? A result of your arterial blood gas analysis to indicate which of the following conditions. Meron siyang respiratory alkalosis. Letter apple. Okay, letter apple. O, kapag nagsashock yung patient mo, metabolic alkalosis, metabolic acidosis. Ano kaya feeding nyo? Metabolic acidosis. Okay, acidosis yan. Metabolic acidosis. The physician orders your intravenous infusion of your packed red blood cells. The normal saline solution and normal saline solutions. The nurse assess the client for which of the following. Kasi ang tendency mo nito, wala ka ng output, tapos may tissue damage ka pa, nag-hyperkalemic ka pa, one way din, kaya ka nagme-metabacidosis. Since nag-ano siya, respiratory alkalosis, on one way mo to compensate is metabolic acidosis para ma-compensate mo yung respiratory alkalosis mo. Okay? The nurse assesses the client for which of the following. O, kapag nagbibigay ka ng blood, hypervolemia, hypovolemia. Hypervolemia. Okay? This one, your altered level of consciousness, hindi rin to kasi kadalasan nagmamanifest. Your pain, pwede siya. Pwede ang pain mo, pero mas importante at mas critical lang anaphylactic reaction mo. Okay? Diba? Crucial ba ang first 15 minutes? Yes or no? Crucial ba ang first 15 minutes? Yes, kaya mo babantayan yung patient mo kasi pwede siya magkaroon ng anaphylactic reaction. Okay, letter boy. Letter boy. The nurse understands the best indication that fluid replacement. The best indication of fluid replacement for the client with hypovolemic shock is adequate is when kapag hypovolemic shock, di ba bumabagsak yung blood pressure niya? Kasi wala siyang blood volume. Okay, wala siyang blood volume. So ang tendency mo, magbibigay ka ng blood volume. Kamusta yung perfusions mo? Gaganda ba yung mga perfusion mo sa organs mo? Yes or no? Yes or no? Yes. Okay. Ano bang normal urine output natin? Normal urine output natin? At least 30 ml per hour. Okay? Correct answer is letter dog. Okay, letter dog. Kapag adult, at least 30 ml per hour. At least. Okay, at least 30 ml per hour. Yan yung upper limit mo kapag adult patient ka. Letter dog. Number 44, sorry. The physician schedules the client for surgery within 6 hours. The nurse minimizes anxiety of the client by answering clients' questions regarding surgery. Okay? Regarding the surgery, calm manner. Keeps the client warm. Bed rest and dims the light. Anong pinapromote ni nurse dito? pinopromote mo dito, Matic, it's the comfort. Letter apple. Okay, letter apple, increase the comfort of the client and her family. The Nurse Summers works in the oncology unit. She takes care of cancer patients in pain. She is aware that cancer pain management is one of her responsibility. Nurse Summers plans for cancer client experiencing pain. Anong goal mo kapag may cancer pain? May pain or wala? Anong goal mo? May pain or wala? No pain. Okay, wala kang pain. She is aware that an important principle of using medication to manage pain is to, syempre, avoid giving clients addictive medications. Kasi kadalasan naman talaga, yung mga pain meds mo is addicting. So, hindi mo talaga siya may iwasan, kaya ka nagko-control. Okay. Discontinue the medications periodically? No, hindi rin po. Diba? Kasi ang goal mo sa mga cancer patients is to relieve the pain. Anong tamang sagot? Tamang sagot, letter, ano kaya? Ang question ko yung letter boy, provide the medication as the client request for it. Pag nag-request ba yung client mo ng pain meds, may pain ba siya or wala? Feeling nyo, may pain ba siya or wala? Meron. Ano bang goal natin ulit kapag may cancer, pag may pain pag cancer patient na may pain? Wala siyang pain. So feeling nyo ba? Okay, yun yung letter boy. Yes or no? No. Kasi, di ba, nagkakaroon siya ng pain, important principle. Di ba, important principle, yes. Di ba, wala to. Correct answer mo is letter apple. Okay? Mas better answer si letter apple. Binago ko talaga yung sagot dyan kasi individualized yan. A good example is that pain is usually subjective and highly individualized. Yes or no? Ang pain mo ba, highly individualized ba yan? Yes. A good example niyan, dalawang patient mo may colorectal cancer. Same ng diagnosis, same ng progression. Isang patient mo, mababa pain tolerance. Isang patient mo, mataas ang pain tolerance. Sa tingin niyo ba magkapara sila ng pain management? Yes or no? No. Okay, hindi. Okay? Kaya ang tanong kadalasan dyan, kapag yung mga cancer patient nyo ba, kadalasan, ano mas preferred nyo dapat? PRN medication or round-the-clock medication? Para ma-clarify natin when it comes to the pain management. Round-the-clock or PRN ang i-recommend nyo? Round-the-clock. Okay, bakit mag-round-the-clock ka? Okay? Kasi kapag round-the-clock ka, nauunahan mo ba yung pain? Nagkakaroon ba ng pain yung patient? Yes or no? Nagkakaroon ba ng pain? Wala. As compared to your PRN medications, hihingi lang ba siya ng pain meds kapag may masakit? Yes or no? Yes. Diba? Di ba nga cancer pain nga yan? Diba pag may pain nga, ayaw mo nagkakaroon ng pain. Diba? Kaya unahin mo ang by the clock rather than your PRN. Okay? Another question dyan is, anong uunahin mo? Ano mas preferred mo? Per ORM or IV medication? Per ORM or IV medication? Ano kaya mas priority mo? Pag IV medication, tutusok ka ba? Mag-i-induce ka ba ng pain? Yes or no? Mag-i-induce ka ba ng pain? Yes. So nag-introduce ka pa ng pain. Ano unahin natin? Per ORM o IV? Per ORM. Mas priority mo ang per ORM. Diba? Per ORM na priority mo dyan. Okay? How about IM injection? Do you recommend IM injection? No, kasi masakit pa din siya. Okay, masakit pa din siya. Kaya papasok dito yung by the ladder natin. Diyan papasok si mild, moderate, and severe pain medications mo. Siyempre, magsa-start ka muna sa non-opioids mo. Yan yung mga NSAIDs and COX-2. Your mild opioids na dyan si tramadol, hydrocodone, and yorcodane. Okay, your strong opioids mo na dyan sila fentanyl, morphine. Okay? Yan yung WHO analgesic ladder. Okay, sabihin niyo kapag done na kayo mag-screen cap. Moderate pain, opioids for your moderate pain, codeine. hydrocodone. Diba? O next. Next na po ako. What about PCA? Your patient-controlled analgesics. A good example of your patient-controlled analgesics are your fentanyl and morphine. Okay, fentanyl and morphine. Kadalasan ng fentanyl at morphine mo, yan yung mga PCA. Ano po ba ang virtue ng PCA mo? Your PCA is a patient-controlled analgesics. Ibig sabihin nito, si patient to make control kung kailan niya gusto mag-press for the pain medication. Okay? Meron tayo mga dyan, we have your basal rate and lockout and rescue doses. Okay? Your basal rate, regardless, di ba ang PCA mo kasi ipipress ng patient mo yan, may button yung patient mo nakadikit sa kanya. Ang tendency niyan, meron silang basal rate, lockout, and rescue doses. Yung basal rate mo, regardless kahit hindi pumindot yung patient mo, may magbibigay sa kanya ng pain med sa kanya. May certain medication dyan, may certain milligram per hour. That is your basal rate. Your rescue dose, kung wari, biglang nag-pain yung patient mo, pag nag-press siya dyan, magbibigay sa kanya. That is your rescue doses. Okay, your rescue doses. Tapos, dyan papasok si lockout time. Ibig sabihin ni lockout time, a good example niyan, within 1 hour time frame, kunwari dapat, makakatatlong press lang siya. Kapag nakatatlong press siya within 1 hour, kapag nag-press pa ulit siya, hindi na siya mabibigyan yan. Okay, hindi na mabibigyan si patient ng ng pain meds. At the same time, kapag lockout time, may specific duration or interval. For example, lockout time 20 minutes. Sabihin niya, pagka-press mo kunwari ngayon 9:40, nag-press ka na 9:40, ang next pa na magbibigay ng rescue dose sa'yo is 10 o'clock. That is an example of your rescue rate. Okay, yun ang PCA mo. Okay, addicting ba siya? No, hindi siya addicting. Okay, kasi ang tendency ng PCA mo, binababa nila doctor yan. Nurse Summers collaborates with the physician in the development of drug regimen for the clients. Which of the following medication should be avoided in the treatment of your cancer pain? Tamang sagot. Di ba? Your morphine is for your severe. Okay, severe yan. Your meperidine or Demerol is for your severe. Hydrocodone is also for your moderate. Okay, bakit hindi ka magbibigay ng acetaminophen? At ayaw mo ng acetaminophen? Bakit kaya? Di na ba effective? Or dahil pang mild pain lang siya? Yes or no? Ano pang other function ng acetaminophen? Diba? Acetaminophen is also known as your paracetamol. Ano pang paracetamol is antipyretic. So kapag nagbibigay ka ng paracetamol kay patient mo, magkaka-fever ba siya? Yes or no? Magkaka-fever ba siya? Hindi. Di ba pag cancer, ang ayaw mo sa kanila infection? Diba? Ayaw mo sa kanila infection. Diba? Ayaw mo sa kanila infection. Ano bang classical manifestation ng infection? Fever. Okay? So kapag nagbibigay ka ng acetaminophen, namamask niya yung fever. Diba? Namamask niya. So, ang tendency, ma-alert ba kayo na mayroong infection yung patient nyo na may acetaminophen? Hindi. Mamamask niya. Kaya ayaw mo na acetaminophen. Okay? Kaya we don't recommend or we don't usually give acetaminophen. Hindi kasi siya, not necessarily mean na mild pain siya. Okay? But more of, imamask kasi niya yung fever mo. Okay? Imamask niya yung fever mo. Next, number 48, when titrating a drug for the client in pain, which of the following is the most appropriate? Letter dog. Seek a new order after 2 doses that do not achieve a tolerable level of pain relief. Kapag tuwing kailan ka ba magre-reassess ng pain after giving the pain medication? After 8 hours ba? Yes or no? No. Tuwing kailan ka magre-reassess? Tuwing kailan ka magre-reassess? Kung mali, IV medication binigay mo, ilang minutes, ilang hours ka magre-recheck? Ng pain scale. Kaya kung in pain pa siya, within 15 minutes yan. Okay, within 15 minutes. Okay, within 15 minutes. Kapag per orem medication, per orem meds, ilang minutes yan? 30 to 60 minutes ang recommend natin. 30 to 60 minutes. Okay, so letter dog. Number 49. One of the clients experienced severe intractable pain. Kapag severe intractable, nakakausap mo pa ba yan? Yes or no? Nakakausap mo pa ba siya? No. And complains of pain medication not working for him. So if the following action is the most appropriate for nurse Summer, makakapag-recommend ka pa ba mag-deep breathing yan? No. Hindi. Baka galit na yan kapag ganyan. Okay? Explore the nature of pain. Makakapag ganyan pa ba yung patient mo? No. Galit yan, promise. Okay? Support the client. Hindi rin to be. Best action mo dyan, mag-refer ka na kasi severe pain na yan. Refer the client to the attending physician immediately and report that the pain medication is not providing adequate pain relief. Okay? May experience nyo yan kapag sobrang in pain yung patient nyo. Grabe. Kulang na lang, magmura na sila. Nurse Summers assesses a client complaining of acute pain. The most appropriate nursing assessment would include which of the following? Assessment daw. Ano ba sabi ko pag best assessment for your pain? Best assessment for your pain. Ano ba dapat? Subjective or objective? Subjective palagi. Dapat po ba manggagaling kay patient or dapat observation mo? Galing kay patient mo. Okay, report ng patient letter boy. The client's pain rating. May pain rating. Mr. Cruz. Miss Cruz is a charge nurse of a medical unit. She is responsible for the management and supervision of the unit. Miss Cruz observed that one of the female staff nurses is not performing her duties very well. Which of the following strategies will she implement to assist the staff nurse? Correct answer, mas maganda bang kausapin mo muna siya? Yes or no? Kausapin mo ba? Yes. Letter apple. Okay, kausapin mo na lang. Okay. 52. Miss Cruz notes one of the male staff nurse is frequently absent and his absence have adversely affected the quality of care given to the clients in unit. Which of the following would be the best approach? Memo ba agad to? Yes or no? Memo? Wag muna, B. Grabe ka naman, ang harsh mo naman na manager. Termination. Termination. Ito-terminate mo na ba to? Hindi rin. Mare-record naman na kasi to. Naka-record na yan. Okay, correct answer is letter apple. Kausapin mo muna. Malay mo may sakit pala kaya pala siya absent. Hinihika pala. Diba? O kaya malay mo may problem sila sa family. Kausapin mo muna bago mo i-terminate. O diba? Bago mo bigyan ng termination or bigyan ng memo. Okay, para mag-meet halfway kayo. 53. True. Totoo yan. Hindi kayo i-terminate kasi understaff. TTIsin na lang ba yan? Yes or no? Yes, TTIsin nila yan. Kahit pa absent ka pa dyan. Diba? Miss Cruz assigns a new staff nurse to administer medication. Totoo yan. Hindi kayo kaya i-terminate. Hindi kayo kaya i-terminate ng mga person. The medications of a client. Which detail of the client? Drug therapy is the staff nurse legally responsible to document. Tamang sagot. Alam niyo ba lahat ng peak concentration ng drug? Yes or no? Alam niyo ba lahat ng peak concentration ng drug? Siyempre, hindi rin. Ako din, di ko rin memorize. Wala nga akong alam. Safe range ng drug. Umamin kayo dyan, alam niyo yung mga safe range ng drug. Ano? Hindi rin, B. Wag kang asyumera dyan. Okay? Client, socioeconomic status, no, then letter dog. Okay? Kailangan alam mo reaction. For example, a good example, carvedilol. Review tayo pharmacology, carvedilol. Anong i-check mo prior to giving the medication? Prior to giving the medication, anong babantayan mo? Heart rate and your blood pressure. Okay, heart rate at blood pressure. Pagkabigay mo ng carvedilol, ano na i-monitor mo? Ano kaya? Your heart rate, blood pressure pa din, B. Another example, furosemide. Prior to giving the medication, anong i-assess mo? Around the clock, 40 milligrams IV every 6 hours na furosemide. Anong i-monitor mo? Or ano i-check mo prior to giving the medications? Ano kaya? Feeling nyo, round the clock na siya. Okay, round the clock na, magpo-potassium ka pa ba? Pwede mo i-check yung potassium, pero may mas kailangan kang i-check. Diba? No, anong i-check mo prior to giving? Heart rate or blood pressure? BP. Bakit mo i-check yung BP? Bakit? Kapag nagbigay ka ba ng furosemide, iihi ka ba ng iihi? Yes. Kamusta blood volume mo niyan? Pwede bang bumagsak? Yes, pwede bumagsak. For example, magbibigay ka Furo 40, furosemide 40 milligrams IV now. BP ng patient mo, 90/60. Magbibigay ka or hindi? No. Babagsak yan, B. O pagkabigay mo ng furosemide, anong i-check mo? I-check mo. Siyempre yung urine output na. Okay, urine output na. Another example, vancomycin. Ano i-check mo? Pag vancomycin. Kidney function. Ano yung watch out for mo? Watch out for UO. Redman syndrome ba i-check mo? Redman syndrome. Yes. Diba? Yes, yun ang i-check mo. Redman syndrome. Diba? Redman syndrome, i-check mo kadalasan. Okay? 54. Miss Cruz decides what is best for recovering client and acts on the decision without consulting the client. Miss Cruz is applying a moral principle of what? Letter Apple. Diba? Without consulting the client. Nagdesisyon ka na for the client. Letter Apple. A 60-year-old male is admitted to the oncology unit. According to the client, he felt growth during the routine digital prostate examination. He complains of pain on urination and frequent urination. The function. The nurse understands that the function of the prostate gland is primarily to, letter boy. Okay, produce a secretion that aids the nourishment of the passage of the sperm. Letter Apple. Letter Apple. Ay, letter boy. Sorry, letter boy. Ano ba yan? Letter boy. Letter boy. On number 56, the nurse analyzes the laboratory values and notes the serum phosphate level is elevated. Kapag, tandaan nyo, kapag elevated ang serum phosphate mo, may problem yan. Most probably saan? Most probably saan? Sa bones. Okay? Pag mataas ang serum phosphate mo, most probably meron niyang bone problems. At the same time, kapag prostate cancer, isa sa mga unang pinagme-mets niya ay bone. Letter cat. Letter cat. Letter cat. The nurse knows that the hormone therapy is mode of treatment for a client with prostate cancer. The goal of this therapy or treatment is what? Kasi ang tendency niya, okay, hormonal therapy is usually given for your advanced prostate cancer. Suppresses your androgenic stimuli to the prostate by decreasing the circulating plasma testosterone. Kapag nag-decrease ang plasma testosterone mo, mag-atrophy siya. So letter Apple. Letter Apple. Letter Apple. the nurse writes a nursing diagnosis of fear and anxiety secondary to the diagnosis of prostate cancer. Which of the following intervention will be the best for the nurse? Oh. Letter Apple, keeping to himself lang. X. Positive outlook, di ba? Nagre-recommend ba tayo sa therapeutic communication? Yes or no? No, di ba? We don't recommend kapag therapeutic communication. Diba? Your letter boy kasi para siya nagpo-fall under what? Para siya nagpo-fall under objective mo. Okay? Ang best answer mo is letter dog. Okay? Letter dog provides spiritual support to the client. Letter dog. Bakit hindi letter boy? Kasi para siya established kasi is more of para nag-lead ka to your objective or your goal na. Okay? Mas objective kasi yung dating ng statement. Okay? Mas objective yung dating ng statement kasi. Ang hinahanap mo, interventions. Okay? Interventions ang hinahanap. The nurse cares for a female client who is terminally ill and experiencing pain. The nurse prepares a care plan for the client. The overall goal for the client is... Tamang sagot. Siyempre, di ba pag may ano yan, pag terminally ill at may pain, dapat gusto mo walang pain. Na-control yung pain and discomfort. Letter Apple. Apple. 60. The nurse is aware of the document that expresses client's wish for life-sustaining treatment in the event of your terminal illness or permanent unconsciousness. This document is the tamang sagot. It is your living will. May living will na ba yung mga person? Yung mga living will na ba kayo? Yung mga living will na ba kayo? Meron na? Wala. Ang ano mo, yung ipapamana ano? Last will and testament ang pamana mo, B. Okay? Yan ang pamana mo. Okay? Di pa na ay, meron na siya. Oh. Say mo lang, ano lang, living lang. Wala pang will to live. Diba? Ang no code order, ito yung ano, DNR, do not resuscitate. Okay, do not resuscitate. How about your durable power of attorney? Ano yung durable power of attorney? Ito yung meron kang representative. You appoint a person. You appoint a person. Appoint a person. Tapos dapat ba notarized to yes or no? Yes, notarized din dapat to. Okay, notarized dapat. Actually, kahit yung living will, dapat naka-notarize. Pati yung last will and testament, dapat naka-notarize yan. 61. The client nears death and requests for no medication be given that would cause of loss of consciousness, including the pain medication. Kakaawa. Diba? The nurse would promote the best end of life care for the client by which of the following? May nasabi bang family member sa situation, yes or no? May nasabi ba wala? X mo kagad yung letter Apple. Okay? Comfort is the highest priority. Magbibigay ka pa rin ba ng gamot kahit yun na yung wish ng patient mo? Bibigay mo pa din? No. Bakit? Possible ba yan ano? Battery kapag ganyan? Yes, pwedeng battery yan, B. Diba? Keys. Diba? Huwag ka din magbibigay ng half dose. Grabe ka naman. Okay, correct answer is letter cat. Letter cat. Respect the client wish and withhold the pain medication and other medications ordered. Kahit magalit yung family ba, magbibigay ka pa rin ba magbibigay ka ba ng gamot kahit pinipilit ka ng family, yes or no? No. Okay, kahit magalit yung family. As long as meron kang living will na hawak, meron kang proof na hawak, huwag mong ibibigay, B. Okay? Which of the following is true about terminally ill? Minimum physical care ba dapat? Di ba dapat nandun pa din yung physical care mo? Okay? Paliguan mo pa din yan. Papakainin mo pa rin ba sila, yes or no? Yes. Pakainin mo yan. Sarap kaya mag-alaga ng mga terminally ill clients. Okay? Healthcare personnel do not understand their own feelings about death and dying. Therefore, they avoid caring. Mas masarap mag-alaga ng terminally ill, promise. Okay, X to. Nakakasad siya siyempre. Pero mas masarap mag-alaga ng terminally ill. Okay. Terminal ill clients experience pain most of the time. No. Okay. Ako kasi, mas gusto ko kasi talaga maging palliative and hospice nurse. Okay, yun kasi yung pinipili kong road, ay yung track, palliative and hospice. Kasi sobrang fulfilling niya. Okay, sobrang fulfilling niya kasi parang up to their last breath, nasa tabi ka nila. Di ba ang ano kaya nun? Ang sarap sa feeling. Ang sarap sa feeling kapag ganun. A good example niya, may patient kami, example ko lang, may patient kami na colorectal cancer, tapos nag-brain mets, everything. Tapos, naging close siya sa akin. Up to the point na in-intubate na siya. So, in-intubate na siya, pero gising siya nung in-intubate. Kasi naman siya, hindi naman siya naguhugot. So, nung nakita niya ako, biglang nag-light up yung mukha niya, bigla siya nag-smile. Kasi alam niya, parang, alam mo yung feeling na parang nagkaroon siya ng relief na ako yung nurse niya, na aalagaan ko siya. Parang ganun. So, ang sarap mag-alaga talaga ng mga terminally ill. The same time, parang, kadalasan niya mga yan, yung mga yung parang hahawakan nila yung kamay mo. Hahawakan talaga nila yung kamay mo kasi parang takot sila na mamatay. Tapos parang, pag hinawakan nila yung kamay mo, tapos hinawakan mo sila, parang nagkakaroon sila ng relief. Yes. Ang sarap kaya sa feeling ng ganun. Diba? Well, wala kang magagawa kasi siya. Pagkasama ka daw ba sa last will nila, tatanggapin mo ba? Wala kang magagawa, kailangan mo tanggapin. Mayroon ba in terms of attachment? Siya, kailangan mo kasi, pag tumagal ka na kasi sa nursing profession, yung term attachment kasi nawawala na yun. Di ba? Nawawala na yun, mas nagiging nag-empathize ka na lang talaga. Pero yung word na attachment, yung ma-attach ka sa yes, meron, pero you know how to, dapat, delineate yun. Delineate. Alam mo dapat kung hanggang saan lang. Diba? A good example din, share ko lang din sa inyo. May one time nun, sila, major stockholder sila ng PAL. Tapos na-touch sila sa akin kasi, unconscious na yung nanay nila, kasi hindi na nagsasalita, hindi na nag-everything, intubated everything. Ginawa ko, kinamusta ko lang yung nanay nila, na-touch sila kasi kinakausap ko daw yung nanay nila. Diba? Dapat kahit yan, kahit hindi na kumikibo or unconscious na comatose na yung patient nyo, kausapin nyo pa din yung patient nyo. Kasi for sure naririnig kayo ng mga yan. Diba? A good example. Kaya sarap mag-alaga ng mga hospice and dying patient. Okay? The dying client's wishes to donate her eyes after she dies. Which of the following statements is not true about organ donation? Tamang sagot. Dito sa Pilipinas, dapat 18 years old. Letter apple. Dapat at least 18 years old yan, ha? At least 18 years old. Letter apple. A situation, the chargers in the medical unit updates her knowledge on nursing diagnosis. She reviews the term used, describe clinical judgment. Matik, favorite nyo to. Sure ako dyan. Itong situation na to, gustong-gusto nyo to. Okay, gustong-gusto nyo to for sure. Okay, a nursing diagnosis when there is insufficient evidence to support the presence of the problem, but the nurse believes that the problem is highly probable. Ang tamang sagot dyan. Sabihin nito insufficient evidence. Ibig sabihin nito, most probably possible yan. Kapag risk kasi, kadalasan, wala pa dyan yung mga signs and symptoms niya. Pero, based on your clinical judgment, pwede siya mag-lead doon. Okay, pwede siya mag-lead doon. As compared to your this one kasi, yung possible, may insufficient evidences ka. Okay, so letter boy. 65. Which of the following statement is a wellness? Nandyan na yung wellness mo, B. Kapag wellness, letter dog, enhance. Okay, letter dog. Letter dog. Which of the following statement is possible? Nursing diagnosis. Nakita mo na, B. B, wag ka na mag-overthink. Nakita mo na ba yung possible? Ayan, nandyan na, letter cat. Letter cat. A letter cat. Which of the following is a risk? Gusto niyo ba panay ganito ang lumabas sa board exam niyo? Yes or no? Saan tayo? Gusto niyo ganito yung board exam niyo? Panay ganito. Nasaan na yung risk? B. Sasampalin na kayo ng risk niyo, B. Ano na? It is letter cat. Letter cat. Tapos 1 to 100, panay ganyan yung board exam niyo. Saya. Actual daw. Actual. Pag actual, wala yung possible. Walang potential. Walang risk. Letter dog. Oo, possible yan. Huy, possible yan. Possible yung ganyang sa board exam. Possible yan. Oo. Iba nga last November, ang tanong, ang computation nila ay lang ml per hour. Okay, ml per hour lang tanong sa kanila sa computation. Ganun ang last board exam. Oh, 'di ba? Sa amin nung board exam ko, ang tanong sa amin parang how would you know yung weight niya appropriate? Parang ganun. Tapos may lumabas na number. Ay, may mga lumabas na number. Ganun yun sa amin. Actually, sinasabi nila ha, mas madali daw ang May boards. Sabi nila yun. Hindi ko alam kung totoo. Okay, hindi ko alam kung totoo. Kasi hindi man ako nag-board exam ng May. November ako nag-boards. Okay? Mrs. Man is the director of the critical care unit of the hospital. Ayaw ng computations? Ba't ayaw ng computation? May apo ba yung bond dito? May apo yung bond dito na nagbo-boards? She utilizes the nursing process to communicate care to the client. Meron? Nandito yung apo ng taga-bond? Meron? Sino? Baka naman. Ay, hindi dito. Ba't pa siya nagre-review? Ba't pa siya nagre-review, B? Nakakaloka naman siya. Sarot, di ko alam. Di ko alam kung ano. Di ko talaga alam ngayon ko na nabasa na may apo pala dito. Nandito pala yung apo ng nag-board ng taga-bond. Di ikaw na. Di ba? Ikaw na. Oh, she is called to the bedside. Pag hindi ka nag-top sa board exam, di ko na alam. Di ba? True, pa-share na lang po. Who is scheduled to have laparoscopic cholecystectomy. Bulong-bulungan mo na yung lola mo. Ikaw yung bubulong sa kanya, hindi ikaw yung bubulungan, B. Diba? Bulungan mo yung lola. Wag naman computation. Ganon. Miss Osman confers with the primary nurse regarding the client's condition. Which type of nursing process is Miss Osman applying? O take note, confers. Kapag confers yan, tandaan nyo, kapag confers, most probably planning. B, wag nyo ipa-perfect. Alam nyo ba yun? Wag nyo ipa-perfect ang board exam, B. Bawal ma-perfect ang board exam. Okay? One mistake lang. Okay? Kasi pag na-perfect nyo ang board exam, ano mangyayari? Diba, may leakage. Most probably may leakage ba siya? Yes. Maghihinala si Bon na may leakage. Opo. Kaya dapat, diba, one mistake ang aim mo sa board exam. Wag perfect. Okay, wag mo i-perfect ang board exam, one mistake lang. Miss Osman calls for EVIT conference. Ay, pag nag-perfect si Apo, alam nyo na. Alam nyo na. Diba? Who are attending to the client. They decide to obtain 12-lead ECG for a more definitive picture. They conclude that the client has no serious cardiac pulmonary. One mistake ang goal ni Apo, hindi perfect. B. Which step of the nursing is in effect in this situation? Correct answer is letter. Tignan mo to. Nagta-12 diagnostic to. Tapos nilagay nila sa cues nila, wala siyang problem. That is your assessment. Nasa assessment phase ka lang dyan. Hindi siya evaluation. Assessment siya. Ms. Osman consults with the attending physician and the anesthesiologist. She advises the primary nurse advice. Kapag nag-a-advise ka, nakikipag-usap ka ba? Nakipag-usap ka with the preparations and to remain alert for any adverse symptoms. Which of the following nursing process is this? Letter cat. Planning. Okay, planning po yan. 72. Ms. Osman confirms with the client. Purpose. Primary nurse the following morning. Together, they determine the client is ready na. Ready na daw si patient. That is your This is your evaluation. Letter apple. Letter apple. Ms. Osman applies the humans relation approach in this situation. She is aware that the key to the productivity is Ano yan? Ang human approach, naniniwala sila dyan na motivating sa people kapag may supporting environment sila. That is your letter dog. Gusto mo syempre ng degree of independence. Okay? Letter dog. Ay, letter apple, sorry. Apple pala. Lutang ang person. Apple. The nurse assists in the care of a 15-year-old female experiencing anaphylaxis due to insect bites by honeybees. Upon assessment, the nurse observed that the client is reacting to the insect bites. Reacting. Kaya pa naman, B. Oo, B, kaya pa yan. Last turo ko naman to. Tapos ang next turo ko na next week na, di ba? Tapos 4 days na duty ang person. Kaya pa naman. Galing kasi ako rest kahapon. Pahinga ako kahapon, B. Kaya wala akong ginawa kahapon. The following. Reaction. B, rest ako kahapon. Tapos ngayon may turo bukas. O kaya bukas wala kang gagawin. Ako may duty ako bukas. Duty ako Thursday, Friday, Saturday, Sunday. Diba? Saklap. 4 na araw ako magta 12 hours. The following are common reactions to an insect sting except. Tamang sagot. For the double pay, parang merong binubuhay ang person. Diba? Parang pamilyado ba ang person? Para may binubuhay na anak. Letter, C, reaction, di ba? Kapag reaction niya, namamaga ka ba, B? Namamaga ka? Yes. Namumula. O, masakit ba ang insect sting? Yes or no? Masakit ba siya? Yes. Okay. Next, a 21-year-old male is admitted to the burn unit X hospital. He sustained burns on the chest, abdomen, right arm, and right leg. The nurse assigned to his care anticipates that the client would be particularly susceptible to which of the following fluid electrolyte imbalances during the emergent phase of burn. Ano kaya ang tamang sagot dyan? Letter apple. Okay, letter apple. Bakit kaya siya nagme-metabolic acidosis? Kamusta potassium nito, B? Kamusta potassium? Mataas, mababa ang potassium nito? Potassium, mataas. Mataas, bakit? Oh, kapag nagkaroon ka ba ng burn, nagkakaroon ka ng tissue damage? Nagkakaroon ka ba ng tissue damage? Yes. Saan ba nakatira ang potassium mo? Sa cell. Lumalabas ba siya, B? Lumalabas. Yes. Hyponat, hypernat? Hypo. Okay, hyponat yan. Okay, hyponat. Letter apple. The nurse assessed the client for fluid shifting. Pag fluid shifting during the emergent phase of a burn injury, shift occurs due to the fluid moving from the nagmamanas ba yung nagkakaroon ba ng edema yung mga patient mo kapag burn? Yes, kasi from vascular sa interstitial. So kapag nag-shift from vascular to interstitial, kamusta ang blood pressure mo? Kamusta ang blood pressure mo dyan, B? Tataas, babagsak. Diba? From vascular, sabihin blood volume mo babagsak yan, B. Kaya ba prone mag-shock yung mga patient mo na may major burns? Prone ba mag-shock? Yes. Okay, yes. The nurse understands the fluid shift results from an increase in the, diba, kanina pa natin sinasabi, nagkakaroon ba ng leakage? Leakage? Yes. Letter cat. Letter cat. The client received fluid resuscitation therapy. The nurse adjusts the infusion rate by evaluating the client's tamang sagot dito. O, di ba? Fluid resuscitation. Most probably, di ba, kaya nga siya nag-fluid resuscitation kasi bumabagsak yung blood volume niya. Okay? So, pag bumagsak yung blood volume, kamusta perfusion sa katawan? Kamusta? Poor perfusion, kidney perfusion mo, kamusta? Decrease din. So, kamusta ihi mo nun? Babagsak. One way to make sure na maganda ang ano mo, na maganda ang blood volume, perfusion. Di ba perfusion ng kidney, letter apple? Diba? Ilan ulit ml per hour dapat ang minimum pag adult? At least maka 30 yan. Okay, at least maka 30. Paano kung wari pag below 30? Nakita mo, 20 ml per hour. Anong unang-una mong gagawin? First thing to do. Para nasabi ko na ata to sa inyo. First thing to do, kumari nakita mo, sa folicat bag niya, 20 lang. Anong una mong gagawin? First thing to do. Ano kaya? Check the patient or yung folicat. Patient muna, B. Check mo muna yung patient muna. Okay, check mo muna yung patient mo. Okay? Check the patient first, just check the folicat bago ka magre-refer. The client receives TPN. The nurse understands that this therapy will help the client. Take note, kapag burn injury yan, kamusta basal metabolic rate mo? Kamusta metabolic rate mo? Increase, decrease, ang metabolic rate mo. Metabolic rate. In distress ba yung katawan mo? Yes or no? In distress ba? Yes. Kamusta metabolic rate mo kapag in distress ka? Increase, decrease? Increased. Okay, increased yan. Okay, increased yan. So, kailangan mo ba ng mataas na caloric intake? Yes. You need a very high caloric intake. Okay, kailangan mo na sobrang taas na caloric intake kasi ang taas ng di ba? Metabolic rate mo. Okay? At take note nyo din, kapag nagkakaroon ng major burns ang patient nyo, nagkakaroon ng ileus yan. Okay, ileus yan. Ay sabihin ng ileus, hindi ba gumagana GI tract niyan, yes or no? Diba? Pag ileus, hindi ba gumagana? Yes. So, meron pa ba kayong chance sa pagpahinga yun kapag hindi na gumagana? Di ba hindi naman na magpapahinga yun kasi in the first place, hindi na siya gumagana. So, you don't need to allow to GI to rest. Okay? Correct answer dyan. Ang best answer, I recommend letter boy. Ensure. Sabi niyan, i-ensure mo kaya ka nga magtitipin. I-make sure mo na magandang caloric and protein intake niya. Bakit ba kailangan ng protein intake? Bakit mo kailangan ng protein intake sa burn? Bakit kaya? Tissue repair. Diba? Kailangan mo ng tissue repair kaya mo mas gugustuhin mag-TPN. So, letter boy. Okay, letter boy. Letter boy. Nurse Mel is a staff nurse in the oncology unit of a tertiary hospital. An activity in the unit for continuing professional development is to disseminate information among the personnel and staff in the unit regarding trends and treatment for cancer. Nurse Marion read an article entitled Understanding Colorectal Cancer, which was recently published in the national newspaper. Sir, pwede po ba magkaroon ng epidemiology yung mga ganyan? Yes. Pwede. According to the Philippine Cancer Facts of Estimates for 2010, one of the most common cancer among men is colorectal cancer. It ranks, ano kaya? Ano rank niyan? Letter dog, third. Sa men, ano number 1 sa men? Ano number 1 sa men? Sa lalaki? Lung cancer ang number 1 sa lalaki. Sa babae? Breast. Sa buong Pilipinas, ano number 1 mo? Sa buong Pilipinas, ano number 1? It is still your breast cancer. Okay, breast cancer pa din po. Okay, ito according to your 2020. According to your 2020, 2020 pa to. Wala pa ako nakikita ng 2022 pati 2023. So 2022. Yes, may prostate talaga sa both kasi we are looking to the number of cases na. Okay, number of cases na ang hinahanap natin dito. Yun na siya, binigay ko na sa inyo. Okay, next na po ba? G. A 45-year-old female married with 2 children is admitted in the medical department with diagnosis of your both kasi we are looking on the number of cases na. Okay, we are looking on the number of cases na siya. Kumbaga, gaano kadami yung may prostate cancer sa Pilipinas, ganon siya kadami. Okay? With diagnosis of your osteoarthritis. Osteoarthritis, local, systemic. Local, systemic, local. Unilateral, bilateral. Unilateral. The nurse is in the care for this client. We diagnose which of the following signs and symptoms should the nurse correlate with diagnosis of your osteoarthritis? Kaya, best answer, letter boy. Joint stiffness that decreases with activity. Diba? O saan daw common link? Number 82. Which of the following factors would most likely increase the joint symptoms of your osteoarthritis? Ano ba yung mostly affected? Mostly affected mo kapag ano? Kapag osteoarthritis, weight-bearing joints. Okay, weight-bearing joints. So yung mga weight, ano ba yung merong related sa weight dito? Letter boy, obesity. Okay, obesity. Okay, ano ba yung mga weight-bearing joints natin dito? The client asked the nurse, what joints are affected in osteoarthritis? Explains that joints most likely involved in this disease are the, ano yung mga weight-bearing dito? Letter cat. Ano pa yung isa pa? Pwede ba yung spine mo? Yes or no? Pwede ba yung spine? Yes. Kasama yung spine dito. Pati yung ends of finger mo. Ends of the finger. Yan. Correct answer is letter. Ano siya? Kasi ang tendency mo kasi niyan, okay, ang late sign mo kasi, ang isa sa, pag nag-progress na kasi osteoarthritis mo, kailangan mo pa din ROM. Di ba? Yung pain mo, yung joint stiffness mo, nakaka-ano na siya. Yes, in the late sign mo, pag nag-progress yan. Next, the client asks the nurse what activities she can perform to effectively decrease the pain stiffness in her joints before she starts her daily routine. Tamang sagot. Oh. Mag-cold bath ka ba? Yes or no? Cold bath ka ba? Yes or no? No. Mas gusto mo warm bath. Okay, mas gusto mo warm bath. Okay. Ang tendency kasi niyan, ito siya, kapag osteoarthritis, in the initial, yung joint stiffness mo, okay, yung joint stiffness mo, ma-relieve yan. Okay? Ma-relieve yan. But in the long run kasi, yan, okay, so kapag di mo siya ginalaw, anong tendency mo? Magkakaroon ka ba ng stiffening palalo? Yes or no? Diba? Mas lalo ka ba magkakaroon? Stiffening? Yes. Kaya kailangan nandun yung balance mo para mag-perform ka ng range of motion. Maglagay ka ng liniment. Kasi ang tendency mo, kapag ang OA mo, di ba, nare-relieve siya, yes, by the rest. Okay? So mag-rest ka na lang ba the whole time? Yes or no? No. Kasi kapag ni-rest mo ng whole time yan, pwede ka ba mag-develop ng contractures? Yes. Okay. So kapag ganyan, mas magandang gawin mo, mag-ROM ka kahit papano. Okay? Para ma-prevent mo yung stiffness or yung development ng contractures mo. Okay? So stretch all muscle group. Muscle group ba ang intended mo kapag osteoarthritis? Yes or no? No. Joints ang focus mo dyan, B. So letter boy. 85. The physical therapist prescribed a regimen of rest, exercise, and physical therapy to the client. The nurse understands that this regimen is what? Yan yung sinabi ko, di ba? Ang tendency niyan, initially yan, yes, kailangan mo mag-rest. Pero kapag nasa dulo-dulo ka, kailangan mo ng balance between rest and exercise para ma-prevent mo yung crippling effect ng disease. Kumbaga, ma-prevent mo yung contractures mo. Okay? Yun yung iniiwasan natin, yung contractures. Okay? Letter boy. Letter boy. 84 po is letter boy. In the medical ward, there are clients with potential or actual disorders of fluid electrolyte disturbances and homeostatic mechanisms. The nurse is caring for a client with chronic kidney failure. Charot, chronic kidney failure. The nurse understands that ammonia is normally exerted by the kidney to help maintain, ano kayang tamang sagot dito? Letter boy. Okay, letter boy, acid-base balance. Diba yan yung isa sa mga responsibility ng kidney mo? Okay, yan isa sa mga responsibility ng kidney mo. So kapag may chronic kidney disease ka, ano expected na ABG reading mo? Expected ABG reading mo? Ano kaya? Metabolic acidosis. Okay, metabolic acidosis. Which best suggests a nursing intervention for a client with fluid volume excess. Tamang sagot. Ito kasi normal potassium volume mo. Hindi naman kasi ito masyadong sensitive. Ito din, dapat nga urine specific gravity mo pag na-resolve na yung fluid volume mo, dapat normal ang specific gravity mo. At the same time, yung positive pedal pulses is not also an indicator. Okay, ang best answer mo dito is letter apple. Clear breath sounds. Bakit? Kapag fluid volume excess ka, anong breath sounds mo? What is your breath sounds? Kapag fluid volume excess. Crackles. Very good. Crackles. Okay, letter apple. 88. The nurse understands that the client with albuminuria has edema because of what? Letter because of the plasma colloidal oncotic pressure is a major force drawing from the interstitial back to capillaries, a drop of COP caused by your albuminuria. Correct answer is letter dog. Okay, letter dog. Letter dog. 89, when the nurse uses the clamp. O kapag ganyan, kapag naka-close yan, potential or kinetic energy initially yan. Potential or kinetic? Potential. Kapag inangat mo yung roller mo, ano mangyayari? Bababa ba siya? Gagalaw siya. Diba gagalaw siya? Ano mangyayari? Gagalaw? Kinetic. From potential to kinetic energy. Letter apple. Number 90. The client with condition has increased risk for your hyperkalemia. Anong condition kaya yon? Ano ba? Cushing's or Addison? Cushing or Addison? Ang increases for hyperkalemia. Addison. Correct answer is ESRD. Bakit ka nagkakaroon ng hyperkalemia yung mga ESRD? Or end-stage renal disease? Ano kayang cause? Kasi umiihi ba sila? Jumijihe. Umiihi ba sila? No. Okay, hindi na na-excrete yung potassium dyan. Ano pa yung pwede mag-increase ng potassium mo? Ano pa? Siyempre, Addison's. Addison's. Ano pa? Burn, very good. What else? Tissue damage. Yes. Anong gamot? Anong diuretic yon? Nakaka-increase ng potassium. Anong diuretic yon? Anong potassium sparing? Spironolactone. Okay, spironolactone. Yan ang mga common. Nakakataas ng potassium. Ano naman bibigay mong gamot kapag hyperkalemic yung patient mo? Ano ibibigay mong gamot? 4 yan, B. 4. 1. Kayexalate. 2. GI solution. Your glucose insulin solution. Ano number 3? 4 yan. Ano kaya? Ano yung 3 and 4? Calcium gluconate. Yes, calcium gluconate. Ano yung last one? Hindi to common na alam ng mga students. Pero baka lumabas lang sa board exam. Apo, pakisagot true. Nasaan na yung apo? Baka naman. Sarot. O ano? Ano yung pang-4? Hindi siya common. It is your salbutamol. Okay, salbutamol po. Okay. May action kasi yung salbutamol na pinapapasok niya sa cell. Yung potassium. Okay, 4 yan. Kayexalate, GI solution, calcium gluc, and your salbutamol. Yung 4 na yun nag-a-adjust ng hyperkalemia mo. Next. A mother with AIDS states that she has been caring for her baby even though she is not feeling well. Yeah, pwede din naman yung yung diuretics, yung potassium wasting mo. Pero kasi ang tagal in the long run. Okay, matagal yan. Long run kasi yan yung potassium wasting mo. Okay, ang tendency mo kasi dyan, kapag nagbigay ka, hindi siya makakababa agad. As compared mo sa apat na yun, nakakababa siya kagad. Okay. What important information should the nurse determine? Ang HIV/AIDS mo ba, nakakahawa ba via kiss? Yes or no? Nakakahawa ba siya pag nakipaghalikan ka? No. Okay, no po. Kiss. O, kailangan ba mag-antibiotic kapag no. Contact precaution po ba ang isang HIV? Pag ginawa ka mo yung tao may HIV, hawa ka na. Yes or no? No. Breastfeeding, nakakahawa ba ang HIV sa breastfeeding? Yes. Correct answer is letter boy. Letter boy. Number 92, the nurse is planning to provide discharge teaching to the family of a client with AIDS. Which statement should the nurse include in teaching plan? Tanong dyan, okay, pwede ka ba makipaghati ng spoon and fork sa patient na may HIV? Yes or no? Share ng spoon and fork? Yes. Okay, so kailangan po ba ng special measure para paglilinis ng ng spoon and fork at plates? No. How about your razor? Pang-shave, pwede ka ba mag-share ng pang-shave? No. Okay, yun ang hindi mo pwede share. Letter apple. Number 93. During an AIDS education, a client states, Vaseline works when I use condoms. Which conclusion client knowledge about condom use can the nurse draw from this statement? Tamang sagot. Letter C. Ignorance concerning correct condom use. Ano ba dapat gagamitin mong lubricant kapag ganyan? Anong lubricant? Water-based lubricant. Okay, water-based lubricant siya. Bakit kapag nag-Vaseline ka, ano nangyayari sa Vaseline? Ano ginagawa ng Vaseline? Magkakaroon ng tear. Okay, magkakaroon ka ng tear dyan. Okay, kaya mo ng Vaseline. The client with AIDS experiencing nausea, vomiting. The nurse would make which of the following dietary alterations for this client to enhance nutritional intake? Letter to enhance nutritional intake. Small frequent feeding ka ba kapag nausea, vomiting? Yes or no? Small frequent? Yes. Okay. Add spices, mas dadamihan mo ba yung mga spices niyan, B? Dadamihan mo ba yung spices niyan? No. Mas nakakasuka ba pag madaming spices? Yes, 'di ba? Correct answer is letter boy. Avoid dairy products and red meat. 95. The physician orders a paracentesis. How should the nurse instruct the client to prepare for radiograph? Tamang sagot. Kapag ganyan, kapag pinaprepare mo sa radiograph, pa-void mo para walang matama ang ibang organs. Letter apple. Letter apple. 55. A 55-year-old male is brought to the emergency ward on a wheelchair. He complains shortness of breath, dyspnea on exertion. Ano sabihin niyan dyspnea on exertion? Ano yung sabihin niyan dyspnea on exertion? Ano kaya? Sabihin niyan dyspnea on exertion. Kapag hirap with activity, hirap gumalaw. Pag gumalaw, hirapan huminga. Yes or no? Yes. Okay. Palpitation, cough and frothy blood, thin mucus, and fatigue and weakness. Based on the information presented, the nurse formulates the nursing diagnosis. Which of the following is most appropriate? Anong tamang sagot dito? Ano yung most appropriate dito? Ano kayang Okay. Yes, your letter dog is ineffective breathing pattern related to decreased respiratory depth and secondary to pain. Yes, pwede siya. Pero take note kasi ang cues na prominent cues mo dito is dyspnea on exertion, fatigue, and weakness. These three are the classic manifestation or classic cues of your activity intolerance. Itong tatlo na to in classic mo ng activity intolerance. So mas papanigan natin yung activity intolerance. So ano dito, sir? Okay? Sa ibang sa ibang items mo, nagsabi ba na may heart failure si patient, yes or no? Sa iba, may nagsabi ba na may heart failure si patient mo? Sa ibang context, yes, sa ibang items. Di ba? Pag ganyan, context clues tayo, letter boy ang better answer. Letter boy. Okay, letter boy. I stand corrected on this one. Okay, kaya kinorek ko na siya. Mas maganda i-correct natin yung ano. Yes, pwede din naman. Kapag ineffective breathing pattern, pwede yan. Kasi yung dyspnea mo, okay, yung dyspnea mo, it's highly correlated to your pain. But at this point in time kasi, yung tatlong cues na dyspnea and exertion, fatigue, and weakness is highly suggestion of your activity intolerance. Further, may palpitations pa siya. Okay, may palpitations pa siya. Pwede ka din naman mag-suggest na meron siyang heart failure. Specifically, left-sided heart failure. Kasi cough with frothy sputum. Next. The nurse assess the client. Which of the following signs and symptoms would the nurse expect of a client with heart failure? Tamang sagot. Kapag may heart failure, kamusta yung pulse mo? Malakas, mahina. Kamusta pulse mo? Malakas, mahina. Weak na yan, B. Weak yan. Yung bradycardia, tachycardic ka. Siyempre, yung gusto ng heart mo, lumalaban ba si heart mo? Lumalaban ba ang puso mo? Yes, lumalaban yan. Tachycardic yan, tinatry niya kahit nangihina na siya. RR mo, syempre, mataas. Letter cat. Diba? Ang presence ng murmur is a sign of your heart failure. '98. The nurse administer oxygen to the client. Which of the following statement is true about giving oxygen with the patient with heart failure? Ang oxygen mo ba nabibigay lang via MEC vent? Yes or no? No. Ang dami pang other ways, diba? Anxiety, hindi naman. Wala naman nakalagay anxiety yung patient mo. Especially, hindi na siya contraindicated to your heart failure. Letter boy. Letter boy. Number 99, the immediate management for a patient with heart failure are the following except, tamang sagot. Siyempre, monitor ka to. Monitor mo to. Assurance to the patient, actually, sinasabi ng mga students, sir, hindi ko priority yan. Yes, hindi mo siya priority. Pwede siya. Okay, assess level of consciousness, yes. Pero magbibigay ka ba ng IV fluid sa patient na may heart failure? Yes or no? No. Bakit? Bakit? Ang tendency ba kapag may heart failure ka mo sa blood volume mo dyan, mataas na yan kasi hindi ka na umiihi. Kapag pag mas nagbigay ka ng fluids, mas dadami ba yung cardiac workload mo? Yes or no? Mas tataas ba? Yes. Mas pinapahirapan mo yung puso. So, wag mong gagawin yung administer IV fluids right away. Okay. Kasi mas papahirapan mo yung heart. Okay? Mas lulunurin mo pa nga yung heart eh. The nurse is aware of that the management of heart failure requires expertise and consultation with other health disciplines. The one who can effectively implement therapeutic regimen to assist with psychosocial aspects and interfere in maintaining healthy home life and healthcare network are the... Okay, ano bang ginagawa ng psychologist mo? Ang psychologist mo, ang ginagawa niya ay help people learn to cope more effectively with life issues. Yan siya. That is the main responsibility of your psychologist. Ang psychiatrist mo kasi, diagnosis to. Diagnosis and treatment of mental health disorders. So, ang best answer dito is letter dog. Psychologist. Ano ba yung social workers? Diba kadalasan home referral to home referral, home services. Okay, yan ang mga kadalasan mo. Correct answer natin is letter dog. Letter dog. Okay. Questions on your NP4 and questions on your NP4. Meron? Questions on your NP4. Questions on your NP4. Wala. Okay. Bladder break, 20 minutes. Scary. Bladder break, tsaka break na para kumain man kayo. Kasi dire-diretso na tayo hanggang na to. Hanggang matapos ng NP5 mo. Okay, hanggang 11. Okay? Thank you. Done pa kayo? Nandyan pa kayo? Uy. Hello po. Yes. Feeling ko maaga tayo matatapos. Nafe-feel ko. Nafe-feel nyo ba? Feeling nyo ba? Gusto nyo i-late ko na onte, mga 1:30. Gusto nyo? Joke lang. Magagalit kayo. Alam ko yung ugali nyo, B. Pag na-late ang lecture, see you in evaluation. Diba? Totoo hindi. Late po magpa-uwi. Ganon. The diverse neurologic disorders present a unique challenges of nursing care. The nurse must have a clear understanding of the pathologic process for appropriate nursing management. Nurse Mateas attending to clients in the ward with multiple sclerosis. Okay. Kapag multiple sclerosis, ang tatandaan niyo dyan, decreased. Okay. Decreased ang kanilang mga perceptions. Okay, which statement by the client with multiple sclerosis indicates Nurse Mateo that clients needs further teaching. Okay, tandaan mo dito, safety ng pasyente mo palagi ang priority. At the same time, yung mga patient mo merong multiple sclerosis, decreased ang perception to pain, touch, and temperature. So kapag nakakaramdam ba sila ng hot and cold, yes or no? Nakakaramdam ba sila? Yes pa din, pero decreased. Okay, decrease. So, anong tamang sagot sa number 1? Number 1 is letter boy. I will take a hot bath to help relax my muscles. So, kapag nag-take siya ng hot bath, anong possible mangyari kay patient? Burn. Okay, burn po yung pwede mangyari kay patient. Okay. A recently hospitalized client with multiple sclerosis is concerned about general weakness and fluctuating physical status. What is the priority nursing intervention for this client? Okay. Generalized weakness. So kapag ganito, ano bang gusto mong gawin kapag generalized weakness? Complete bed rest ba siya? Yes or no? Or meron pa din siyang gagawing activity? Di ba? Kailangan mas gusto mo pa din may gawing activity. Okay. So kapag nag-encourage ka ng bed rest, wala kang mangyayari dyan, B. Di ba? On take note mo, letter C mo, ang focus mo kasi focus mo is the generalized weakness. So wala naman naka-cues dito, pati ito, correct answer is letter boy. Okay, letter boy. Number 3, Mateo is excited to be assigned in the neuro ward. After his extensive training, he is preparing to conduct a neurologic examination. What intervention is anticipated in a client in plateau phase of GBS? Kapag GBS, ascending, descending. Ascending, descending. Ascending paralysis. O kapag nag-plateau yan, makakalunok pa ba yung patient mo dyan? Yes or no? Kamusta gag reflex niyan? Cough and gag reflex. Kamusta? Weak na po ba yan? Weak or halos wala na? Kamusta cough and gag reflex pag nag-plateau na? Sabi niya nasa peak siya. Wala. So makakapag-straw ba siya? Magpa-provide ka ba ng straw? No, kasi possible aspirate. Makakapag-aerobic exercises ka pa ba sa kanya? Eh di ba paralyzed nga yan, B? Aerobic exercise movement niya. Passive ROM ba i-recommend natin? Passive ROM po ba? Yes. Mag-administer ka ba antibiotics to prevent, prevent pneumonia? Bibigay ka ba antibiotics to prevent pneumonia? Yes or no? No. Correct answer is letter boy. Kasi baka maging incontinent sila. Okay, incontinent sila dyan. Letter boy. Number 4, Mr. Rod, a 40-year-old client, carpenter, admitted to the spine after spinal cord injury. And physician indicates that the client is paraplegic. The family asked Nurse Mateo what this means. What should nurse give to the family? Kapag plegic, kapag plegic, tatandaan nyo, paralysis. Kapag plegic, it is paralysis. Kapag paresis, ano yung paresis? Plegic is paralysis. Pag paresis, weakness. Okay? Kapag para, ibig sabihin sa baba, yes or no? Yes. Letter boy. Okay. Ano yung one-sided of the body is paralyzed? Kaya yan. Hemiplegia. Both lower and upper extremities are paralyzed. It is called as quadriplegia or tetraplegia. Very good. Which clinical indicator does nurse Mateo identify when assessing a client with hemiplegia? Plagia daw. Plagia paralysis kapag hemi one-sided. Correct answer is letter boy. Okay, letter boy. As a professional nurse, you take into consideration the ethical moral principles in providing nursing care. You release information over the phone to a caller who identified himself as the brother of your patient. You found out later that the brother was out of town. Which of the following rights did you violate? Correct answer. Letter. Okay. Letter Apple. Right to privacy. Bakit sir right to privacy yan? Your invasion to privacy includes violating confidentiality, intruding on private client or family matters, and sharing client information with an authorized person. Again, your invasion of privacy or your right to privacy is when violating the confidentiality, intruding to the private client or family matters, and sharing client information with an authorized person. Ito siya, lagay natin B. Yeah. Ang right to confidentiality kasi, okay, kadalasan yan kapag kumari meron kang na data information siya. Okay, data information. Kadalasan ang right for confidentiality yan. Sa work, ay sa research ganyan. Pero kasi ito kasi nag-divulge ka. Yung privacy ng patient mo to unknown. Okay, so mas maganda yung right to privacy mo. Okay, kadalasan ang confidentiality information. Okay. Pero dito kasi, sa maling tao ka divulge, privacy kasi ng patient mo, di ba dapat hindi alam any information about the patient. Okay, so right to privacy talaga siya. 7. Your patient is having difficulty of making decision to undergo hip surgery. Which of the following nurse actions best describe your advocacy as a nurse? Ano kaya? Pag advocacy, di ba, you are protecting the patient, yes or no? Kapag advocacy, you're protecting kung anong gusto ng pasyente mo. Okay, you are protecting. Tamang sagot is letter Apple. Okay, protecting patient's autonomy and independence. Okay, pwede ka ba mag-advise kay patient, yes or no? No, di ba? No yun B. Okay, next, number 8. Mrs. Go needs to undergo a hip surgery. She refused to have it done even after attending surgeon has explained the procedure thoroughly. What ethical procedure or principle applies? Bakit hindi B? Okay, because, ano yun? Okay, bakit hindi B? Kasi, saan dito? Ano ba to? Ano bang ito? Dito? Sa 7, ba't hindi B? Communicate the patient needs interdisciplinary. So, ibig sabihin advocacy kasi, you are protecting the patient. Okay, you are protecting the patient. Okay? Kapag actively support the patient's decision, you are on the autonomy side. Autonomy side to. Okay? If you communicate with the ano ginagawa mo? Ibig sabihin ba na advocacy parang nandun ka, kumbaga, you are there for the patient kasi siya. Patient-centered kapag advocacy kasi. Kapag ito actively support patient decision, this is your promoting the autonomy of your patient. Okay, promoting the autonomy of the patient kasi to. Okay, if you communicate the needs with the interdisciplinary team, yes, pwede siya. Pero did you protect the autonomy and independence of the patient? Diba? More of yes, collaboration kasi nangyayari dito. Hinahanap mo kasi yung advocacy mo. Okay, your advocacy roles as a nurse. Which is what? You promote the autonomy and independence of your patient. Letter Apple. Number 8. Mrs. Go needs to undergo a hip surgery. She refused to have it done even though the attending surgeon explained the procedure. Tamang sagot dito, what ethical applies in this situation? Autonomy. Okay, autonomy. Okay, autonomy. Informed consent is one of the patient's Bill of Rights. One of its requirements is the capacity of the patient to give it. Okay? Which of the following elements are related to its capacity? Tamang sagot. Okay. Ito, let me explain my side first. Explain ko muna kung bakit hindi letter boy yung i-recommend kong sagot. Ano po ba dapat ang meron si patient muna para ma-qualify siya magbigay ng informed consent? Ano muna? Kumbaga, bago ka magpa-informed consent, si-screen mo muna sila ano ba dapat ang meron sila. Diba dapat 18 years old, diba? 18 years old, conscious, coherent, and mentally competent and voluntary. So ito muna yung hanapin mo bago ka magpa-informed consent, yes or no? Yes. Okay? So patient is adult, connected siya saan? Dito. Patient is competent to make a choice, connected siya dito. Yes. He has the freedom to make a choice. Is it a voluntary ba dapat, yes or no? Voluntary ba dapat? Yes or no? Voluntary ba dapat siya ibibigay? Yes. So ito siya. Okay? He can understand the consequences. Ito, papasok lang yan. Di ba? For a good example niya, step 1. Ang step 1 mo dyan, kailangan hanapin mo muna, sino ba yung competent ba yung patient? At least 18 ba siya? At voluntary ba niyang gagawin yun? Kapag nag-yes ka dyan, you would explain kung ano ba yung risk, benefits ng procedure, consequences, at doon ka lang mag-aano ng informed consent. This one kasi, sa elements ng informed consent papasok. Itong consequences mo. Elements ng informed consent. Yung hinahanap natin, elements nung pipirma. Okay, nung pipirma. Hindi yung elements ng isang informed consent. So, ang best answer dito is letter apple. Okay, apple. Di ba itong tatlong to ang kailangan merong characteristic yung person. Okay, itong tatlong tong kailangan may characteristic yung person para pwede siya magbigay ng informed consent. Ang laman ng informed consent, nakalagay doon na naiintindihan niya yung consequences, alam niya yung risks and benefits, alam niya yung mga kailangan gawin, and alternative choices. Kaya ang best, I recommend the answer letter apple. 1, 2, 3. Na ano ba, na-gets po yung point ko, or like, nakita ko bakit 1, 2, 3 siya, hindi 1, 2, 4. Yes. Okay. Next. Another requirement of informed consent is voluntariness. It means freedom of choice without following the conditions. Okay? Except, di ba, kailangan pag freedom of choice may pipilitin ka ba, yes or no? Ba hindi dapat. Fraud. Di ba, ito yung fraud, yung parang tatakutin ka kasi. Deceit, parang, para siyang sulsol. Parang ganun ang deceit mo eh. Correct answer mo is letter cat. Okay, consequences. Letter cat. You are the community health nurse doing a home visit to a patient with open glaucoma. The following question apply to the situation. NP5 po. A patient taking Latonopro, Salatan. She asked you why she was given this medication. Your answer is that, tamang sagot, letter dog. Okay, letter dog, decrease intraocular pressure. Ano bang ginagawa ng mo? It lowers the pressure in the eye by increasing fluid drainage from the eye. Okay, tanong, alam ko naturuan ko na yung section na to. Kapag glaucoma, mitotics mydriatics po. Mitotics, very good. Okay, mitotics ang drug of choice natin kapag glaucoma. The fundamental assumption of theory of life cycles is that the development occurs in successive stages. The different life cycle theories try to explain personality development as well as development of psychiatric disorders. The following questions refer to this situation. The nurse understands that Freud's phallic stage of psychosocial development, which compares to Erickson's psychosocial phase of initiative versus guilt. is best seen as what? Letter, cat. Okay. Kapag Eric Erickson, ano yung sa adolescent mo? Ano yung adolescent mo pag Eric Erickson? Ano kaya? Eric Erickson. Identity versus role confusion. Kapag 6 to 12, ano kaya? Industry versus inferiority. Kapag birth to 1 year, ano kaya? Trust versus mistrust. Pero kapag birth to phalanx, pag to Freud, ano kay birth to Freud? Birth to Freud, oral. Adolescent to Freud, ano? Pwede na siya pumasok ng genital. Okay? Eh, 6 to 12, dito papasok yung latent po ba? Yes or no? Latent. Yes, dito papasok sa latent mo. Next, a 3-year-old boy was brought to the pediatric clinic for an indifferent behavior. About a month after their toddler is diagnosed as moderately retarded. Kapag moderately retarded kasi, significant ano na to? Kumbaga significant support na. The parents discussed toddler's future, reflecting specifically on plans on child's independent functioning. Sa tingin nyo ba kapag moderately retarded, may independent functioning pa kaya yung bata? Most probably, ang baba na niyan kasi moderately retarded na siya. Okay? At this point in time, feeling niya ba in denial yung family? Yes. Letter apple. Letter apple. The nurse understands the problem with dependence versus independence developed during the stage of growth and development known as, kapag dependence, independence, is that synonymous with autonomy? Yes or no? Autonomy. Yes. Ano yung may autonomy sa na psychosocial mo? It is your toddlerhood. Diba? Autonomy versus shame and doubt. Letter cat. May letter cat. When planning to teach about the stages and growth of development, what stage does the nurse indicate as basically concerned with role identification? Tamang sagot dito. Ito yung may mga audible complex, Electra complex, that is your letter cat. Okay, audible stage. Okay, letter C. The nurse utilizes play when interacting with children based on the understanding that the play for preschool age child is necessary for the emotional development of, di ba kapag preschool age child, ito yung may mga gusto ko paglaki ko ganyan, gusto ko pag ganyan, ganyan. Di ba ganyan ang preschool, di ba? Play stage. Most probably anong klaseng yan? At it's for your development of what? Nag-introjection siya. Sabihin niyan, ang introjection mo is what? A type of identification in which the individual incorporates traits and values for another to himself or herself. Ito siya. Yan. Elizabeth has been using contact lenses for the last 5 years. She has been admitted to the eye unit with diagnosis of your corneal ulcer. Which of the following affects the ability of the eye to clearly focus? A change in the, ano ba yung nasa context natin? Sa context natin, corneal ulcer. So, syempre, sagutin na natin letter cat. Okay, cat. The cornea functions as a window and allows light to enter the eye. At it also begins with the process of focusing. Light rays that allow you to see worlds and images clearly. The cornea provides 65 to 75% of your focusing power. Letter cat. 18. Which of the following characteristics make immune defenses difficult to tend of infection of the cornea? Diba? Sa mga nag-special senses sa akin dito, may mga kinalakas ako dito. Your cornea is the outermost layer of your eyes. Yes or no? Outermost? Yes. Transparent po ba ang cornea mo? Transparent? Yes. Vascular, avascular? Avascular. Pag ibig sabihin ng avascular, may blood vessel or wala? Wala. Letter apple. Okay, letter apple. 19. Which of the following is a predisposing factor for Elizabeth's condition? O meron daw siyang corneal ulcer kasi nakasuot siya ng contact lenses. Yes or no? Yes. So yan lang yung na-mention dito, B. Letter boy. Prolonged use of contact lenses. Number 20. Corneal ulcers are considered medical emergencies. Which of the following nursing actions will be your priority? Siyempre, ano ba yung root cause problem? Bakit ka nagkaroon ng corneal ulcer? Kakasuot ba ng contact lens? Yes or no? Yes. So, tanggalin mo na ba yung root cause problem? Yes or no? Para ma-address na. Yes. So, remove the contact lenses. Letter apple. Now, John is an 11-year-old grade 4 pupil in a private school. Was diagnosed to have attention deficit hyperactivity disorder or ADHD. Which of the following is not a main characteristics of your ADHD? Ano kaya? Inattention, common ba to? Inattention? Yes. Ito yung hindi siya makafocus sa isang bagay, yes or no? Hindi siya makafocus. Yes, that is your inattention. Hyperactivity, yes, nasa ano na siya, nasa diagnosis siya. Yes, ito yung maligalig yung bata. Okay, maligalig. Galaw ng galaw. Impulsivity, ito yung tendency niya mag-bat out siya without thinking any of the consequences. That is your impulsivity. X. The correct answer is your passivity. Ang passivity ba, common ba to sa autism? Mas common ba sa autism ang passivity? Yes. Yun ang difference sila ni autism. Sino ba yung walang social skills? Most probably. Autism o ADHD? Autism. Okay? Yung ba yung kapag tinawag mo yung pangalan nila, titingin ba sila or hindi kapag autism? No. Si ADHD, pag tinawag mo, lilingon ba siya sa'yo? Yes. Okay? Yes yan. Okay? Anong priority nursing diagnosis mo kapag ADHD? O impulsive siya, hyperactivity. Anong pa? Risk for injury. Okay? Risk for injury yan. Si autism, anong nursing diagnosis mo? Priority. Ano kaya? Risk for ano? Or impaired social? Interaction. Okay, social interaction, social chenes, cutie. Ayan. Okay, ang cutie na social chenes. Don't worry, ano naman, hindi makatila dyan na judge. Okay, yan yung common difference ng dalawa. Si ADHD, attention span. Si autism, faulty social skills yan. Daan na mag-screen cap. Next. 22. His teacher has observed John to have a difficulty of waiting for his tutor when batting out conversation. So nagbabat out without any thinking. Blurts out answer without waiting for questions to be finished. Ano kayang tamang sagot dito? 'Di ba? Letter dog. Impulsive. Siya ibig sabihin nito, acting on a spur moment in response to immediate stimuli. Acting on a momentary basis without plan or consideration of the outcomes. Letter dog. Okay, letter dog. Which of the following is the most important nursing consideration in caring for John and his family? Ano kayang best answer dito? Nursing in consideration, dapat establish therapeutic relationship with John and his family. Kapag na-establish na yung relationship, makakakuha ba siya ng information kay mother? Yes or no? Yes. Makapagturo ba siya ng maayos? Health ed. Yes. Okay. So, umbrella answer mo si letter apple. Okay, letter apple. Mr. H, a 50-year-old female, was brought in the emergency room with a chief complaint of sudden severe headache, numbness of the right side of her body, and difficulty in speaking. Oxygen was administered at once to Mrs. H. The rationale of administering oxygen to suspected stroke patient is, di ba kapag stroke, kamusta brain perfusion mo? Kamusta brain perfusion? Hypoxia? Mababa, di ba? Kaya ka ba magbibigay ng oxygen? Yes. Yes. Okay? The answer is letter boy. Okay, letter boy. Siyempre, di ba may brain hypoxia yung patient mo? Okay, meron siyang cerebral hypoxia. So kapag nagkaroon ng cerebral hypoxia, vasodilate or vasoconstrict? Ano sa tingin nyo? Kapag nag-hypoxia, vasodilate or vasoconstrict? Ano bang kailangan ano ba mas kailangan nila? Mas madami bang blood or mas konti? Mas madami. Bakit? Kasi kailangan ba niya na mas madami oxygen? Yes. Kapag nag-vasodilate yan, dadami oxygen mo. Pwede bang tumaas ang intracranial pressure mo? Yes or no? Yes. Kaya tayo nag-oxygen administration to prevent your increased intracranial pressure. Okay, letter apple. 26. A non-contrast computed tomography was ordered for Mrs. H. The purpose of diagnostic test is to determine ang CT scan mo is imaging. Imaging yan para malaman mo yung ano. Letter dog. Okay, dyan mo kasi malalaman. Ang CT scan used to detect if meron siyang infarction. Okay, titingnan mo din kung may lesions, kung may cerebral atrophy siya. So letter dog. Letter dog. (27) Which of the following is the focus of initial assessment for Mrs. H? Initial assessment daw. Ano daw focus mo dyan, B? Diba? Most probably, mas focus mo si airway pa din. Letter dog. Okay, letter dog. (28) You read the physician's notes that Mrs. H has contralateral deficits. This means, kapag contralateral, ano ba yung manifestation ni patient? Right or left weakness? It is your right side yung numbness niya. Kapag right side yung numbness mo, unaffected na brain mo, left or right? Nasa left. Letter cat. Letter cat. Okay, letter cat. You are a community health nurse in a municipality C. You want to improve the primary prevention activities in the municipality in relation to mental health. In the public health model, which of the following is considered the patient? Di ba kapag public health model, ang focus natin is what? The letter apple, community. Okay, community po. (30) In assessing mental health needs of the community, one of the techniques used is epidemiological studies, which examine the incidence and prevalence of mental disorders. Kapag incidence, letter N ang pangalan niya, may letter N. Ano hinahanap natin kapag incidence? New or old cases? New. Letter cat. New cases of mental disorders in population over specified period of time. How about your prevalence? How about your prevalence? New and old or all cases. Okay? New and old or your all cases. Promoting mental health is a primary prevention activity which is consistent with the principle of what? Kapag primary prevention, ang interdisciplinary and multidisciplinary is almost same answer yan, dalawang yan. X mo yan. Okay? Di ba ang primary prevention, it should start with you, yes or no? Pag primary prevention starts with you, yes. Correct answer is letter dog. Okay, self-help. Okay, self-help. Number 32, the purpose of prevention is to lower the incidence of mental disorder. This can be done through, kapag early treatment, that is your, ano kaya yan? Secondary. Ito bang letter A, para nag-early treatment na din ba to? Yes or no? Para nag-early treatment na to? Yes. Okay? Directly na kasi siya, kaya makakonsider mo siyang secondary. Ang case finding, di ba tatandaan nyo, kapag secondary prevention, dalawa lang yan. Early treatment and screening. Early treatment and screening. So kapag case finding, nagsiscreen ka ba ng mga people? Yes or no? Case finding, naghahanap ka. O, paano ka maghahanap ng case? You screen people. Okay, you screen people. Correct answer is letter dog. Okay, program development and intervention for older adults. Letter dog. You are the staff nurse in a government hospital being transferred to the psychiatric unit. You were required to equip yourself by attending to the enhancement program on crisis intervention. To assess your knowledge and skills on the subject, you were given a pretest. A crisis that is acute but temporary due to external source is, tamang sagot. Ano yung developmental? Developmental, also known as your, maturational. Okay, maturational. Okay, transitional, ito yung pagpapalit mo ba ng roles, yes or no? Transitional, yes. Okay, changing of roles to. Ang traumatic mo kasi, ito yung crisis precipitated by unexpected external stresses. Okay, external stresses. Ano example ng traumatic mo? Ano example ng traumatic mo? Trigger warning, rape, di ba? Pwede bang rape sa traumatic? Pwede ba siya? Yes. O kaya yung mga murder. This is an example of your traumatic. Right answer is letter dog, dispositional. On number 34, which of the following nursing interventions is the most appropriate for a client in early state of crisis? Di ba kapag early state of crisis ka pa lang, pwede ka pa ba intervene kay patient? Yes or no? Yes. Pwede ka pa ba mag-verbalize ng feelings? Ganyan-ganyan. Yes. Okay. So kapag tamang sagot is letter apple. Okay, kapag evaluation, ibig sabihin ba nito most probably tapos na yung situation or yung crisis? Yes. Ito din yung begin development of insight. Okay? Tapos na din to. Okay? Tapos na din yan. 35. Each of the following is not assumption in the concept of crisis. Diba? Kadalasan po ang crisis is acute and resolved within short period of time. Yes. All individuals experience crisis, yes or no? Lahat ba tayo dito nagkakaroon ng crisis? Yes. Yes. Diba? Okay, specific identifiable events precipitate a crisis. For example, anong crisis na meron kayo ngayon? Board exam, diba? Expect identifiable event can be. Diba? Correct answer is letter cat. Sir, bakit mali yung letter cat? It should be psychological development. Dapat po psychological to. Next, the main objective of crisis intervention is to, tamang sagot. Diba? Ang goal mo talaga is resolution, immediate crisis. Tapos, letter cat. Return to the person to the root of crisis and identify the cause. Para ba hindi na maulit yan, yes or no? Yes. Para magkaroon din siya ng higher level of functioning. Ma-realize niya ano bang nangyari. So, letter cat. Documentation is a registered nurse. Accountability, legal and ethical actions. Charting done by a nurse provides comprehensive sequential notes of the following except Oh, i-note mo ba yung procedures na ginawa? Yes or no? Yes. Tsaka yung health status ni patient. Health status. Information. Yes. And relevant health data. Bakit mali yung letter boy? Ba't mali yung letter boy? Ano ba dapat? Ano ba dapat? Nursing diagnosis dapat, di ba, B? Letter boy. Letter boy. Number 38. The following are the importance of your proper documentation. Ang kasi dito, ba't hindi daw safety? Ang goal mo kasi sa crisis intervention is to have your higher level of functioning. Kumbaga mabalik siya sa Buti sana kung siya, kumbaga nasa not necessarily mean kasi kapag nasa crisis ka, nagwawala or ganyan. Pwede yan sa anxiety kapag panic. Pero at point kasi kung crisis yan, hindi kasi safety yung tinitingnan mo kapag crisis. Diba? A good example ng crisis mo is board exam. Are we looking to the safety ba pag nagbo-board exam ka? Di ba hindi? A good example, kumari, kapag anxiety ka, di ba kapag anxiety, wala ka ng magulo na yung utak mo. Okay, pwede ka ba magwala kapag may anxiety? Yes. As compared to your crisis kasi, para siyang external force. Okay, kaya siya letter cat. The following are the importance of proper documentation. Lahat ba tamang sagot dito? Yes or no? Lahat ba tamang sagot dito? Yes or no? Feeling nyo lahat tamang sagot? Yes. Diba? Pero kasi kung ibo-book base mo siya, ang main responsibility in proper documentation mo is number 1, communication. Number 2 is what? Planning client care. Okay, planning client care. Lagyan natin dito. Ano pa siya? Para saan pa ang documentation mo? Research and education. And healthcare analysis. And your legal document. Pero sa book nakalagay siya, ang legal document mo does not necessarily mean na for court siya. Okay? Nakalagay siya doon. Saan ba dito? Interdisciplinary communication, yes. Diba? Holds vital information. May nakalagay ba itong vital information? May nakalagay bang vital information dito? Wale. X mo to B. Kahit labag sa kalooban natin, yes or no. Kahit labag sa kalooban natin, tanggalin natin kasi wala siya dito. Okay? Reflects quality time nursing care. Client care. Yes. Evidence of care provided. Planning client care. Utilize legal document in a court litigation. Ang nakalagay kasi kay Kozer, yes, it is a legal document but not all the time should be used for court litigation. Okay? Tamang sagot is letter cat. Letter cat. Hirap no pag pag ganyan, ang daming ganyan sa board exam. Promise. A good example yung qualifications of your blood transfusion. Wala kayong mahanapan kung ano yung qualifications ng blood transfusion. Promise. Nasaan? Saan ko siya nakita? Public Health Nursing Book. Lumabas siya na NP1 ng board exam ko. NP1 board exam. Tapos nandun siya sa Public Health Nursing Book yung qualifications. As in, kapag naghanap kayo Red Cross, DOH, wala. Okay. Compliant with the standards is one of the characteristics of good documentation. Well, you will observe kasi talaga, most of the questions are coming from the book. By the book talaga siya. As in, ang dami ko na nakita ng mga previous board exam question na saktong-sakto yung wording niya. Okay, saktong-sakto yung wording niya. Okay? Madami bang SATA? Hindi ko na matandaan sa akin pero sabi nila, your SATA daw kasi. SATA daw previous board exam. Nandun na daw, tutuklawin ka na daw. As in, tutuklawin ka na kung ano yung tamang sagot kapag SATA. Tsaka most of the time, ang sagot daw sa SATA, all of the above. Obvious daw kapag may mali. Okay? Huwag na kayo magbasa ng Bruners. Huwag na kayo magbasa ng Bruners. Huwag na. This means, anong tamang sagot dito? Tamang sagot, letter cat. Okay, specified protocols are dutifully followed. Letter cat. Letter cat. Bakit wag na? Kasi it's too reality speaking, matatapos nyo ba siya? Yes or no? Reality speaking na lang, matatapos nyo ba siya? No. 'Di ba? No. You are, kumbaga nag-aaral kayo ng sobrang detailed. Okay? Sobrang detailed. Buti sana kung kayo, masipag kayo magbasa ng libro. Kaya nyo tapusin yung libro within 2 weeks. Sige, go, magbasa kayo. Pero 4 years kayo sa nursing school, nabasa nyo ba yung Bruner? Umamin kayo dyan. 4 years kayo nasa nursing school, nabasa nyo ba yung Bruner? Nabasa nyo ba yung Kosher? Diba? Yun. Diba? Kumbaga, gawin nyo, study-wise kayo dyan. Mag-study-wise kayo. Study-wise, sabihin nito, you study what is important. You study what is quick guide. Okay, quick guide. Guidebook. That is a quick guide. Okay, nandun na siya. Kung hindi nyo maintindihan yung guidebook, doon lang kayo tumingin sa Bruner nyo. Pero sabihin nyo sa akin na, sir, babasahin ka ba yung Bruner? Ilang pages yun? 2,000 mahigit? Hanggang ngayon, hindi ko pa nababasa buong Bruner. Kosher, hindi ko din nababasa buong Kosher. I won't recommend reading your Bruner Saunders. Yan. Public health nursing book, yes. I recommend that one. Reading it as in, isa puso nyo siya. Mabilis lang yan, wala pang 2 weeks, tapos nyo basahin yun. Yung white book, yes. Nandun kasi halos lahat ng mga NPs nyo. Drug handbook, B. Ano mababasa mo sa drug handbook? Kung ano mag-drug handbook. Mabasahin mo po ulit lang naman side effect, nausea, vomiting. Which of the following guidelines in documentation applies when you administering drugs? Ano recommend kong ibasahin? You go for a quick references. Okay, quick references yung mga guidebook, public health nursing book, Maglaya. Yan. Ay, wala dito yung isa ko pang libro. Meron si Udan na mabilis basahin. May Udan book na mabilis basahin, yung color yellow. Ganyan na siya kakapal. MS na siya lahat-lahat. Hindi naman lahat-lahat, pero nandun yung mga pertinent. Baka may PDF, wala nga akong PDF eh. Wala akong PDF noon. Hanapan ko kayo pag meron ako pag meron ako nahanap, share ko naman. As in, direct to the point yun. Which of the following guidelines in documentation applies when you administer the drugs? Tanong dyan, kapag pinipare ni nurse, pwede ka ba magbigay ng gamot? Pwede mo ibigay yan, yes or no? Kapag pinipare, no. Kapag kumari gagawin mo, binigay mo, di mo ba siya i-document? Di-document mo. Okay? Document that you administer. Di ba in the first place, ayaw mo nga magbibigay nito. Okay? Ayaw mo din magbibigay. Ang best answer mo dyan is letter cat. There must be existing institutional policies that must be observed in relation to this situation. That's the best answer to do kasi ang ina-expect kasi sa inyo sa board exam, book-based nurse kayo. Okay? Book-based nurse kayo. Okay? So, pinakamaganda mo sagot, letter cat. Nila, 26 years old, worker arrives in the ER clinic riding a Honda motorcycle. He is wearing a headset with MP3 player hooked to his belt. Neil is for hearing assessment. Ano yung pure tone audiometry is ordered? Ano bang para saan? Ang pure tone audiometry. Letter dog. Hearing acuity. Okay, hearing acuity. Yan ang mini-measure ng pure tone audiometry. 42. Neil was found to have mastoiditis. Which of the following ear structure is affected? B, kinakain ka na nung mastoiditis. Anong tamang sagot dyan? Nandyan na sa sagot mo, sa choices mo. Letter, yan na B. Letter dog. Wag na tayo mag-overthink. Mastoid air cells. Okay, mastoid air cells. Yung pina mo kasi outer ear. Okay, use chan tube, yung ear canal mo. Tympanic membrane, mas loob kasi yan, mastoiditis na yan. Which of the following is the most common cause of your mastoiditis? Ito, tatandaan nyo. Okay, tatandaan nyo. Ang kadalasan niya magsastart sa acute otitis media. Okay, acute otitis media. Tapos magkakaroon siya ng frequent occurring otitis media kaya siya magka-chronic otitis media. Si patient pasaway, hindi niya ipapatreat yung chronic otitis media niya. So ang tendency, mas papasok yung infection. Pupunta siya sa mastoid. Mastoiditis. So common yan is untreated otitis media. Letter boy. "44 antibiotics have limited use in the actual treatment of your mastoiditis because mastoiditis bone. Ang bone po ba nakakapag-penetrate? Ang antibiotic nakakapag-penetrate po ba? No. So letter cat. Antibiotics do not easily penetrate the infected bone structure of the mastoid. Letter cat. Letter cat. O, di ba? Hinabi na nga natin sa number 44, antibiotics. So, sasagutin pa ba natin antibiotics? Hindi na, B. Okay, tanggalin mo na to. Tanggal to. Tanggal to. So, which of the following is the most common treatment? According to Saunders, sabi ni Saunders, simple or modified radical mastoidectomy with tympanoplasty is most common treatment for your mastoiditis. Letter boy. Okay, letter boy. Letter boy. The nurse is reviewing for his admission exam for a prestigious hospital in Taguig City. He is answering questions related to eye disorders. A patient is due for tonometry. Para saan ang tonometry mo po? Tonometry. It measures your IOP. Anong normal level ng IOP? Normal level ng IOP 10 to 21. For confirmation of the following diagnosis of your glaucoma. Kapag may glaucoma ka ba, mataas or mababa IOP mo? Mataas, mababa, increase ang IOP mo. Okay, increase IOP mo. So kapag may mataas ang IOP mo, gusto mo ba tumaas palalo? Yes or no? No. Ano yung mga nakaka-increase ng IOP? Valsa maneuver po ba? Yes or no? Valsa maneuver? Yes. So kapag nag-cuff ka, nakakataas ba ng IOP to? Yes. Bending at hips. The hips. Yes. Try mo B. Squinting. Gumanyan ka. Mataas ba IOP mo? Yes. Correct answer. Letter boy. Breathing through the open glottis. 47, in the clinic, the school health nurse is conducting a vision screening to incoming grade 1 and grade 4 students. One of the students was able to read 10 feet, what a normal eye sees at 20 feet. She document this finding as, ano kayang tamang sagot dyan? Ano yan? Me before you yan, di ba? Yes or no? Me before you. Ano yung me dyan? 10. Ano yung you? 20. 10, 20. Letter apple. 48. A student nurse wasn't able to read the letters at 20 level. How should the nurse proceed with the visual assessment? O nag-visual assessment ka pa? Okay. Siyempre, wag mo muna document kasi nag-visual assessment ka pa. Okay. Allow the student to come nearer? Nope. Okay. Dito ka magtitira. Sabi po ni Wong, okay, kapag nagpa-squint ka, ay sabi ni Wong, mas maganda ipa-squint mo yung bata. Try. Ask the student to squint and try to reading level again. It is same as your pinhole occluder. Letter cat. Okay. Letter cat. Letter cat. 49. A nurse is performing admission assessment on a client with diagnosis for detached retina. Which of the following is associated with this eye order? Question, total loss of vision. Saan kaya mga common eye disorder, common ang total loss of vision? Glaucoma, yes or no? Glaucoma, yes. Pwede siya. Diba? Progression. Ano pa? Macular degeneration, pwede ba? Pwede siya. Pwede siya sa macular degeneration. How about your pain? Sa detached retina ba, masakit or hindi? No. Cataract, masakit or hindi? No. Saan siya common? Acute glaucoma, masakit or hindi? Acute glaucoma. Yes, acute glaucoma. Okay, acute glaucoma. Chronic glaucoma. Chronic glaucoma, pwede ba siya? Pwede siya pag nag-progress. Okay, progression, di ba it would start on your headache and then kapag nag-progress yan na hindi tinitreat, magkakaroon ng pain. Pero mas common sa acute glaucoma. Okay, sa mga close angle. Okay, close angle, sabihin ito sobrang sarado niya kasi may obstruction siya. Yellow discoloration of your sclera, anong tawag dito? Yellow discoloration of your sclera, icteric. Okay, icteric yan. Correct answer is letter apple. Ay, letter dog. A sense of curtain falling across the vision or field of vision. Common din po ba ang floater sa detached retina? Yes. How about your cataract? Anong common sa cataract mo? Yung cataract. Anong common na distinct characteristics ng cataract? Ito yung white. White. Cloudy appearance. Okay. How about si macular degeneration? Anong common kay macular degeneration? Ito yung merong loss of central vision. How about si chronic glaucoma? Si chronic glaucoma, meron tong so kami loss of central vision ka, meron ka bang tunneling of vision? Tunneling or peripheral vision lost. Next na po. Opo. The nurse is caring for a client with following enucleation. The nurse notes the pressures of bright red drainage on the dressing. Kapag bright red drainage, anong possible yan? Possible? Ano kaya yan? Bleeding po ba? Pwedeng bleeding? Pwede bang sign of bleeding? Yes. Arterial or venous? Bright red. Arterial. Kasi pag venous, dark. Diba? Dark. Correct answer, ino-notify mo ba si physician dyan? Kasi most probably arterial bleeding yan. Letter apple. Okay, letter apple. Notify the physician. In a PGH ear unit, the staff nurse is attending to several outpatients seeking for follow-up care. Okay. Next. The nurse assists in ear irrigation. Which of the following statements by the nurse is correct? Etong otitis media, di ba otitis media, it is an antibiotic treatment. Okay? Kadalasan po kapag ear irrigation, hindi mo na yung pag-lean to the affected or unaffected side. Okay? Hindi mo na tilt. Diretso lang yan. Kaya naman ni doctor yan. Okay? Correct answer is letter boy. The extreme, the irrigate at the sides of the ear canal. Okay? Letter boy. Letter boy. In administering your eardrops, the nurse observed which of the following exam principle. Kung nag-administer ka ng eardrops, why sa right ear ka nag-administer? Saan mo papaposition initially yung patient mo? To facilitate absorption, letter cat. Okay, letter cat. Pero kunwari, wala ka naman binigay na gamot. Saan mo encourage yung patient mo? Affected or unaffected side? Sa affected side. Okay, affected side. Paano naman kung patient mo nag-cataract surgery? Cataract surgery, saan mo siya ipapaposition? Affected, unaffected side? Sa unaffected side. Okay, unaffected side. 53, otosclerosis, a disorder of your labyrinth function, constitutes which type of hearing loss? Otosclerosis, ano bang involved dito? Middle, ay inner, ay outer, middle, or inner ear. It is your middle ear. Kapag middle ear, matik, ano meron sa kanya? Possible conductive hearing loss. Okay, kailan ka lang ba magsa-sensory neural or perceptive hearing loss? Kailan? Kapag inner ear. Acute otitis media. Okay, acute otitis media, ano kaya? Ito siya, oh. Yan. Kapag acute otitis media, conductive sensory neural. Conductive. Impacted cerumen. May nakaharang dito, B. Ayan, require malaki yung cerumen mo dyan. Conductive or ano? Conductive. Kung wari autotoxic medication. O autotoxic, maapektuhan ba yung dito mo? Yes or no? Yes. Sensory neural. Di ba ang ano mo, Meniere's disease, ito ang problem mo sa Meniere's disease. Meniere's disease nandito. Ano kaya ang Meniere's disease mo? Sensory or conductive? Sensory. Okay, sensory yan. Next, which of the following is a characteristic sign of your acute otitis media in children? Kapag acute otitis media or otitis media, masakit or hindi? Masakit. Okay? May relate ba yung awakening? Difficulty of awakening? Wala. Jumping in pain, B. Pag nag-jumping in pain ka ba, mas lalong sasakit yan. Feeling nyo. Try nyo tumalon. Yes, mas lalong sasakit yan. Correct answer is letter. Boy, ear tugging. Nilalagnat mo yung bata dyan, yes or no? Yes, nilalagnat sila dyan. Anong color ng eardrum sila dyan or tympanic membrane? Pink-orange. Okay, pink-orange. Ano normal color ng tympanic membrane natin? Pearly gray. Okay, pearly gray or pearly white. What makes children more predisposed to your chronic otitis media? Siyempre, shorter Houston tube and more horizontal. Okay, correct answer is letter dog. Okay, letter dog. Letter dog. Ano itsura niya, sir? Ito siya. Horizontal. Tsaka shorter as compared mo dito, biyang haba. Okay? Ayan siya. Addiction disorders are unnecessarily common in the modern lifestyle of Filipinos, especially with the rise of establishments selling products with caffeine. Because of various improvements in performance, this industry is still unwavering. Which of the following do not give or do not have potential of addiction if consumed frequently in large amount? Take note na mention yung caffeine. Okay? Chocolate flavored cola, may caffeine ba to? Yes or no? Yes. So addicting ba to? Yes. Okay, green tea, may caffeine ba to? Yes. Okay, bakit common cold preparation? Nakakaantok ba to? Nakakaantok, yes. Kasi addicting. Correct answer is letter boy. Apple juice. Apple juice. Caffeine greatly affects which part of the heart as reflected in an ECG? Tamang sagot. O, di ba caffeine, tendency mo mag-increase ba heart rate mo kapag nag-caffeine ka? Yes or no? Yes. Maapektuhan ba yung preload mo nito? Yes or no? Yes. Saan yung preload mo? Saan ka yung preload mo? Sa atrium. Letter apple. The nurse suspects caffeine intoxication in a young professional if he notes which of the following. Caffeine intoxication. Kapag, sabihin nito, isipin mo na lang na sobrang ka kunwari sa kape. Kapag nasobrahan ka sa kape, madaldal ka o tahimik ka? Kapag nasobrahan ka sa kape, madaldal, X mo to. Urinary retention o ihi ka ng ihi kapag nasobrahan ka sa caffeine. Diuretic po ba ang caffeine? Ihi ka ng ihi, X. Kamusta yung mukha mo? Namumula na ba? Namumula na ba yung mukha mo? Yes. Okay? Correct answer is letter Boy. Okay, letter boy. Ba't nangingitim? Ano yan? Ano? Nangingitim? Kakape, bakit? Allergic ka dahil. In the previous situation of the young professional intoxicated with caffeine, he suddenly was unable to take any caffeine source for 24 hours already. The nurse expect to note the following findings except, most probably kapag hindi ka nag-take ng caffeine for 24 hours na intoxicated, possible ba withdrawal? Withdrawal? Yes or no? Yes. Kapag sign ng withdrawal mo, masakit ang ulo mo, yes or no? Yes. Nausea, vomiting, pwede. And your muscle pain. Ang tendency kapag nag-withdrawal ka, irritability, not difficulty of swelling, difficulty of simulating. Ito yung mga common mo na signs and symptoms ng withdrawal. Dami sa akin kapag next na. Gina. The following are the reasons why many people abuse caffeine. Choose the exception. Tamang sagot. Nakaka-relieve ba ng fatigue to? Ba't ba kayo nagkakape? Nakaka-relieve ba ng fatigue kaya kayo nagkakape? Yes or no? Mamin kayo dyan. Yes. Increase mental alertness. Kaya ba kayo nagkakape kasi increase mental alertness? Yes. Kaya ba hinanap natin yung maling sagot? Yes or no? Yes. Di ba? Maling sagot hinanap natin. So, matic X din to. Correct answer natin is letter dog. Letter dog. You are the staff nurse at the neurology unit of the pediatric ward. You have patient for admission who has been diagnosed with bacterial meningitis. Which of the following type of isolation should you implement? Diba? Pag bacterial meningitis, ano yan? It is a droplet. Okay, droplet. Actually, I don't know kung bakit kapag may mga ibang tao, inaantok kapag, kapag umiinom ng kape. Example ng airborne mo, B. Airborne. Airborne. MTV, your measles, tuberculosis, and your ano yung isa? Varicella. COVID. Ang COVID mo ba, pwede ba siya makonsider na as your airborne? Pwede na ba siya makonsider? Yes. Okay, yes po. Next. The attending physician of Mr. MS who has cerebral palsy and seizure disorder prescribed your Tegretol XR for him. Master M has a gastrostomy feeding tube. The medication prescribed is on hospital's no crash list. Which of the following should you do in order to administer the medication? Ano ibig sabihin ng XR? Ano ibig sabihin ng XR? Ano kaya yan? Ano kaya sabihin ng XR? Ang XR ay extended release. Very good. Extended release. So most probably, hindi mo siya pwedeng i-crush. Okay? Hindi mo pwede i-crush yan. Okay? Pwede mo ba sa small pieces? Hindi po. Okay? Hindi rin siya. Okay? Dissolve in 30 ml juice. No, kasi parang mo to, kinrush mo na din. Ang pinakamagandang gawin dyan, refer ba kay doctor, tanongin mo muna si pharmacist. Pharmacist muna kasi mas alam ba niya kaysa kay doktor yung other forms. Yes. Okay, mas alam kasi ni pharmacist. Okay, kasi kapag nagsabi ka kay doktor, ang sabihin sa ni doktor, ano po bang sabi ni pharmacist? Okay, ano po bang ni-recommend ni pharmacist? Okay, letter, apple. You have been observed by your nurse manager when you gave an IV medication. You disconnected the flush syringe first and then clamped the intermittent infusion device. Which of the following would be most effective way to improve this nursing practice? O ano sabi ni Attorney Kapili B? Kapag nakita mo yan, yun na ba yung sasagot natin? Yes, di ba? Pag nakita mo ang evidence-based practice, yun na yun, di ba? Letter, apple. Letter apple. You have a newly admitted patient with bulging fontanelles, settings, sun eyes, and lethargy. Which of the following doctor's order will you question? Most probably ba increase ang intracranial pressure nito? Yes or no? Yes. Kaya ano yung ayaw mo dyan? Matik itong MRI, CT scan, hindi kasi press lang naman to. Arterial blood walang connect. Okay, bakit mo ayaw mag-lumbar puncture? Ano bang ginagawa kapag lumbar puncture? Nagre-release ka ba ng CSF? Yes or no? Kumukuha ka ng CSF? Yes. Okay, kapag kumuha ka ng CSF, saan siya pwede mag-lead? Saan? Sa possible brain herniation. Okay, letter dog. Your unit is reviewing a national sentinel events, alerts, medication, and preparing recommendation for the unit. Which strategy would help reduce medication error? Utilize only oral syringe to administer oral medication, yes or no? Most probably pediatric to, yes. Eliminate pediatric satellite. Kapag nag-eliminate ka ng pediatric satellite, may mapagtatanungin ka pa bang pharmacist na specifically for pediatric? Wala na. Okay, egis mo to. Okay. Increase the steps in the medical administration procedure. Kapag nag-increase ka ng steps, mas magiging komplikado ba yan? Yes or no? Yes. Egis mo din to. Ano na lang dyan yung walang 3? Correct answer is letter dog. Ay, letter apple. Sorry, 1 for 5. Apple. The intervention by a psychiatric nurse that implements the ethical principle of autonomy is when the nurse, letter apple, stays with the client who is demonstrating high levels of anxiety. Pwede ba itong fidelity? Fidelity. Nandyan ka lang. Letter apple. Pwede ba yun? Yes. Intervenes when self-mutilating clients attempt to slash her wrist. Do no harm. Non-maleficence. Yes. Okay. Correct answer is letter. Explore alternative solutions. Fullater chooses one alternative. Kasi you are giving him options. Okay, you are giving him options. Letter cat. Letter cat. '67. The nurse learns that the patient was admitted involuntarily. Anong reason ba't na-admit involuntary yung mga pasyente on the shift? What assumption could the nurse make about the patient? Bakit kaya? Most probably ba may threat to harm sila? Yes or no? Yes. Okay, tandaan nyo kasi sila na-admit involuntary kasi pwedeng self-harm or harm to others na sila. Okay? Correct answer is letter cat. Okay, letter. Kahit ba suicidal ideation, pwede ba siya ma-admit na yes or no? Suicidal ideation, pwede ba siya? Yes. Di ba may threat na ba siya saktan yung sarili niya? May ideation na siya. Okay? Pumapasok na sa isip niya, i-hurt yung sarili niya or mag-harm sa sarili niya. A may psychiatric nurse receive a call asking whether a certain person has been patient in the facility. How should the nurse respond? Pwede ba to? No. Letter apple states that he is unable to give any information to the caller. Letter apple. Letter apple. A patient is to receive your electroconvulsive therapy. ECT mo, invasive, non-invasive to? Invasive. So, kailangan ba ng informed consent dito? Yes. When nurse sees the patient has not signed the consent, which of the following facts should determine the action of the nurse? Verbal consent, pwede ba to? Verbal consent. No. Okay? I-witness mo ba ibang pasyente? In the first place, nasa psych ward to. Yes or no? No. Diba? No, yan, B. Permission is granted by the patient when he signed the admission form. No, magkaiba po kasi yung admission form as informed consent mo, pati sa ECT mo, since invasive procedure siya. X to. So, syempre, kapag nag-fail ka, makapagkaroon ng written informed consent, pwede ka magkaroon ng lawsuit. Letter dog. Okay, letter dog. 70. When the nurse is told by the patient that she consented to ECT out of fear being abandoned by her husband, what nursing action is required? Letter apple. Pwede ba yan? Mag-explain ka. No. Diba? Reassure the patient. Di ba hindi pinilit na nga siya? Tsaka hindi sound mind to si patient kasi mag-ECT siya eh. Reprimand. Papagalitan mo ba? Aawain mo ba yung asawa? Yes or no? No, B. Baka ano mangyari sa iyo pag inaway mo yung asawa? Diba? Right answer is letter cat. Document na lang talagang pinaka-best answer dito. Okay, letter cat. What other traits are expected in a client with paranoid personality disorder? Kapag paranoid ka ba, ano ka? May trust issues ka ba? Yes or no? Kapag paranoid. Yes. May paranoid. Suspicious ka ba? Yes or no? Suspicious ka. Yes. So ano meron dito? Takot ba siya na baka saktan siya ng mga person? Meron ba? Saktan siya ng mga person? Yes. Anong tamang sagot? Letter boy. Letter boy. He's afraid another person will inflict harm. 72. The client discusses current problems with the nurse. Which of the following interventions should have priority in the nursing care plans of the client? Anong tamang sagot dito? So, syempre, meron kang paranoid. Paranoid. Ano bang kailangan mong gawin? Ipa-realize ba sa kanya yung mga delusions niya? Yes or no? Na walang ganon. Diba? Say, walang ganon. Charot. Ano? Yes. Diba? Let him clarify. Diba? Yung thoughts and beliefs about an event. Diba? Para magkaroon siya ng clarification, kumbaga maintindihan niya na walang ganun. Na walang ganun. Letter C. Okay, letter C pa din talaga. Okay? You notice that the client has impaired social skills. Which of the following short-term goals is most appropriate for the client? Okay? Walang ganun. May ganun. Charot. Ano meron? Kailangan ba ma-develop yung insight niya? Yes or no? Yes. Diba? Identify the personal feeling that hinders social interaction. Bakit? Kapag naintindihan niya yung sarili niya, o kaya nakadevelop siya ng insight, mas makakapag-interact ba siya with other people? Yes. Okay? Yes. Letter cat. The client makes an inappropriate, unreasonable report to you. Which of the following principles of good communication skill is important for you to use? Kapag ganyan, inappropriate, unreasonable report, matter of fact ka ba dyan? Yes or no? Matter of fact. Yes. Okay. Matik, wag kang gagamit ng non-verbal. B. Use logic to address. Kasi anong nangyari dito? Kapag nag-logic ka dyan, feeling ba ng patient tinotolerate mo? Yes or no? Kasi hindi mo siya pinakailaman eh. Yes. Okay. Ano mas gusto mo? Confront or tell? B, yung confront kasi parang away-away yan. Okay, yung confront parang naaaway ka. Letter C ka na lang. Tell the client that you do not share this interpretation. Mabilis ba? Mabilis ba yung pacing ko or bagalan ko? Bilisan. Gusto na matapos, no? Napaghahalataan. Diba? Napaghahalataan, gusto na kumain. Gutom na. Di ako din gutom na. Last kain ko pa kayo ng umaga. Which of the following long-term goals is appropriate for this client? Tamang sagot? Diba? Meron siyang paranoid. Ano bang gusto mo kapag may paranoid? Makadevelop ba siya ng trust? Magtiwala sa mga other person? Di ba siya maging suspicious? Yes. Anong isang way nun? Sabihin ba makapag-cause ng social relationship? Yes. Letter boy. Letter boy. The ICU nurse assigned to a 6-year-old acutely ill client with Parkinson's disease who was hospitalized frequently. The initial confinement was due to electrolyte imbalance. The following confinement was due to injury sustained from fall. He became to have incontinent of stools that further lead to the development of skin irritation and breakdown. Currently, he was admitted due to respiratory infection. Related literatures include case situations similar to the case of the client. The nurse is interested in gaining further knowledge that can help the risk for fecal incontinence. The nurse should use which of the following? Kapag mga risk factors po kasi talaga, kadalasan yan, ano dapat kapag mga risk factors? Ano kaya? Anong gagamitin mo? Quantitative. Okay, quantitative research of method. Tandaan nyo, kapag experimental, may intervention ka ba dyan? Yes or no? Yes or no? Yes. Okay? Your qualitative and historical, most probably malito kasi halos same sila. Your qualitative, di ba, kadalasan why? Okay, mga why, yung sasagot. Gutom na talaga ako. Okay, qualitative yung mga why dyan. Okay, kaya mas papanigan natin yung quantitative. Letter dog. Okay, letter dog. Next, the review of literature does not only include published research studies, but also theory. In this case, which theory is least related to the study? Tamang sagot. Tamang sagot. Ano kaya? Letter C. Bakit, sir? Ang letter C mo kasi, ang components ng letter C mo ito, pure air. Pure air, pure water, efficient drainage, cleanliness, and light. Eh, hindi naman kasi masyado nakapag-affect yung pure water mo, drainage. So, ang mas magandang answer talaga, letter cat. Okay, Nightingale's environmental theory. Letter cat. 78. While the nurse was able to identify the cases that were studied, it is important to understand the phenomenological experience of the client. This approach includes the following except, okay, syempre dapat you get the whole picture. Okay, letter boy, yes. Pero tingnan mo, opposing answer ba sila ni letter C? Yes, opposing answer sila ni letter C. Letter C ang tamang sagot. Okay, kasi kapag get the whole picture, exploring the idea, okay, the same time interviewing the questions. Letter cat. Okay, letter cat. The nurse also reports multiple lumbar muscle strains. Thus, is also looking for the alternative therapies to reduce the pain. The client seeks advice from the nurse as to what type of alternative therapy would provide best pain relief. How should the nurse respond? Okay, kapag therapeutic communication, pwede ba ulit tayo mag-recommend? Recommend? Sa letter Apple, nag-recommend tayo use of acupuncture, therapeutic, non-therapeutic. None. Okay, this type of therapies are more than just therapies. They are really mind over matter. You disregard the patient. Okay? Some of the clients, magnetic therapy, nag-recommend ka, hindi yan therapeutic. B, letter dog. Okay, letter dog. 80, which of the following can the nurse use in protecting the safety of the subjects undergoing research study? Siyempre, gumamit ka ethic code. Yes. Nightingale, siyempre si Nightingale na yan. B, Patient's Bill of Rights and Human Rights Guidelines. Letter Apple. Apple. In the psychiatric ward, nurses are discussing the other factors that cause Alzheimer's disease, and they all agree that it's degenerative disease of the brain caused by gradual death and loss of brain cells, resulting from your progressive and irreversible dementia. Which of the following nursing intervention is most helpful in meeting the needs of an older adult hospitalized with diagnosis of your dementia of Alzheimer's type? Okay, hospitalized. Kamusta environment niya, bago or luma? Bago. At the same time, ano ba mas gusto ng mga pasyente mo? Simple or complex? Simple lang. May mention ba dito about the diet of your patient? May mention bang about diet ni patient? Wale, wag mo na tong tanggalin mo na to B. Okay? Alternative choices, gusto nga niya, direct to the point, wala masyadong choices. Okay? Take note, nasa hospital yung patient mo. Kaya mo ba maglagay ng fixed time schedule, yes or no? Kaya mo ba mag-fixed time schedule? No. Kaya, di ba ang hospital pa bago-bago yan ng mo? Correct answer mo is letter boy. Simplifying the environment as much as possible while eliminating the need for choices. Okay? Kasi gusto nila, bagong environment yan eh. So, mas gusto ng patient mo yung old style or yung dating environment. So, simplify mo na lang siya. Okay? Letter boy. The nurse recognized that dementia of Alzheimer's type is characterized by, ano kaya? Tendency nito, may hypoxia ba yan, selected brain tissue? Kapag may hypoxia yan, stroke ba yan, B? Pag hypoxia, pwedeng stroke to, B. So, X mo to. Common dyan, magkakasya ng senile plaques. Diba? Ang tendency ba kapag Alzheimer's type, nag-atrophy yung brain mo? Nag-atrophy yung brain? Yes. Okay, nag-atrophy yung brain natin. 83. A 75-year-old man with diagnosis of rare dementia has been cared of by his wife for 5 years. For the past 2 years, he has not spoken and incontinent of urine and feces. During the last month, he has changed from being flaccid to easygoing to agitated. He's admitted to the psychiatric hospital for treatment and psychopharmacology, which is the priority nursing care while this client is in the psychiatric facility. Tamang sagot. Ito, magpo-focus ba tayo kay wife or kay patient? Wife or patient? Patient, X mo tong CND. Ang tanong dyan, may na-mention po bang deterioration na nagde-deteriorate yung patient mo? Yes or no? May na-mention ba nagde-deteriorate ang patient mo? Wala. Okay. Ano ba, bakit ba siya na-admit? Kasi nag-agitate at aggressive siya. Okay. Tamang sagot, i-manage natin yung behavior niya. Okay. I-manage yung behavior niya kasi wala naman nakalagay sa situation mo na nag-deteriorate po siya. Letter, apple. When attempting to understand the behavior of an older adult diagnosed with vascular dementia, the nurse recognized that the client is probably not capable of using defense mechanism. They are capable. Anong defense mechanism kadalasan naman ng mga older adult? Ano kaya? Isa yan sa number 1, regression. Okay, matik to, X to. Okay, kapag regression, bumabalik ba siya on old familiar mechanism? Old familiar mechanism, yes. Letter cat. Letter cat. The nurse develops a nursing diagnosis of self-care deficit for an older client with dementia. Which of the following is the most appropriate goal for this client? Okay, kapag self-care deficit na may dementia, mababalik pa ba na yung self niya into original? Yes or no? Mababalik pa? No. Okay, kaya ba magawa ng older adult magawa lahat ng activities within 1 RB? Kaya ba? Hindi. Diba? Baka 1 hour, baka di pa rin tapos. We promote independence ba? Yes. The highest level of independence is letter boy. Boy, boy. You're the community health nurse in a municipality B where the incidence of alcohol among the youth is observed to be increasing. You want to have an advocacy called your alcohol watch. Which of the following would you invite to organize this advocacy? Tamang sagot. Guidance counselor, pwede ba tumulong sa'yo? Yes. Si Office of the Local Youth Office, yes. Yan yung sangguniang kabataan. Chief of Police and your Municipal Health Officer. Yan yung crucial. Correct answer is letter boy. Letter boy. Your advocacy will operate on the following principle. Tamang sagot. Diba, Alcohol Anonymous is a well-known and widely available self-help group for alcoholics in treatment and recovery. So self-help ba yan naka-ano? Yes or no? Yes or no? Naka-self-help ba yan? Yes. Ano ba yung sabihin ng self-help? Tutulungan mo yung sarili mo. And then, yung Alcohol Anonymous kasi by the ano yan, ang tendency niya, ikaw yung tutulong sa sarili mo. And then, hindi kayo magkakakilala sa alcohol group, then you would share your experiences. So, correct answer is letter dog. It focus on your self-help kasi rather than your group therapy. Okay? Letter dog. Alcohol Watch will have its aim for, ano kayong tamang sagot dito? Total abstinence. Kaya mo ba mag-total abstinence agad-agad? Yes or no? Kaya mo mag-total abstinence? No. Same ba to yung BNC mo? Total abstinence tsaka total withdrawal? Yes or no? Almost same yan, B. Okay? Same to. X mo to. Moderate withdrawal. Ano yung sabihin na moderate mo? Diba? Ang pinakamaganda dito is letter Apple. One step towards total withdrawal. Sabihin nito, unti-unti mo ba siyang tatanggalin? Yes or no? Yes or no? Yes. Kasi kung wala ng total abstinence or total withdrawal, ano mangyayari sa'yo? Magkakaroon ka ba ng withdrawal symptoms? Yes. Mas mahihirapan ka ba? Tanggalin yung alcoholism? Yes. Eh as compared dito, inuunti-unti mo siya. Common ba yan mag-withdrawal symptoms? Common pa ba magka-withdrawal symptoms? Unti-unti mo siya tinatanggal sa sistema mo? No. 89, you have a plan to have a seminar on legal implications of substance abuse. Which of the following members will be assigned to handle this activity? Legal implications. Kapag legal implications, mga ano to? Keron, police, chief of police. Si municipal health officer, anong pwede? Pwede ba mag-health education si municipal health officer? Yes. Withdrawal management, pwede ba si municipal health officer? Withdrawal management. Di ba? Expect mo possible mag-withdrawal management yan. Yes. How about si municipal mayor? Anong pwedeng gawin ni municipal mayor? Programs. City ordinances. Di ba? City ordinances. Si guidance counselor, pwede ba siya maging support? Support system? Yes. Okay? Yes. Which of the following is the most influence in the development of alcoholism among youth? Tamang sagot. Sino unang nagpainom sa inyo, B? Umamin. Si peer. Letter dog. Okay, friends yan, B. Saan ka unang nalasing? Barkada or sa family? Umamin. O hindi ka pa nalalasing kasi strong ang person. Ay, hindi ikaw na malakas. Diba? Hindi ka pa meron dito, hindi pa nalalasing. Anong broken hearted? Inom-inom ka ng ano iniinom nyo? Red Horse. Emperador. Pag medyo umangat-angat, pag estudyante, di ba? Pag estudyante, Emperador. Umamin kayo. Pag estudyante, Emperador. Gin. The Bar. Yan yung mga ano nyo. Di ba? Pag medyo tumanda-tanda ka na, pag nagkapera ka, ano na yung mo? Kapag medyo umano ka na, JD, pwede ka na JD, Blue Label, Black Label, Cuervo. Yan, kapag medyo may trabaho ka na. Pag tito ka na, ano pag tito? Alfonso. Umamin. Kapag tito-tito ka na, Alfonso ka na. 'Di ba? Kasi kapag estudyante yan, Emperador, kasi magkano lang yung long neck ng Emperador? 180. 'Di ba? 180 lang ata yung long neck noon, parang ganoon. In a nursing practice, you are directly involved in conducting a comprehensive physical assessment, especially to older clients. Tapos kapag estudyante ka pa, sa ano ka lang, sa mga dorm lang, umamin kayo kapag estudyante, sa mga dorm lang iinom. Kapag may trabaho na, magbabar na ba? Yes or no? Umamin kayo. 'Di ba? When formulating nursing care plans for older, ang The Bar, 300 lang yung The Bar, yung mga 300, 200. 'Di ba? 'Di ba ganun lang ang The Bar, yung The Bar pink, The Bar green. Ayoko ng The Bar gin yun eh. Nurse Trisha should include special measures to accommodate for age-related sensory losses such as kapag older adult, Hirap na ba sa lumunok, B? Yes or no? Hirap na ba? No. Okay. Increased sensitivity to heat. Increase or decreased? Increase or decrease? Ano mapapansin mo pag matanders? Ano? Kapag naligo, sobrang init ba ng tubig nila? Yes. Diba? Pero yung malamig na tubig sa kanila, tap water lang sa'yo. Letter cat. Okay. Diminished sensation to pain. Diba nga ang tendency nga, hindi nga sa'yo sobrang sakit na sa kanilang nga. Diba? Hindi masakit. The client with head injury is having problems with several sensory functions. Nurse Tricia should understand that the structure that acts as a relay center for sensory impulses is the tamang sagot, letter apple. How about your cerebellum? Ano yung cerebellum? Balance. Okay, balance and gait and coordination. How about your hypothalamus? Hypothalamus, BP temp metabolism. Medulla oblongata. Ano yung medulla oblongata mo? Respiration kadalasan. Okay, respiration. After brain attack, the client remains unresponsive to sensory stimulation. Nurse Tricia understands general sensations as heat, cold, pain, touch is related to your, kapag ganyan, ano kaya yan? Letter boy, parietal. Ano yung frontal? Frontal. Dito to. Ano to? Nag-iisip ka ba dyan? Yes. Diba? Emotions. Diba? Thinking. Broca's or Wernicke's? Broca's. Okay. Ang parietal mo, ito yung mga perception, senses. Okay? Yan siya. How about your temporal? Temporal mo, palagi ko nasa isip pag temporal nandito. Saan malapit siya? Dito. Ano to? Hearing. Tsaka Wernicke's. Okay. How about your occipital? Isa lang naman na occipital mo, B. Starts with letter O. Diba? Mata. Vision. Okay. Sabihin sa akin pag done na mag-screen cap. D. Next. And the novice nurse who is administering beta blocker asked the senior staff nurse about its effects of autonomic nervous system and formulating a response. The nurse should understand which common misconception about autonomic nervous system. Pustantahin, hinulaan nyo to. Sasagot nyo letter C. Letter C, no? Umamin kayo. Letter C. Okay? Saan tayo? Ako din naman, ayoko sagutin pag ganyan eh. Okay, although sympathetic impulses usually control most visceral effectors in the time of stress, parasympathetic fibers likewise stimulate increased gastric contractions and increased peristalsis. Sympathetic fibers also inhibit organs such as bladder and cause relaxation of this organ. Hindi nyo rin naman intindihan. Tamang hula lang. Letter C. Pag masyadong nakota ang letter C, ang susunod nyo, letter B. Letter B. Kapag masyadong maraming sagot na letter C, letter B naman sasagutin nyo. No? Number 95. Visual acuity declines with age. Presbyopia is progressive decline in kapag presbyopia, elasticity ng lens nawawala po ba? Yes or no? Yes. Yes. Ang presbyopia ba dahil sa age? Dahil sa age ba ang presbyopia? Yes. Okay? Kasi kapag nagka-presbyopia ka, nakita mo ba yung malapit na work? Yes or no? No. Tendency ba nilalayo yung cellphone? Yes. Okay, correct answer is letter cat. Anong difference ng presbyopia, hyperopia? Ano pinagkaiba? Presbyopia, hyperopia. Kapag presbyopia more than 40, na-diagnose yan. Kapag hyperopia, common, less than 40 yan. Okay? Eliza, a psychiatric nurse, respond in a variety setting different clients with personality disorder. Strict toilet training and too early trainings to toddler child will cause problems in personality development because at this child, the child is, Pag toddler autonomy versus shame and doubt. So, letter boy, hindi niya alam kung ano ba yung makakapag-satisfy in his own needs. So, kapag masyado kang strict, mas lalo ba siya makakonfuse, yes or no? Yes. Okay. On number 97, the psychiatrist orders restraints PRN for a client who has history of violent behavior. Nurse Eliza, should kapag restraints po ba, pwede ka ba mag-PRN? Yes or no? No. Okay. Matic unacceptable yon. Kailangan ba ng official order bago ka mag-restraint? Yes. Okay. Ang question dyan, ilang hours lang valid ang orders ng restraint? Ilang hours lang? 24 hours. Paano kapag magda 24 hours? Anong gagawin mo? Anong gagawin mo? Reorder. Pari-assess mo kay doctor kung kailangan pa ba i-restraint ni patient ulit. Okay? Kasi kapag more than 24 hours na yan at wala pa ring order, pwede ba yan maging false imprisonment? Yes. Kasi 24 hours lang po valid ang iyong restraint. Okay? 24 hours lang po. A client on the psychiatric clinic asked Nurse Eliza about psychiatric advance directives or PAD. The nurse explains that these advanced directives are, di ba tayo din naman sa ospital nag-advanced directives tayo. Kapag advanced directives, ito ba yung mga wishes or mga gusto natin treatment na gagawin sa atin at hindi gagawin? Yes. Anong tamang sagot? Letter dog. Allow the client while having the capacity to consent or refuse potential psychiatric treatments in the event of a future incapacitating mental health crisis. As depression begins to lift, a client asks you to join a small group discussion that meets every evening on the unit. The client is reluctant to join because I have nothing to talk about. What is the best response by the nurse? Tamang sagot? Or maybe tomorrow you will feel more talking. Suggestion. Could you start talking off by family? Suggestion. A person like you, ayaw mo din na to. Correct answer is letter dog. Restatement ba yun? Nagre-reflective statement ka ba? Yes. Para makapag-isip-isip siya. Okay? Bladder break ba tayo? Bladder break? Bladder break? Yes. So nyo, 1 hour. 1 hour. The nurse encourages a client to join a self-helping group after being discharged from a mental health facility. The purpose of having work in a group is to provide letter Apple support. Okay, Apple support. Questions? Yay, ano na? Meron akong white book na PDF. I sent already. I sent na ako, B. Sige, try natin. Wala, ayaw. Ayaw. Try ko. Nag-send na ako, oh. Wait lang. Message mo na lang ako, ma'am. Hindi ko makita. Message mo na lang ako. Hindi ko makita. Questions? Message mo na lang ako, ma'am. Instagram or Facebook? In test banks online. Pwede yan. Pero hindi mo kasi sure. Message ako ng mga person na walang ano. Message po ako. I'll try to reply today, ha? Walang assurance kasi babiyahe ako pa Manila. Okay? I'll try to ito yung IG ko. Try ko mag-reply today or tonight. Babiyahe kasi ako pa Manila. Oh, thank you po. Sir Pence rin. Pengi. Message me on Facebook or mas maganda Instagram kasi mas maka-reply ako. Thank you so much. Questions. I'll entertain question. Total maga naman natapos. Kahit random questions yan, sige lang, go lang. Kasi hindi ata ako ang pre-boards 1 nyo. Hindi ko sure kung kailan pa tayo mag-ano. Hindi ata ako pre-boards 1 nyo eh. You tend to overanalyze. Ito yung mga tips ko when it comes to overanalyzing. Always, always, always stick to what is. Yan po. Okay? Stick to what is asked. Okay? Ano ba yung tinanong? Kapag nasa choices, wala doon, kumari letter apple, kumari ang tanong lang about kay patient, tapos lumabas family. Tanggalin mo yon. Okay? Tanggalin mo yon. Tanggalin mo yon. Okay? Yun ang ano mo. Skincare routine reveal. Di ba na-reveal ko na yung ano ko, B? Yung skincare products ko, B. Di ba? Maniwala ako sa inyo. Hindi ka umattend, no? Alam ko nag-skincare reveal na ako. Oo. O, na-reveal na, sabi ko sa inyo eh. Na-reveal na, B. Ulit, halaka. Sige, ulitin natin. Ano pa ba yung ano? Study routine ko, kadalasan kasi nag-ano na ako. Ang tawag dito. Focus talaga ako mag-aral eh. O itong BO, ito na. Talaga itong mga to. Oh. Ala ka, nahulog pa yung phone ko. Oh. Ala. Ano tawag dito? Facial wash, toner, Lux, Celetec. Tapos, serum ko niacinamide apothecary 10%. Mura lang to, 500 lang. Sale pa sila 420 ngayon. 420 lang to ngayon sa Lazada. Moisturizer ang tawag dito. Yan, mas gusto ko yan kasi moisturizing effect yan. Taka hygienic to, ayoko ng tab kasi hindi siya hygienic. Sunblock, Lux Organic. No, it's not ang tawag doon, hindi siya acne prone. Sa acne prone, pwede naman. Age ko, ilang taon na ba ako? Wala nyo, ilang taon na ako. Eto, may nagtatanong sa akin. May nagtatanong, ano daw average board rating ko? I don't usually reveal, ever since na naging lecture ako, I don't reveal my board rating. Bakit? It would add up anxiety to students. Kailan na kapag natanong lowest highest NP ko, it would add up anxiety to the students. So, sabi ko nga, pag may isang student lang na nag-ayaw na mag-reveal ako ng board rating ko, hindi ako mag-reveal. 'Di ba? Kasi it would add up anxiety to the students. So, ako kasi, I'm a believer na pag pumasa kayo ng board exam, yun yung importante. Okay? Yung importante pag pumasa kayo ng board exam. Yeah. Hoy, ang taas ng mo na yan. Ang tawag dito, ang taas ng range ng score mo dyan, ma'am. Ma'am Nai Katerina, ang taas ng range mo na. Any advice? Focus on what is your weakness. Focus on what is your weakness. What are your weakness? Kung baga weakness mo, PIDYA, mag-aral kang PIDYA. Parang alam mo yung tamang sagot, pero mali naman pala. A good example, ang common kasi to the board exam is HOTS. HOTS yan. High order thinking skills. Sabihin yan, you need to think of things kasi. The same time, comprehension. Isa sa mga ng comprehension. Okay, comprehension ang kailangan mo dyan. Kasi may mga other terms talaga na siya. I really don't know how to compute when it comes to the board exam. Okay, I really don't know kung paano mag-compute sa board exam. Basta ako nagsagot lang ako ng tanong, then ayun, umasa naman. Ganon. Hindi ko kasi masabi na kung ilan yung score mo, yun lang talaga. Hindi ko talaga alam. Okay. Recommended po ba? I won't recommend NCLEX books. Okay. I won't recommend NCLEX books. Okay. Dapat po ba makapasa? Yes, at least 60%. At least nga 75 para average mo 75. No grades lower than 60. Okay, no grades lower than 60. Nag-memorize po ba kayo nun? Nag-memorize ako, yes. But when it comes, for example, RA, Republic Act, I don't memorize Republic. I didn't memorize the Republic Act. How about Top Rank's book? I recommend Top Rank book. Siyempre, ako nag-edit na, recommend ko yan. Yes. Yes. Okay. Pass po, sir. Pass pa 60. When it comes to the board exam, 75 kasi. Okay. Recalls kasi, okay. Pag nag-pre-boards, pag sa akin kayo nag-pre-boards 1, i-reveal ko sa inyo yung pre-boards 1 scores ko. Kung sa akin kayo mag-ano. Pero sa recalls kasi we don't have recalls. Okay, we don't have recalls exam nung time ko. Kaya hindi ko masasabi sa inyo kung ano. Okay, and meron lang kami nung time ko. Pre-intensive boards, pre-boards 1, 2, 3. Okay, pre-intensive boards ko nasa ano lang, below 60 lahat. Below 60 lahat ng scores ko, pre-intensive. Wala akong 60 nun ang alam ko. Yeah. Yeah. Nanggulat kayo. No intensive secret. Siyempre, hindi pa ako nagpi-pre-boards. Hindi pa ako nagpi-pre-boards eh. Pag pre-board secret, pag nag-pre-boards 2 kayo or pre-boards 3 or pre-boards 1, alam ko kasi hindi kayo sa akin eh. Ang ratio day namin ng pre-boards 1 is 17 to 20. April 17 to 20. Ang pre-boards 1. April 17 to 20. No. Wag yung score na yan. Masyadong ano. Basta nag-i-improve yung scores, so go lang. Binibigay lang kasi sa amin yung load eh. Binibigay lang sa amin yung load. Tapos, umuoo lang ako pag binigyan ako load. Kailan first pre-boards? Alam ko start na April 15. I really don't know kung zero-based ang board exam. I really don't know. As in. Diba? Di ko rin alam kung paano mag-scoring ng board exam. Promise. That's okay. As long as you're improving. As long as you're improving, that's okay. That score. Actually, okay yung score na yan. Okay yung score na yan. Kino-compare niyo yung sarili niyo sa ibang tao. No? Don't compare yourself to other people. 1250, I'll leave that 1250. Pre-test and post-test. Ano ba kayo? Bagsak din ako palagi ng pre-test post-test. Hindi nga ako nagta-top 10 ng pre-test post-test. Eh. Di ba may top 10 yan? Diba? Diba? Test-taking strategies. One of the things is, number 1, do not overthink. Number 1, do not overthink. Kung anong tanong, yun lang sagutin nyo. Okay? Number 2, when it comes to the exam, ang strategy ko nun, sagutin ko 1 to 100 sa questionnaire. And then, doon ako magta-transfer. Anong ginagawa ko para matanggal yung kaba ko? Aral. And never ako nag-compare. Okay, aral. And never ako nag-compare. CHN. Message mo ako sa CHN. Meron akong table ng CHN. Pero dati pa yun eh. May table ako ng CHN. Wag antokin sa review. Spoil yourself. Spoil yourself. Be more, okay. Be more, spoil yourself. Ano yung kung saan ka magigising? Kape reveal. Ano bang kape ko ng board exam ako? Mini stop coffee lang. Alam niyo yung chills ng mini stop. Yun lang. Yun lang. Yun lang inaano ko. Oh. Payo sa nape-pressure, never compare yourself to others. Alamin mo kung bakit ka magbo-board exam. Nagbo-board exam ka para sa sarili mo, hindi para sa ibang tao. Tanggal na lahat ng pressure. Paano ma-cover lahat ng study? Well, acceptance is the key when it comes to covering all your studies. Kasi never mo matatapos ang board exam. Never mo matatapos pag-aralan lahat ng board exam. Kasi pagdating mo sa board exam, meron at meron ka doon topic na hindi mo na pag-aralan. Okay? Kaya nga, di ba sabi nila, mas maganda na madami kang balang dala. Okay? Pupunta ka sa board exam na marami kang balang dala. Hindi kompleto yung dala mo. Kasi hindi mo alam kung anong war ang pupuntahan mo. Okay? Alam mo lang kung anong ano. For example, ng board exam ko, ang board exam namin, ang topic is Palmer plus OB na ER. Okay? Yung tatlong yun. Palmer, OB, ER. Magkakasunod. Ilan na NP2 namin, Palmer ER OB, pinagsama silang dalawa. So kapag nag-ES, prioritization, may OB palagi. Ganun yun nangyari sa amin. Okay. Question pa. Hindi ko ina-adapt yung anxiety nyo, but more of, mas maging kayo. absorb lang na absorb ng ano, knowledge. Absorb lang ng absorb ng knowledge. Para pag nawawalan ng gana, then find something, bakit ka nga ba mag-board exam? Number one thing to do yan, bakit ka nga ba nag-board exam? Okay? Ba't ka nag-board exam? Nag-board exam ka ba kasi peer pressure lang? Or nag-board exam ka kasi gusto mong pumasa? Diba? Now, if you're nag-board exam ka lang dahil sa peer pressure, maybe you're not yet ready to take the board exam because hindi mo alam kung bakit ka mag-board exam. Ang hirap kasi noon, if you were depending to people na, nagde-depend ka lang kung bakit ka nag-board exam dahil gusto na ng magulang mo. Pero ikaw sa sarili mo, hindi ka pa ready. Diba? Then there's something wrong. There's something wrong kasi mag-board exam ka kasi ikaw lang ikaw gusto mo siya kaya ka mag-board exam. Hindi dahil gusto na magulang mo, hindi dahil mag-board exam na yung mga kaibigan mo. Okay, mag-board exam ka dahil sa sarili mo, dahil gusto mo. Okay, kasi at the end of the day, sarili mo lang yung kasama mo sa board exam. Hindi mo kasama yung pamilya mo, hindi mo kasama yung kaibigan mo. Sarili mo lang yan. At the end of the day, pag nag-board exam kayo, walang pake yung mga kaibigan mo sa UB. Okay, walang pake sa yung mga kaibigan mo. O, wag muna kayo mag-NCLEX. Pagsilbihan nyo muna yung bayang Pilipinas. Wag muna kayo mag-NCLEX. Pagsilbihan nyo muna ang Pilipinas. Okay. Hindi mo siya nakakalimutan. You're just trying to apply it. Okay? Sabi ni Sir Dakan, sige mag-NCLEX na nga kayo. Unahan nyo pa ako. Pero hindi ako mag-NCLEX. Wag muna pagsilbihan nyo muna yung Pilipinas. Tapos kapag ready na kayo, mag-NCLEX na kayo sa top rank. Diba? Ganun yun. Okay? O, alis na ako. Message lang yung may mga concerns. I'll try to answer you kapag may mga messages. Okay? I'll try to answer my best. Total, wala naman ako ano. Hindi tayo mahal ng Pilipinas, gano'n naman tayo. Minamahal natin yung hindi tayo mahal. Tama, mali. Diba? At least, pinilit nyo mahalin yung Pilipinas. Diba? At least, pinaglingkuran nyo siya. Diba? Sir, need ba confident? Yes, you need to be confident when taking your board exam. Be confident. Okay? Kasi sarili mo lang yung kasama mo. Okay? Sarili mo lang kasama mo dyan. Okay? O, sige, bye-bye na. Enjoy your Holy Week na. Enjoy your Holy Week. Huwag kayo masyadong magpaka-aral dyan, promise. Para hindi kayo mapagod. Okay? Iwas pagod. Kaba is normal. Mild anxiety is normal. Pero panic ay hindi. B. Okay, kapag naka-experience kang panic, kalmahin mo yung sarili mo. Umalis ka muna sa situation na yun. Okay, mild anxiety is normal. Okay, thank you. Bye.